I'm going to call this meeting to order, work session, and I'm going to read the public charge. So the Board of Commissioners asks its members and citizens to conduct themselves in a respectful, courteous manner, both with the board and fellow citizens. At any time, should any member of the board or any citizen fail to observe the public charge, the chair will ask the offending person to leave the meeting until that individual regains personal control. Should the quorum fail to be restored, the chair will recess the meeting until such time that a genuine commitment to the public charge is observed. So we are going to get started. We have a very, very packed agenda today. And I am going to really ask the commissioners and anyone else that's presenting to really be committed to the time allocated in order for us to get through this packed agenda today. I will do my best to keep us on time, not to offend anyone, but if I ask you to end your conversation, please be courteous and let's do that, because otherwise we won't get through this agenda today. Okay? So the first item is we have citizen comments, and we have 30 minutes allocated for citizen comments today. And I have one person that's signed up, Sharon Hunter. Yes, ma'am, if you will go to podium and give your name and address.
I'll be brief. This situation started in February of 2020 with my neighbors trying to criminalize my son's mental health status. In December of 2020, I wrote the district attorney asking what's the basis for this amount of restitution that seemed random and arbitrary because there was no actual damage. I hired 3 different lawyers. The charges were dismissed on February 10th. We were told to go to the clerk to request a refund on February 13th. We were sent to bookkeeping. We went to bookkeeping. The person says, oh, well, that money was paid out in 2021 with no basis in the beginning, no matching to charges because the charges were dismissed. And we were following instructions of an officer of the court. We could and would have paid the money into escrow if we thought it would just vanish that way. I left a message for the clerk of courts on the 13th. I left another one on the 23rd of February, no response. I emailed the county manager on the 13th, no response. The real issue, I've already touched on it, is we were following the instructions we were given. If there was an inability to account for the money, it could have been paid into escrow, and we would have known precisely where it was. My ask of the commission, one last thing. On the 13th, the bookkeeper sent us upstairs to the district attorney's office as if I would be afraid to go up there and ask the same question. Somebody in the district attorney's office said that there is a form that can be completed to request a refund of the money. And my ask of the commission is if you can just help me find the form, I can fill it out, I can get a lawyer to fill it out, but this process of keep away is disturbing and distressing. And I've written all of you before, so you've had communications from me. Probably the last communication I sent to all the commissioners electronically, I'm going to call it mid-October of 2021. I sent a hard copy to the Commissioner Howerton because she was the chair. And I did get a response back from Commissioner Jacobs, so I know people are aware of the details, the backstory.
So thank you, Ms. Hunter. And this is a tax situation, is it not? Okay. Okay, so we will have staff follow up with you on whatever this issue is. I'm not clear what it is that you're asking, but we will have staff follow up with at a later time. Thank you. All right. Monica, did we have anybody online? Is Commissioner Alam online? Okay. All right. We are moving down to our consent agenda, and we will have a manager go through our consent agenda, and if there are any items that commissioners are unclear with, that they need to discuss. Commissioners, again, and I know Commissioner Jacobs just got here, we're going to stick to the 3-minute rule for commissioners as well today. If you have questions, and if you can't get all your questions answered, we'll follow up with emails to the departments to get them completed. Does that work? Okay. All right, thanks. Go ahead.
Thank you, Madam Chair. Good morning, everyone. We'll start with agenda item 230044, Budget Ordinance Amendment Number 23BCC00059, Public Health, to recognize $44,125 from the NCDHHS Division of Public Health Epidemiology Section, Communicable Disease Branch, to create an additional grant-funded disease intervention specialist position.
Ms. Jacobs?
I just have a request for follow-up information. We had several years ago, oh, you don't have to do it now. It's okay. Yeah. Thank you, Rod. We had funded an HIV navigator a few years ago and signed on to the Paris Accord to end HIV/AIDS, and I just wanted to see if we could get updated data related to our HIV rate in Durham County and just how we're doing with that and other communicative diseases. Thank you.
Okay. We will follow up with that information. Item 230045, Budget Ordinance Amendment Number 23BCC00060, Public Health, to recognize $3,567 from the NCDHHS Division of Public Health Women, Infant, and Community Wellness / Reproductive Health Branch to purchase family planning methods.
Commissioner Alam? You have a question on this item? Can you get her online? Okay, she texted me now. She said she don't have a question. So move on. Go ahead.
Okay. All righty. Item 230046, Budget Ordinance Amendment Number 23BCC00061, Public Health, to recognize $500 from the Center of Black Health and Equity for the Men's Health Council. Okay. 230048, Budget Ordinance Amendment Number 23BCC00062, Public Health, to recognize $83,913.13 from the Duke University Health System for the Partnership for a Healthy Durham Program.
Commissioner Carter?
Yes, thank you. Partnership for Healthy Durham, such a strong program. I was wondering if we could get some follow-up information about the CIP trainings that are mentioned as one of the areas that will be receiving funding. I'd be curious to know a little bit more about that. Communities in Partnership, I believe, is what CIP stands for.
We will do that. Okay. Thank you. All right. 230052, Contract Approval of Matthews Specialty Vehicles Contract Supplement for new Public Health Mobile Medical Unit totaling $16,460. Vice Chair Jacobs.
Yeah, again, you don't have to get up, Rod. Anyway, this is very exciting, and I know it may take a while to get the vehicle, but when you all get it, would love for our board to just get a report on what the plan is for the mobile unit. Thank you.
Great. 230098, Budget Ordinance Amendment Number 23BCC 00068, appropriating $250,000 of general fund balance for the Durham Youth Home to offset higher than expected use of out-of-county facilities. Commissioner Carter.
Commissioner Carter?
Yes, thanks. I just want to take this chance to say how frustrating this is. I'm sure everyone agrees. You know, we're spending a lot of money to build a brand new youth home, and so we don't have to send youth out of county. I recognize the challenges from COVID and et cetera, but this just makes me want to recommit to, you know, phasing out the placement of youth in our youth home, to do everything we can in our community to prevent youth from needing to be placed in a secure facility like this. And you know, at some point, it'd be great to have a real discussion on this and have a plan for how we might get to 0 youth placed in youth home in Durham. Thanks.
Jacobs?
I just wanted, this is just request again for follow-up information. Just wondering how many youth are being sent out of county, for how long, and how it's impacting visitation with families.
Okay. 230099, Durham County Sheriff's Office contract approval with Tech 84 Inc. in the amount of $141,462 to purchase a body scanner for the Durham County Detention Facility.
I just want to say I think this is great. Gudrun and I had the opportunity to actually see one of these recently when we went to Bexar County, Texas, San Antonio. We went to they have a jail annex where they actually divert everyone to first see if they need mental health treatment, diversion. They meet with the DA and the public defender before anything happens, even before going to a magistrate. And Gudrun was the person who volunteered in our group, our national group, to actually be the person who got scanned. And it's really going to help a lot. So I'm really glad that we're doing this. This is a national best practice.
Commissioner Burns, did you have your hands up, or were you just, okay. Good, okay, all righty. 230109, Capital Project Amendment Number 23 CPA 00017, reducing the roofing replacement capital project 4190 DC 073 by $300,000 and increasing the parking lot resurfacing capital project 4190 DC 074 by $300,000 to cover unanticipated cost increases. 230111, 2022 Annual Report, Durham Bicycle and Pedestrian Advisory Commission. Okay. 230113.
I just didn't know, was anyone here from BPAC?
No, they just sent the report.
Ellen,
On the Zoom, okay.
did you have something that you want to say, Ellen?
We actually didn't intend for this to be a discussion item. We submitted the report for you all to read, but if you have questions, we can certainly respond to them.
No, I've gone through the report. I don't have any questions.
Okay, well, I guess if there's a rep on the report, I really just wanted to express gratitude for the incredible work. And Commissioner Carter, I know you're the representative to that. The list of all of the work that this commission has done was really incredible. And I also want to lift up the fact that we have had so many bike and pedestrian fatalities and accidents in Durham. This is a really, really serious concern. And I know the MPO got a federal grant, Safe Streets grant, but we really have to work on this. You know, we have a Vision Zero plan, and we are failing here in Durham. So I just wanted, this is a health and safety issue. But I really just wanted to lift that up and also encourage the BPAC members to be involved in the 70 study, and that's happening right now. Good. Okay, great. And I was very interested in the fact that Raleigh has now included in their UDO separate bike lanes, protected bike lanes being included in all developments. So and maybe you know, Commissioner Carter, where are we at with that? Because that's a really great idea. And how do we do that? So I guess I'm asking you or somebody from BPAC.
I'll get back with you later on that.
Okay.
Commissioner Jacobs.
Okay.
Okay, thank you, Commissioner Jacobs. Moving on to 230113, approve an amendment of $15,744.96 to the West Staff staffing contract to continue the contracted services for countywide IT-related training assistance, increasing the total contract amount to $53,880.96. 230114, authorize the county manager to enter into a $83,500 contract with Infotech Group. 230115, authorize the county manager to enter into a 3-year contract with Carasoft, a technology reseller, in the amount of $271,578.95. Vice Chair Jacobs said something.
This sounds really innovative and interesting, and wondering, will this also impact residents, or it will just be internal for staff?
I'm not sure if we've identified if it will include residents. I do know it is a software that can help us identify how we can make community engagement more efficient, but I'm not sure if we have a specific plan for that yet.
Just thinking about the results from the community survey and some of the areas that were identified for improvement, and wondering if it could help us.
And if we find that we already have a specific plan, I will certainly follow up, let you know. All righty. 230116, Durham County Sheriff's Office grant adjustment modification with the Bureau of Justice Assistance, BGA, for the 2019 Edward Byrne Memorial Justice Assistance Grant JAG. 230123, Board of Elections Equipment Purchase Request.
I got one.
Yes, ma'am.
See, I told you I did my homework. I only have 3 questions today. And I see, hey, Derek, how you doing? I see that from the links that I clicked on, it looks like we are going electric. Looks like we are going to be able to do push buttons. So 2 kind of quick questions, and maybe I'll get follow-up. When will we get these 70 back, and what kind of education will we be doing around them? And did I just look at the picture wrong?
Thanks, Commissioner Burns. So
I mean, it's exciting, so congratulations on
it is. So I've got actually an ES&S representative here with us today to answer any questions regarding the machine, but I can give the quick rundown. So these 70 machines, Durham County will remain a paper ballot county. I want to make that clear. The machines that we're purchasing were first manufactured, I believe, in the late 90s. We bought in 2007, I believe. So they've definitely reached end of life. These are ballot marking devices only, so they're our ADA compliant system. So they would allow touchscreen. There's an audio option. So basically, it's an upgrade to the AutoMark voting system, which the county has had for multiple years and is well beyond its life cycle. So those 70 units will replace the 66 AutoMark units, and they pair with the DS200, which is the precinct tabulator that we currently use.
Right.
But I can let the ES&S rep give a little bit more details if
No,
you'd like.
not unless you really want to. My only question, which was the last one, any back order issue?
I'm sorry, any
Is there any
order?
back order issue?
No, ma'am.
That's all I need.
Readily available.
Okay. See, I'm easy. Congrats on the new machines. I can't wait for folks who might be seeing or hearing impaired to be able to utilize these. Thank y'all.
Yes, and on training, you did mention training, Commissioner Burns. We will definitely do some, try to do some community events where folks can come in and test out the units
Wonderful.
if they'd like.
Thank y'all.
Is that it? Thank you all so much. Moving on to 230126, Budget Ordinance Amendment Number 23BCC 00066 to recognize $5,107.10 in grant funding from the North Carolina Department of Public Instruction's Child Nutrition Program for the Youth Home. 230136, contract approval with SHI International Corp. in the amount of $259,824.51 for licenses and services for the enterprise agreement with Microsoft for the Office of the Sheriff. Budget Ordinance Amendment Number 23BCC 00073, Public Health, to appropriate $293,776.39 in general fund balance to provide additional funding for grants awarded in FY 2021-22. Budget ordinance, 230144, Budget Ordinance Amendment Number 23BCC 00072, Public Health, to recognize $4,820 from the NCDHHS Division of Public Health Epidemiology Section / Communicable Disease Branch for active TB disease screening and treatment. 230148, Budget Ordinance Amendment Number 23BCC 00070 to recognize $53,664 of a grant award to the Criminal Justice Resource Center's Local Reentry Council and to authorize the county manager to sign and execute the subaward agreement between the City of Durham and the Criminal Justice Resource Center.
Mr. Jacobs?
Yeah, I really just wanted to lift up this item and the next one. This is so exciting. I think the 53,000 doesn't give enough credit to the whole item because it's really about a bigger package of over $600,000 that the city is providing to CJRC, and I'm just so excited about the collaboration between the city and the county with ARPA funding, that we are helping each other with things. This is a great example of that, reentry housing. And also, I wanted to ask if, I love the data that's being tracked. I think this sets a great example as well. And if it's possible for us to also get whatever reports quarterly or whatever they are, if they could also be shared with us as well, because this is very exciting. And then the next one is about the peer support network, and this is a national best practice. So kudos to CJRC staff.
Great. Thank you, Vice Chair Jacobs. So we'll go ahead and move to 230151, Budget Ordinance Amendment Number 23 BCC 00069 to recognize $25,000 in additional funding from the North Carolina Department of Adult Correction, NCDAC, formerly part of the North Carolina Department of Public Safety, NCDPS, for the Durham Local Reentry Council. 230156, approve capital project amendment number 23 CPA 00019 and budget amendment number 23 BCC 00071, decreasing the open space and farmland preservation capital project 4730 DC 083 by $142,500 and transferring $142,500 to the general fund to support the purchase of the second phase of the Alston Glen Farm Conservation Easement, as well as approve the final budget for the Alston Glen Phase 2 Farm Conservation Easement.
Commissioner Burns?
This is number 2. So, I just want to say thank you to staff for being creative enough. We all know, whether y'all agree with me or not, land is the one thing God ain't making no more of. And when we think about land ownership, especially for in the African American community, it's getting taken up each and every day. And I just want to say thank you to the staffers, because I remember when y'all bought Phase 1 to us about this centuries-old farm, and I appreciate the fact that we're moving along with Phase 2. And I want to say thank you to my board members for recognizing how this is something that's important for us. So it's just a huge thank you and a congratulations to the Glenn family. And as projects like this come up, as we can help our farmers or our landowners in Durham preserve what they have, please continue to bring us items like this.
I just want to echo what Commissioner Burns said, and I noticed that you're partnering with NCCU on some type of a documenting the history of the family, and I would just encourage, and I know Commissioner Lom is our liaison to the History Museum, but it would be really cool to see an exhibit focusing on the family. And also, I don't know if you're looking for any In Touch with Durham County episode, Deborah, but it would be neat to do something on this as well, because it's really an amazing what's happening there. Thank you. And I don't know if you have any response. I see.
Sure. Yeah, I just wanted to mention that the last time when we brought Mr. Day's second phase to the board to y'all for approval, the board had really commented on how historically significant the ownership of these African American families who have managed to maintain their farmland during really, really difficult times. And you all were struck by the significance of that. And so we are partnering and reaching out to NC Central. They have a public history department, and in collaboration with them and their chair of the public history program, we have a graduate student who, through an internship with us, is preparing oral histories with Mr. Glenn and Mr. Day and Clara Glenn. And then as part of the oral histories, they're also going to be creating a short documentary. So that will be done maybe at the end of the summer. We actually met this past weekend to kind of do an overview with the families and get their concurrence that they were willing to have their family histories captured. So we're really excited about it because it helps to tell the part of the story that it's about the farms, but it's also about the families. And so I just want to mention that it was you all that really planted that seed, that this was really something we needed to capture. So thank you.
Commissioner Carter?
This is all just getting me excited. I'm trying to sit here quietly as you admonished us, Chair Howerton. But boy, our open space and that department, can't even think of the real name of it right now. But you are a small but mighty team. And Celeste Burns is sitting back here too. And I feel like, Celeste, you really bring the passion that helps continue to make this about the families, not just the farms, which we're so glad about the preservation of the open space. But this personal focus too is it's just heartwarming and incredible. So thanks. Just wanted to say that.
Okay, thank you. Thank you all for that. Moving to 230157, approval of the contract to purchase the Enterprise Inc. Streetwise MBA program in the amount of $57,000.
Number 3.
Yes, ma'am.
So I won't pull anybody. But I did want to ask. I looked at all the material. Of course, there's a train coming through now. Okay, so one, congratulations on purchasing any curriculum that will help, some of our small businesses. As we all know, a lot of programs that are out there right now are for-profit programs, and it's really hard for an entrepreneur to sharpen their saw around their finances, around compliance, because they are, in fact, the small business trying to run a business. So I do appreciate this type of investment, because as people pivoted in the pandemic, we want them to be able to keep what they have. What I would love to know, because I saw that it said 39 weeks. Whoever can come back, I don't know, and maybe we throwing this into Tammy's lap because it's new, or you got it, or Shannon, because I saw Shannon was a research person. I want to know how we're going to roll it out. I would love to know how many people, and what does 39 weeks look like to a small business owner. So I can come back to those. I want it to be really successful. I want us to roll it out in grand fashion, but that's almost a year, and I'm just curious.
We can bring back once we have all the details finalized, but what I can tell you is I have participated in this program. That's how I know about it. And so it really requires that the entrepreneurs commit about 7 months. So the 39 weeks is really from the time that we sign this contract through graduation. But it's a monthly commitment of about 2 days a month for the entrepreneurs. And there are about 5 modules that they'll go through to help them, for those that don't have a business plan, to help develop one. For those that do, to help develop more of a strategic growth plan. But it is really to prepare them to the point that they can compete for contracts with the county, with the city, with people in private industry.
Music to my ears.
Yes, ma'am. So we'll come back once the contract is signed, and we will be working with C.J. Broadwick from the Black Chamber. I've already spoken with him and his board chair, and some other critical partners in the community to help us identify kind of the criteria for who will participate, so it won't just be staff making these decisions.
Right, and the only reason I can think of one that's going on right now this week, and it is a good one that's going on right now at Duke, but, I think one of the requirements was you had to, have bought in 250,000 or 500,000. For some of our newer folks, they haven't gotten there yet. You got to have 50 employees. At that point, you're not looking real small. So one, I would love to see the criteria. I don't need a whole presentation. A fact sheet would be good. And the last thing, I did click on the PowerPoint. Texas did a graduation for their program. I would love if we did a graduation for ours. And that's
Absolutely, we will. And you only need two employees to be eligible for our program. So that's a great point you make. Yes, ma'am. Any other questions, Vice Chair Jacob?
Yeah, great. I had questions too, and so I'm glad to hear about that. I'm wondering, is there a limit on how many people can participate?
Up to 20 entrepreneurs for this cohort. Yes. Is that it? All right. Great. Moving on to 230172, Utilities Contract Amendment with Sanford Electrical Contractors, Inc. to increase the contract by $30,500 to a total contract amount of $60,000. 230180, additional funding for contract with Express Employment Services, Inc. 230186, Durham County Sheriff's Office Revenue Contract Amendment with Via Path Technologies and increasing authorized strength for the Sheriff's Office by 1 FTE. Vice Chair Jacob.
Again, this doesn't have to be provided now, but I was really curious about the kinds of programs that people can access on the tablets, because it was described as there are educational programs and things like that. So if we could just get, more information about what people can access on there, that would be helpful. Thank you.
Okay, is that it? Okay, Madam Chair, that concludes the consent agenda items.
Great job, Manager. And just for the public to know, is that we get this information Thursday, by Fridays. So we have an opportunity to read through it and get back to staff and ask questions. So if you don't hear us asking a whole lot of questions, it's because the staff has been so great at making sure that we have the information we need to answer all those questions going on in our head, that we would take half a day to get the answers we need. So just want to say thanks to the manager and staff for making sure that we do that. All right, great job. So we're going to move on to our discussion items. And these are the items that we want to make sure that we stay on task. The first item is Alliance. This is a 30-minute discussion, and I'll ask the clerk to start the clock when you start to speak, and we will hold it to 30 minutes. And Rob, good to see you. It's been a while. If you want to introduce your team, that'd be great.
Good morning, everyone. Commissioners, Madam Chair, Manager Sowell, it's really good to be here today. It is good to be here. For those of you that don't know, Alliance started here in Durham. Our legacy agency was the Durham Center, which was the local mental health agency. Several mergers, acquisitions, multiple system changes, and here we are today. We've been very fortunate to work with some very good and compassionate people around the work that we do. So I do have a team today. We're going to give an update on a couple of things. I'll kick it off just providing an overview of who Alliance Health is. And then I'll talk a little bit about Medicaid transformation. You may be overhearing about Medicaid transformation, so I'll make it brief. Then I'm going to turn it over to Diana White, who's our SVP over finance. This is her first time ever at a county commissioner meetings, so she's ready to go. And then I'll turn it over to Sean Schreiber, who's our chief operating officer. He's going to talk about programs and services here in Durham. And then Ann Oshel is going to take us home to talk about the work that we're doing in the community. All right, so about Alliance Health. So we are a LME MCO. We serve Cumberland, Durham, Johnston, Mecklenburg, Orange, and Wake counties. The LME stands for Local Management Entity, and that is about managing care for people who are uninsured, underinsured. The MCO stands for Managed Care Organization, and that's about managing care for people with Medicaid. We do manage services for people with severe mental health, severe substance use disorders, just about everybody with an intellectual and developmental disability, and those with a traumatic brain injury. Again, the people that we serve either are on Medicaid or they do not have a means to pay. We pay for those who are uninsured, underinsured using state dollars, and then you give us a substantial contribution to help serve the uninsured as well. We are about a staff of 1,000. We are not a service provider. As I said, we contract with about 3,000 providers who actually deliver the care. And once we go live with a tailored plan, which I'll talk about in a minute, we'll have an operating budget of almost $2 billion. All right, here's the region. Alliance Health is one of 6 LME MCOs across the state. You will see us in the purplish color. What's interesting, you'll see that we have the smallest number of counties, but we are the largest LME MCO by far, given where we serve, right? We're primarily in urban settings, The rest of the counties are primarily rural. All right, Medicaid transformation. Again, I think you're been very versed in this. This is about bringing managed care to the Medicaid population. Up until this point, the only managed care that was available was the work that the LMEs did, again, managing behavioral health, substance use, and intellectual and developmental disabilities. Under Medicaid transformation, the state would like to bring managed care to the entire state. Their plan consists of two types of health plans or managed care organizations, standard plans and tailored plans. Both the standard plans and tailored plans are responsible for managing the physical health, mental health, and pharmacy services for people with Medicaid. The big difference is around who they manage for people with mental health. For standard plans, they manage folks that are mild to moderate, which is defined as people with Medicaid who are not accessing mental health services or just receiving basic outpatient. Tailored plans, which is most of interest to us because that's what we're going to become. We're responsible for people with severe mental health, severe substance use, everybody with an intellectual and developmental disability, and a traumatic brain injury. We're excited about this group. This is the group that we feel like we're best equipped to serve. We've been managing this population for several years now, and we're excited to move into whole person care. All right, with that, I'm going to stop and turn it over to Diana, and she's going to give a financial update.
Good morning. Up here we have the Alliance fiscal year 23 approved budget that was approved back in June.
Pull the mic up on a closer, please.
This was Alliance's approved budget back in June for $1.4 million for fiscal year 23. We will have budget amendments, and actually we did last Thursday evening due to the impacts of the Taylor Plan delay. This was the fiscal year 23 approved spending from the Durham County. Real quick to go over the different programs. We have the Recovery Response Center for $5.5 million. The System of Care, this is to fund Alliance salaries related to the System of Care. The Supported Housing for $214,000 is actually two programs. It's the Health and Housing and the Coming Home programs. We have Pharmacy Services, which are the contract with Gurley's, the Community Health Network. This is funding Lincoln Services in the Crisis Center. The Latino Services is the contract with El Futuro. The Threshold County Grant was the originally started in the nonprofit grant system, and then our administrative support, and that's based on a percentage of the services provided. And then we also have a care coordinator that's partially funded by DSS as well. This slide shows our year-to-date spending as of February 21st and our projected spending for the end of the year. You can see we have a couple of items that are projected to underspend. The first one is the System of Care. That's due to a staff vacancy at Alliance. We had a staff leave at the end of August. The new staff person is starting on March 20th. The second one is the Supportive Housing, and as a reminder, that's two programs. The ones that is projected to underspend is the Coming Home program. The providers submitted a large salary budget, but they have not been submitting large salary reimbursement requests, so we do need to work with the provider more on getting those reimbursements requested. And then the administrative support, as I mentioned, it was just a percentage of the services provided. So if we don't spend everything, then our administrative support doesn't spend all as well. This slide shows the last 5 years of spending that we've done of the Durham County funds, and you can see through 2018-20 we have spent all of the funds. Beginning in 2021, we started receiving additional COVID funding. In 2021, we received a lot of funding, and in 2022 we were still in COVID funding years, which is why we had excess funds not spent of the county funds. So now that the COVID dollars are not coming in, we do project to spend most of our Durham County funds and working with those programs to get it to spend almost all of the funds.
Can I just speak to that real quickly? One thing we were surprised about is during COVID, the amount of spend or the number of people seeking services decreased. Maybe it wasn't a surprise, it was to us. There's a couple things for that. People were trying to just deal with COVID. The other thing is some of our providers did not have access. There was more of a provider capacity workforce issue, and providers were not able to see members that we thought they were going to be able to see. We did take some action, used telehealth as the solution, but it didn't get us to the numbers that we'd hope. We are seeing it now that we're coming out of COVID. I guess if you say you're coming out of COVID, that we're trending back up and we'll be where we need to be on spend in the coming years.
Good morning. Thank you for the opportunity to present this information. I'm going to cover a couple things. I'm going to talk a little bit about some of the numbers served for Durham County, and then some of the new initiatives we have in place really across Alliance and particularly in Durham. As everyone's been hearing, there's really a youth mental health crisis going on in our country right now. It's impacting a number of children in emergency departments, number of children in social services, juvenile justice. I appreciate your comments, Commissioner Carter, about really the goals of ultimately keep kids in the community and not in these facilities. So we'll talk a little bit about what Alliance is doing there and some of the changes. So as Alliance is responsible, as you know, for providing services and arranging for services, covering services for individuals who both are covered by Medicaid and the uninsured population. And there's been some movement, obviously, in Medicaid with the standard plans coming in. There were some individuals who used to be covered by Alliance who now are covered by the commercial plans that administer the Medicaid program, and those are kind of more in the mild to moderate range. Also, during the public health emergency, there was increase in Medicaid rolls. So the combination, as Rob said, of service people really being a little bit apprehensive to access services, to go into the community, to go to facilities, we did see some decrease in the numbers served in our state spending, but also there was an increase in Medicaid enrollment during that time as well. So some members traditionally served under the uninsured state pool and the contribution that Durham provides to us were likely covered by Medicaid. And so what we did is just to give you an idea for the state funding, we didn't include Medicaid just because we're not the only Medicaid payer anymore. But you can see there was somewhat of a gradual downcrease that coincides with both COVID and the change to standard plans. And again, some of those uninsured members likely received Medicaid during the public health emergency. So one of the primary source that we use Durham County funding for is to support our crisis response center. As you know, this is really the primary diversion point from the emergency department in the county. So while Duke is state-of-the-art of having behavioral health emergency department, we still believe individuals with significant mental illness should not be going to emergency department, and we've put a lot of emphasis on diversion. And again, you can see the trends follow what Rob was saying. So there's really actually three components. We highlighted two at the crisis facility. The first is the crisis and evaluation. And that almost operates like a psychiatric emergency department. Anyone in the community, 24 hours a day, can walk in to get assessed. And if it's felt that they maybe need some time for greater observation, they can stay for up to 23 hours in what we call a crisis chair, then either get referred on to other more intensive services or go back to the community. Additionally, individuals can be brought who are considered on an involuntary commitment, so they've been picked up by law enforcement, quickly dropped off at the center, allowing law enforcement to get back into the community and individuals to get the service they need outside of the emergency department. So you can see that that number had a small dip that coincided with COVID, but has really kind of come back, and we're still getting the rest of the data for fiscal year 2022. The other program that's not highlighted, but it's an important component there, is the Durham Crisis Recovery Center implements Suboxone. So individuals who may show up who are there with an opioid use disorder, they can be put on medication and released, and go back into the community. So that's a really important service that's provided at the facility as well. And then the other component is with the facility-based crisis beds. These are akin to inpatient psychiatric beds, kind of a lower level of care that there's not quite as much nursing and staff, And Durham has really a state-of-the-art model. It's really a peer-run type center, so many of the individuals who work in the facility-based crisis and work day-to-day to help our individuals have lived experience with either themselves or family members with substance abuse or mental health, and that's really considered a best practice for crisis services in the country. And you can see there was some decrease in utilization over the course of the years, and this was really particularly due to COVID. They had to, at times, because of members being in the facility with COVID, had to begin to isolate, move to one bed instead of two per room, and some staffing challenges. So, and additionally, we're also seeing the impact of, we only now have the numbers for the facility-based crisis of individuals that we cover with Medicaid. On the chairs, we get a report of all individuals because it's payer blind. Anyone can show up in a crisis and at least get a screening and evaluation regardless of their insurance coverage. So just a quick overview. This is just some of the services that are available to citizens of Durham County, whether they're covered by Medicaid or not. We talked about crisis services. We contract with Duke University Health System for access to their inpatient psychiatric services. Alliance basically also contracts with every psychiatric hospital and every psychiatric unit in the state. So members, unfortunately, if the local units are full, can get their needs met in other communities. We offer a bunch of team-based services. I won't go into detail, but the ones we have listed here really are for individuals who have more significant and complex mental illness. Not only do they address mental illness, they provide counseling, case management, sometimes medical support in the community, in a much more intensive fashion. So as opposed to people kind of showing up for an outpatient appointment, these are typically services that go into members' homes in the communities. We serve, as Rob said, basically everyone in the Medicaid and the uninsured system who has an intellectual or developmental disability would get served through Alliance, and we have an array of services. Again, the goal is for individuals with those issues to remain in their homes, in their communities, and not going into institutional levels of care. And we offer the same for individuals with traumatic brain injury as well. And then the last part of our service continuum are residential services. So for children, we offer an array of residential services all the way from locked residential to treatment foster care in the community. The largest number of children are served in treatment foster care, which again is considered a best practice. We have seen an uptick really since COVID in children needing residential services, and you probably hear about this. You may hear about it from the Department of Social Services. There are children who are awaiting these services because there are finite numbers of them in the state. Alliance and every other LME MCO basically contracts with the same network, so we're often competing for beds. So we've done some specific things to basically purchase beds just for our children, and with the county support, are opening a home that's specific for Durham County youth. So here's one of those programs. We call these our crisis stabilization and transition programs. Unfortunately, there's times where children, primarily in the Department of Social Services, are waiting in an inappropriate placement. They have behavioral health needs, but there's not a treatment bed available. They don't meet kind of inpatient psychiatric care, but they do need residential kind of oversight, sometimes 24-hour supervision, specialized counseling when they're in settings. These children, unfortunately, sometimes have been waiting in Department of Social Services offices, emergency departments, or shelters, not getting the care they need. In response, Alliance began opening these transitional group homes where we've hired or contracted, with provider organizations who have specialty working with youth, and they develop homes specifically for Alliance that nobody else can use. So we use county funding to help kind of the startup and the renovation costs, and then Alliance uses our Medicaid dollars to fund the ongoing operation. Because children are coming here at a really rough point in their lives, often it's right after they've been taken out of their home or had a disruption of a placement, we pay for double the staffing. So typically there may be, two individuals to one staff. We're almost running a 1-to-1 staffing ratio. So the first home specifically that will only serve Durham County members will open late in spring, offered by a provider. It's called Breakout LLC. And you can see it's where it's located in Durham. And this will have 4 beds that only can be used by children who are in Durham County Department of Social Services. And to make sure the provider is sustainable, whether there's a child in the bed or not, we pay for those so they're available. Again, you'll see all we're going to focus on today mostly is child mental health. We do have initiatives around adults, and OSHA will speak more to that in our housing realm. But based on what we've been seeing out of the pandemic, we felt like we had to make greater investment in child services. And this is a really exciting service that's spreading throughout our region, and actually the state is moving on board to fund statewide. It's called the Mobile Outreach Response and Engagement Service. And the idea of it, it's really a mobile crisis service that's specifically designed for children and families. So if a family's having a crisis with a youth, it could be a foster placement or even a residential placement, and they're thinking about sending the child to emergency department, instead they can call, and they get a 45-minute response time, which probably doesn't sound great compared to things like EMS, but the next best response time in the behavioral system is a 2-hour response done by adult mobile crisis. So it is an improvement on that number, and the idea is a trained therapist goes into a home, begins to work to stabilize the crisis, and then they follow the family for another 30 to 45 days until they can be really well matched with the treatment provider and the crisis is resolved. So the provider who will be doing this is Kids Peace. They'll also be doing this in Wake County, and Kids Peace also is the operator of the child crisis facility that will be opening hopefully sometime in the coming months. This program will be available towards the end of April in Durham. So individuals will be able to, families will be able to either call Alliance to get the service implemented, or they will be able to call the provider directly. The other thing we've been doing in response to these issues of children who are not be able to get into immediate placement is building some therapeutic support services. Again, Durham, I think, has done better at moving children, keeping them in various residential placements. In some of our communities, there are children who are sleeping in offices and hotels with DSS staff. We've contracted with a provider entity who has behavioral health staff on call that goes into those settings and basically provides behavioral health support to the children while they're in these settings. They also will take them into community outings to give some respite for the staff who are spending basically 24/7. So we're using an agency called Pinnacle Services. They're currently operating this in 2 areas within Alliance catchment area, and we'll be bringing this on in late March, early April in Durham. It's just they had to find staff and get people trained up in the model. I believe this will be my last slide. The other thing we're doing is
You've got about 10 minutes.
Okay, I want to make sure I can give answers.
Yeah, you've got 10 minutes to complete and your presentation.
Right.
And
I'll wrap up with this thing then.
yeah,
So the last thing is a child to serve community treatment team. It's just an intensive model in-home services for children that provides psychiatric support, medication management, skill building, and family therapy, case management. So with that, I will end my comments and turn it to Ann.
thank you.
Thank you.
So for those of you that know me, you know, I could have used our whole time to talk about our community efforts. So, oh no, so I really will be brief. That's okay. Since Alliance kind of grew out of the Durham Center, we have remained committed to having a local presence. We don't want any of our key public partners to have to think about our 1-800 number, to wonder who at Alliance can help them navigate a system or a service. And so not only do we have some of our community staff embedded in juvenile justice and DSS, but we also have a local team who does nothing but work here in Durham. And these are our team, our community health and well-being teams at Alliance. And I want to just highlight a couple of really quick things. Community education and outreach. This is our team that does all of our disease prevention and early intervention to behavioral health training. Durham is a hotspot for all of our training initiatives. There are constant requests. Last year, we trained 180 librarians who completed the adult mental health first aid training. We go back and do twice a year in-service trainings on de-escalation and communication for library staff. Several years ago, we trained the entire African-American faith congregations in mental health first aid. We are going back and redoing that circuit. Starting this month, we have trained 40 staff from our local faith groups. And so that continues to be a huge need of helping people understand the signs and symptoms of mental illness for both young people and adults, as well as understanding the community resources and how to access care. So I wanted to highlight that because we have more requests for education and outreach in Durham than sometimes we can do. We also continue to support the detention center in mental health training, specifically around mental health first aid. There's a public safety module that we do, and we are still the host agency for crisis intervention teams, which is our partnerships with first responders. Part of that effort is, around community paramedicine. So lots of things that we do. I did want to, oops, it's stuck. There we go. I did want to highlight around social drivers of health. And 5 years ago, Durham recognized the importance of stable, safe, decent, and stable housing that is conducive to improving people's health outcomes. It is very hard to give somebody an antipsychotic injectable when you're looking for them under a bridge, much less get them to dialysis and help them with diabetes education. And so the county has generously funded 3 positions related to our supportive housing efforts. I'll talk about that in a second, but we've been using this quote from the World Health Organization that just points to the importance of housing as the key intervention to interrupting poverty, chronic health issues, addictions, all those things that at times unnecessarily inflate the cost of public services if we could just use housing as an intervention. And I don't say just like it's so easy and it's cheap, but I say just in terms of if you really want to isolate an intervention, you should begin with housing. So speaking of which, I want to talk for just a second about our local supportive housing efforts. We have an ongoing partnership with the Durham Housing Authority. For years, Alliance has administered a Shelter Plus Care program on behalf of the Housing Authority. Last year, that program ended. We also are the recipients for years of a HUD-funded grant called DASH that serves 31 chronically homeless families and single adults. Many of you are familiar with our Independent Living Initiative program, which is both eviction prevention and rapid rehousing for the people that are involved in services. So far this year, we've offered over $145,000 just for Durham households. We serve 150 households in our Transition to Community Living program, which is the Department of Justice settlement agreement between the state of North Carolina and the Department of Justice around an Olmstead violation for people unnecessarily living in institutional care with a severe mental illness. And one of the most exciting things that we continue to do is the capital housing investments totaling almost $1.2 million here in Durham and creating 39 exclusive set-asides. In total, Alliance has spent almost $7.6 million creating 91 set-asides with a 15-year deed restriction, which does a couple of things. One, it mitigates housing barriers for people with severe mental illness, so we can negotiate tenant selection plans around criminal records, credit history, eviction histories, all those things that often prevent people from accessing housing. When we purchase those units for 15 years, it mitigates some of those barriers, especially for the people that we serve who are often marginalized or discriminated against in housing. The other thing that it does is, at least for the units that Alliance bought with a 15-year deed restriction, if that property is sold to the private market, our units have to remain affordable for that period of deed restriction. So, and we've had several properties where we've had a long time presence and affordability in Durham that have been sold to the private market and displaced the people that have been living there for a long time. So that was an unintended, but has ended up being a really good thing with that. It was mentioned earlier that the county has funded 3 of our supportive housing programs, which are administered by Resources for Human Development. We have and it is too lengthy to go into, but we have this whole array of community living options, which helps for people coming out of institutional care, both our state hospitals, our state detox facilities, certainly as a strategy for people who are in and out of homelessness, who are high utilizers of hospitals, inpatient, and other crisis systems. So EMS can call us and say, this is really true, this is the 51st time that we've responded to this household on a 911 call. Can you help us out? And we do. We got a call last week from the HEART team, which is the behavioral health outreach team with the city of Durham that had encountered a mother and 7 children living in a household that had received a notice from the public health department around the hazardous levels of lead. So, I mean, there are many ways that we all network and are connected around this issue of safe, decent, and affordable housing. For us, though, it really is creating alternatives to institutional care for people so that they can live their best life in the most dignified of ways. Everything for us points to the work that we do with permanent supportive housing. We have one program that unfortunately is ending in May. We were a subrecipient of SAMHSA money during COVID that housed 11 families who were impacted by COVID with emerging mental health and their children, called RISE. And so that program loses its funding in May. And so we're in the process of ensuring that all of those families are able to support themselves ongoing. So many exciting things just around the issue of health and housing here in Durham, with multiple strategies that we've been implementing for years in partnership, and then all the other work that we do around our community presence. And I don't know where that took me, Commissioner Howerton. Probably 30 seconds left, so.
Yeah, you've got about 30 seconds. But you did great. Great job. What we'll need to do with the commissioners, because allocating 30 minutes, what we did not do, staff, is add time in there for discussion. So given that we've got 7 hours of allocated today in 30-minute increments, the staff, if commissioners have a question, I'm asking if you'll take 1 minute, ask your question, and have them take 2 minutes to respond. And let's not use up no more than 10 minutes. If you could set the clock, Monica, and each commissioner have a question if they would like to ask. If you will do that and have them respond. 2 minutes for you guys, 1 minute for us. Okay, Commissioner Carter?
I just want to thank the Alliance team. I think you are incredible and very capable, facing amazing challenges, both financially and just with the depth of need in our community. And you're leading the way with moving towards, managed care and the therapy and the thank you, tailored plan. What does TP stand for? Thank you, tailored plan. And I'm so glad that even though I'm on the board, I heard this presentation because I learned so much. I feel like our board meetings, when you have a $2 billion budget, the discussion is much higher level and not really county specific. And so this is great to get this report. Rob, or any member of your team, I wondered if you could just speak a minute to the statewide foster care bill issues and what your recommendations are around that and how your work with DSS is going related.
Thank you,
related
Commissioner Carter. I could speak on this subject for an hour, but I'll keep it to 30 seconds as best I can.
No.
So the state is put out a proposal. There's a piece of legislation that requests the development of a statewide health plan to serve kids in foster care. And I will be the first to serve. There have been challenges trying to serve kids with very complex needs in the foster care system. Even though we serve successfully tens of thousands, there are a small group of kids that do have complex needs that get caught up in DSS offices or EDs. We would like that opportunity to serve. Those kids are our kids. We've been serving them for years. We've got a multi-million-dollar plan to try and best serve them. The statewide, the issues that we've experienced have had to do with provider capacity and provider workforce issues. I'm not sure how a statewide plan is going to be able to solve that issue. And I also believe that this work is local. The things we do to help better serve this population have to be done in local communities. And again, I'm not sure how a statewide plan responsible for 100 counties is going to solve that problem.
And I guess the takeaway message is that you believe that these children, these youth will be better served through a local plan rather than a statewide plan, and may need some advocacy from us on
I would
that.
love support and advocacy from this body if you're willing to do that.
Okay. Who wants to go next? Commissioner Lum, you have your hand up? Do you have a question? Commissioner Lum? Okay, why don't we go ahead, and if she can get on, we'll go ahead. Commissioner Burns?
Mine is relatively quick. I know you all mentioned that you all had trained some clergy. I'm not familiar with that network. I don't know if some of my networks are completely, because you said 2 names. So my only request is, as those classes become available, could you at least send those to us so that we could send them out to the clergy that we know? Because I can think of 3 churches right now that are doing a series on supportive services and mental health for both parents and children, and I think it'd be great if they were linked into you all. So that's an easy yes or no. I'm happy to see that you all are working with the SAMHSA funding. The last time y'all were here, I did ask whether or not there was going to be a second iteration of that funding, so we're seeing that it's not. I do hope we can get those folks on their feet, and congratulations on this mobile outreach unit that you all are going to have. Please let us know how we can be supportive with the services that we have. 40 seconds. Y'all be blessed.
Commissioner Jacobs?
I have a lot of questions, so I know you can't answer them now. One is just, what is going to be the impact of Medicaid expansion on your ability to serve people, the capacity, providers? Just really curious about that. I'm just going to list my questions because I know we don't have a lot of time. Really glad to hear about what you're doing to support children in crisis. And I'm wondering about what the plan is for the child crisis facility and how Durham County will be able to access the capacity there. And I know right now we don't have a FACT team that's really functioning in Durham County, and a forensic act team, and how do we get that going again? I'm on the Access to Care group for Stepping Up, and we've talked about the gaps in the IPRS funding, the Integrated Payments and Reporting System, and that's a real barrier for care. And if we had more funding, is that something we could route through Alliance to serve more people who are uninsured? That's another question.
Commissioner Jacobs?
Yeah.
They are not going to have enough time to answer your question.
This is for them to follow up with an email.
Okay.
Yeah, we'll
Follow
follow
up
up with an email
okay.
on these questions.
And I'd like to make sure that Commissioner Lum, has a chance to
Yeah,
speak.
and just wondering, I see you're partnering. I hope you will partner with the assessment center, with the youth home, also the whole schools that's happening at Durham Public Schools. I know we're going to talk about faith-based community centers, and I do want you to talk about, Ann, about the trip you're helping us organize to go to Moore Place, which the whole board and other folks will be invited to in Charlotte. If you could just mention that.
All right.
Minute.
You're going to email her. Okay? If you got one quick response.
Sure. I'll do a follow-up email.
Madam Chair, can you hear me now?
Great.
Yeah.
Commissioner Lum,
Can you hear me, Chair Howerton?
I hear you. Go ahead.
Perfect, wonderful. Yes, I had one question and then one quick comment. So my question was, I was just wondering what resources and cultural training the providers have to support in the care for youth of color, especially including what resources are available for the families of youth who are struggling with mental health issues that may be patients and in the Alliance healthcare system. So that was my question. And then my second was more so a comment. I was really happy to hear the alliance partnership with the Hearts program under the city. And, I would love just for our board to have a broader discussion and conversation in the future just to see how we could possibly expand partnerships with the Hearts program and maybe even expand it into the county.
Thank you for the question, Commissioner. I can start. One of the things Alliance has done is we've done some significant investment in developing cultural competency toolkits for our providers and additional training, but also we've been looking more at the needs of providers who are typically underutilized, considered minority-owned, and small businesses. It made some significant investments to help them be viable and succeed in this new environment. About a year and a half ago, we put out $1 million to these providers to help upgrade their information technology systems so they'd have better record keeping, be able to track outcomes and data. And actually more recently, very excited about, we're actually helping to fund something called a clinically integrated network in an administrative services organization that purely is to serve and support historically underutilized businesses, where they'll be providing some of the back office functions, care management platforms, analytics, and pooling resources. The idea is allowing smaller providers who are actually really quite skilled at serving underserved communities, comfortable in the communities, parts of the communities, but if maybe lack some of the specification and technological infrastructure needed to do so in a very complex environment. And so we're putting actually almost $3 million into this group over the next 2 years to support this infrastructure to help our smaller providers.
So we are about at the end. You got 30 seconds if you want to wrap it up with something else. And what I would like to do is have you come back another time. There are so many questions I think this board has, and so much information that you have that you can provide us with. And having to rush you, it just doesn't work for any of us, but that's the time schedule we're on today. So I'd love to schedule for you to come back at another time.
Thank you, Chairman Howerton. We'll come back anytime. Thank you for having us. I do want to walk away. Just the crisis facility located on Duke, that was one of the first facility-based crises in the state. It is still seen as a leader across the state in the work it does to help people with mental health. And then the system of care, Durham has been the leader in implementing system of care. That's where I started my career here in Durham, is working on system of care, and Ann's been involved with that. And that is also seen as recognized as a state-of-the-art initiative as well. So thank you for your time. We appreciate it. Look forward to coming back.
Thank you so much. Okay, Commissioners, our next item is 23071, Community Mental Wellbeing Hub. And that is Ms. Pierce, Deputy County Manager will be Assistant County Manager. I'll get it all right in a minute. Deputy Assistant. Which name you've been given lately. Will present that to us. And that is a 30-minute item as well.
Yes, good morning to the board, to Dr. Sowell, Attorney Andrews, and everyone present. I have my trusted timer here, so I want to also allow time for the board to ask any questions or make any comments. I'm glad that I go after Alliance, our partner, because they've touched on some of the things, so I'm just glad to be here today, and thank you. This will not come to you as a surprise because around mental health crises, because the board, this has really been a priority for you. You've discussed it, sounded the alarm, so I'm just going to provide an overview of some issues and potential opportunities today. There have been conversations at the national level with the National Association of Counties. They had a recent summit on mental health solutions just last month, and also created a commission on mental health, mental well-being. And also at the state level, there's been some activity, and also at the local level conversations. So just going to provide an overview of that and then talk about some local conversation. So certainly you all are aware that we're in a mental health crisis, and there are a number of reasons or inequities that exist, as you see, and even, Alliance, a partner, talked about, certain barriers as well. We know that COVID-19 exacerbated or really shined the light on the inequities that we have seen, and, just people having to navigate through COVID. And so these are just some of those issues that you've all brought up about what can we do. Recently, and a few of you participated in the recent summit that NACO held, and overwhelmingly what we heard from it was a packed room. We heard that, many jurisdictions and counties said, what will we do about the mental health crisis? It's pervasive, and we need solutions. At that summit, there were congressional, federal agency leaders, and national thought leaders, having conversation. And so I just want to share that your concern over the, several years is in alignment with what those conversations were. And so the commission that NACO just established last month on mental health and well-being really wants to reach out to counties, bring counties together to hear, what are some potential solutions. And so NACO is looking to counties, and counties are looking to NACO to figure this out. And overwhelmingly, what we're hearing is that obviously we can't do it alone. Government can't do it alone. We need our community and faith leaders and partners. We need public-private partnerships to really imagine what is possible to address those who may not have insurance, whether it's Medicaid or private insurance, and they're uninsured, underinsured, and really are not able to receive care. Two bullets here that I really want to highlight for you is that this commission really wants to showcase county innovations and solutions because I hope you can hear me very well. Oh, thank you. Many counties are looking for, whether it's rural or urban, we're all faced with the same issue. And so this commission is looking for innovation. What can we do? Because, sometimes what we're doing now is not reaching everyone we need to reach. So that's something that they're looking for. And then the other bullet that I want to highlight is the last one about partnerships. How do we partner with each other, and what are those policies that would need to be addressed so that more people can receive care? The commission that was just established in February by the current president of NACO, they've used these bullets as maybe grounding or context for why the county should be involved and would have a role. As you see, 75% of the U.S. population is relying on county-based behavioral health services. That's a lot of people, so that means none of us is untouched by the crises. Also, it talks about the investments that counties make to ensure that people receive care. Alliance mentioned the World Health Organization, and those of us in the public health world, it's good to see public health partners in the back and over here. The World Health Organization, or WHO, defines health as a complete physical, mental, and social well-being of a person, and not the mere absence of disease or infirmity. And sometimes we look at the physical health and not realize that mental health is critical so that people can thrive in our communities. NACO also talks about, and we've heard this from our director, Palmer, and certainly from our sheriff, that in far too many instances, county jails and other public safety services are used as frontline treatment providers for our most vulnerable residents living with mental illnesses and substance use disorders. And so the question, of course, what can we do to close gaps and address the inequities that we see? At the local level, just last Monday, the Department of Health and Human Services and the health equity team with the state hosted a Black Faith Leaders Town Hall meeting. A few of you participated in that as well. And the goal of that, or the purpose, was to re-engage with leaders in the community. There were hundreds of people on the call, and the state really wanted to ask those leaders, what are you seeing? What are those issues that you're seeing or facing in your communities? What barriers are in place? And what would you, if you had all the resources, what would you do? And of course, one of the top issues about health-related issues was about mental health. That's no surprise to you. And so the state is committing to work more closely with faith leaders and faith-based organizations and also community to figure out what can we do. We can't do it alone, whether it's government or community. So there's that. So what opportunities exist right now? There are many conversations happening, and we know that there are people falling through the cracks, underinsured, uninsured, and so fine-tuning what those opportunities are would probably look a little like this. This is also, again, part of your priority to promote safe and equitable inclusive access to services. Partnerships, we know that's important. How do we build capacity for our partners and for ourselves? And I bolded the faith and community-based organizations because this just allows me a moment to acknowledge our faith and community-based leaders and organizations in our community, because often they are the ones on the ground addressing the gaps. They see them, they call it to our attention, they do it paid, unpaid, they do the work, they see it even before it becomes a thing, they're doing the work. And so I just wanted to pause to just acknowledge that the work that they do in the community. And then this is when I talk about the local level. Now, so community mental well-being hub, that's not really a title. It's just what it's called at this moment, a space. So there are some in the community who are, and again, the conversation that's happened at the state and national levels, looking at what can be done locally. And there are some models or approaches that other areas are using. One I can think of in Mecklenburg County and Charlottesville, Virginia, and surrounding counties. They've partnered with each other and with whether it's the state or government to figure out what can we do to build a coalition and create spaces within the community based organizations or faith-based organizations where there are licensed therapists who would be available to provide services to those who are least likely to receive care. And so that's what, a hub would be, a space where people can go right in the community to receive care. who would normally not be able to access the care. And I believe that the previous presentation talked about, or the question I believe Commissioner Alum asked about cultural competency. And this type of mental well-being hub would certainly ensure that people who wanted to receive care would have a way to access individuals or therapists who would be culturally competent. Strategies related to this type of space or hub that would be based in a community-based hub would really involve these 4 strategies about investing in the actions to create or increase access. It would mean partnering with a few faith and community-based organizations to establish spaces and places where people can go right in the community, and so it's not an institutional environment where they normally would go, or right easily accessible. It would be identifying, again, culturally proficient providers to offer this service, licensed culturally proficient providers, and also there has to be a component to evaluate the effectiveness of some type of program or project such as this. Oh, before I do that, I did want to close with, I know I went very quickly, I just wanted to make sure you had time to make comments. I wanted to close with something the Surgeon General shared at the Mental Health Summit in February, and I'm looking at Vice Chair Jacobs because I think she knows what I'm going to say. He really, as he closed, Dr. Murthy, as he closed his presentation, he really spoke directly to county officials. And he said that, as you were, these past few years, particularly, you've worked very hard to ensure that people were safe, that they were fed, that they were housed, all of these social drivers and trying to, fill in the gaps and address inequities and all of that work that you've done, that you were also you also experienced the pandemic. You also experienced things in your lives and your families' lives. And he said that, you all need to notice that and remember to take care of yourselves, because as you're moving forward and working to address all of the issues that come before you, that you might not have paid attention to that. And so he just really admonished all of us, and especially county officials, that your well-being is important as well. So I think that's what you were probably going to say too, Vice Chair Jacobs. And that was just a moment that was really important. So I went through that very quickly, and I certainly would love to entertain any questions or comments. Thank you.
Thank you, Ms. Pierce. I'll bring it back to the board for questions or comments. Commissioner Burns?
Mine is just really quick. On the last slide where we were talking about strategies, I mean, you went through a lot, and you went through a lot kind of sort of the 30,000 foot range, and then we dropped down to Durham. So what I see partnering with 5 to 7 faith.
Can you pull your mic up a little bit, Commissioner Burns? We can't hear you.
I don't think I'm gonna get it no closer than this, so I'll speak up. You spoke at a 30,000 foot level about what we should be doing, about what NACO's doing, about what Congress is doing, and then you dropped on this last slide to the partnerships, and you stated that there would possibly be 5 to 7 faith and community-based organizations that we would be working with. So I know what the rumblings around the county are about funding around this opportunity. I'm trying to figure out, so this is there a request coming later? Are we identifying? Is this something that we're going to open up? So that's just the one I want to kind of sort of focus on, because I imagine if we want to do this in the way that you've presented it, we want to do it right, and it's going to take substantial funding. And let me be clear, I love that we're doing this because, you know, when I think about one of my closest friends, you know, he became a senior minister at the same time I became a county commissioner, and our pastor set us down, and he said, it is a privilege for people to tell you about his problems. That thing sounded real profound that day. It didn't sound profound a year later because we were both pretty tired. But I think that this is a perfect niche because people don't always go to their psychologists, their parents. They go to their pastor with what they're dealing with. So I'm excited that we're primed and ready to do this. I'm just trying to figure out exactly what are we primed and ready to do because we didn't really go over that. So, like, what's the strategy behind this partnership? I hope that was loud enough for everybody.
Thank you, Commissioner Burns. That's a really important question. I will say that this presentation was informational, just to kind of try to pull together the conversations and discussions that were happening at the national, state, and local levels. And to that point, again, there are conversations, questions, concerns, and I'm glad maybe our partner's still here from Alliance, that there have just been conversations around what can we do on the ground to have these kind of faith and community-based spaces for individuals to access care. That number is just, you know, thinking, envisioning what would it look like if we did have that? How many would we start with if it's a demonstration project? And what, you know, potentially, that's still kind of in the works. What would it cost? What would it look like? Who would access the care? Who would be the particular population? So that is there. It could have just not been 5 to 7. It could have been faith and community-based organizations. But looking at those numbers, yeah, just kind of finding a number for a demonstration project and for 2 to 3 years and evaluating it. I don't know if I've answered your question.
No, that's good. Okay, so this is all preliminary.
Yes.
All right, well, thank you. I'll hold the rest of my questions. Thank you.
Thank you.
Commissioner, which way? Commissioner Jacobs.
Thank you, Joanne. And I know, Deborah, you and I were there for the Mental Health Summit in NACO, which was really great. One of the other things that the Surgeon General said that I just keep thinking about was that that we need to invest in social relationships, and that, you know, that is something that is also the heart of the impact of the pandemic, people being isolated, and the more that we create opportunities for everyone, our youth, our children, our seniors, everyone, to just engage and connect, that's a protective factor, that's a resiliency factor, because what we learned was that now the biggest cause of death for our youth ages 10 to 14 is now death by suicide. So it's shocking. But the good thing is we are good at engagement in Durham. We are a community of people that like to be together. That was the positive thing for me. I was wondering if you could tell us a little more if you think there's going to be federal or state funding opportunities that might be connected to these initiatives and awareness around mental health. And are you looking at partnering, for instance, with El Futuro, because, you know, and also obviously Alliance and also Carolina Outreach, because as you know, and we've been communicating, and I have more things to send you about the crisis with behavioral health providers in this country, and especially of culturally competent or, you know, providers of color. That was talked about in the summit. So, yeah, just and wondering if we'll be able to do telehealth, and do you think that the places of worship, like, will they offer like free or reduced cost spacing. I mean, maybe I'm getting too in the weeds already, but this is the way my brain functions, is like I can't help it.
Well, thank you for that, Vice Chair Jacobs. And, I'm shaking my head, nodding. Those questions are all important. The first question I believe you asked was, would there be any federal funding coming? Certainly hope so. I certainly hope so because, we have a national crisis, a national public health crisis, and there are conversations happening, obviously, at the federal level, and we will be on the lookout. I'm looking at Dr. Sowell. We will be on the lookout for those opportunities because I think we're really well poised in Durham to apply because we do have strong partnerships, community and faith partnerships, and because I believe, that we were really ahead of that, noticing the board, noticing that, hey, what are we going to do about this? So I think we're poised for that. And we have, again, really strong partners. The other question you asked about is, what would it look like? And I certainly didn't have time to talk about what would that look like if we did operationalize this hub or space. But you're absolutely correct. Those partners would allow space, and we would need, a fiscal agent, someone to oversee the work, agreements. It's all possible. It sounds hard and long, but it's possible. And we have models and approaches that we could follow that others have done and been successful. And you had a few other questions. I'm sorry, I didn't think.
That's okay. I was asking about the telehealth, and I think it's a great idea because kind of like what we're doing with the whole schools, making sure we have resources in our schools, in our faith we want to go where people are at and where they feel comfortable. And the big thing, of course, is the stigma.
Absolutely.
Trying to address the stigma.
And part of this conversation locally is about telehealth, part of having also a unified system for those appointments to connect with licensed professionals, and the telehealth piece was certainly part of that conversation. So, yes.
Yes, thank you for the presentation, and thank you for doing this work. I really appreciate the focus on, innovative ways to try to do a better job with being sure people are having their mental health needs addressed. I do feel like 5 to 7 seems like a lot to start with. I don't know how others are feeling about that, but there seems like there's a lot to figure out, and I'll be sure we, do it really well. So maybe a smaller focus. That's just my initial reaction to the number. Make sure we're working with Alliance. I just wonder how tight the partnership is there, and also Lincoln. And I couldn't also help but think sometimes when we're trying to be innovative, we think about the flavor of the month or starting something new when we have some things that are working, and maybe we just need to expand those or invest more heavily in some of those. Along that line, I just really believe that it's great to work through a system like the faith-based system, so that's, a systematic approach, which I always endorse. I think we need to do more with our school-based mental health here in Durham, our school-based mental health services, and the whole school approach, and using our schools as hubs for services. And there are opportunities to expand there either in addition to this or as a primary focus. So this was informational, and those are just my reactions. Thank you.
So thank you, Ms. Pierce, for your presentation and the research and the information that you bring before this board. This is an idea. This is not just an idea that has been thought up. This is very effective, and there's websites that I can get to the board out of Mecklenburg County that they're being very effective in this model. And the thing that I think about and I hear from a clergy in this community is that we don't use them. We don't allow them to participate with us. You know, they have their little cocoon, and what the folks in Mecklenburg County talked about is how they were able to work with the pastors, which are able to get to more people, get to more children. When we talk about keeping our children in the community and keeping them healthy and whole, there's just some parts of our community that will not come to the systems that we set up. But when they have services in their community, they have access in their community, they're more prone to take advantage of those services. So this is, it's something that I really hope the board will entertain to get all the information they need, because mental health is one of our top priorities. And if community-driven mental health is so needed. And when you see that it's happening in other communities, Durham can do it. And we have partners that are ready to invest. I've been having conversation with different entities, and it's not that Durham has to finance the whole thing. So we've got partners here. We just wanted to present it to you today so that you understand what's happening, the conversation that's happening. If you have questions, get those answered, and then it'll come back to you at another time. Yes.
I just wanted to follow up on one point that Commissioner Carter made, since I'm on the Lincoln Board of Directors, and she has a really good point. I didn't realize until I got onto the Lincoln Board how many community-based clinics they have. And just to list some of the locations, Hillside, Holton, Lyon Park, Walltown, and we're opening a new clinic at Lakewood. And there's the Recovery Response Center. They operate clinics all over the community. So also looking at how we may be able to strengthen those, because people do feel comfortable going to the community clinics at Lakewood. That Lincoln runs that are in the community. So good point. Thank you, Commissioner Carter.
And thank you, Vice Chair Jacobs and Commissioner Carter, for sharing that about Lincoln. I had the pleasure and honor to serve for 2 years on that board, and I agree with you that they have several clinics that people aren't aware of, or the general public, and partnering with Lincoln Community Health Center is key in our community. Thank you.
Yeah. And you can do, the model also talks about the churches, but also community centers, to be able to use community centers as well. So so I hope you'll go online and check out the model.
Chair Harrington, if I can just say one thing, and this is not to generalize black churches, but I want to say another important reason for this to be in a faith-based institution in the black community is because historically, black churches have not made it okay for people to seek mental health assistance. And so to have this as a part of the conversation in a black church, it helps people to be more receptive to accessing mental health services. Just wanted to make that point. Yes, ma'am. Absolutely.
In addition, part of this project or work is to apply mental health first aid training to congregations and leaders. And also, faith is inclusive of, they're saying faith leaders because it's across an ecumenical approach.
Okay. Any other questions?
Okay. Thank you very much. We'll come back. It'll come back at another time. All right? All right. Let's see. We are down to a next item is, okay, which one is that? The 230158, proposed name change for the Criminal Justice Resource Center. And Gudrun, I see, is here. Want to do the introduction?
Good morning, Madam Chair. Good morning, Madam Manager, Commissioners, Mr. Attorney. Thank you for giving us a few minutes. We don't have a presentation. We just have a brief proposal to you. But before we get started, Roshana will present this item, but I want to introduce you to Roshana because, you know, COVID kind of changed everything, and so many of you have not seen Roshana ever, or at least in the last 3 years. So this is Roshana Parker. She is the Assistant Director at the Criminal Justice Resource Center. So
Yes,
thank you.
It's been a while. It's been a while. Good to see you.
Good to see you too. Good morning.
Good morning.
Thank you for having us this morning. So as Gudrun mentioned, we don't have a formal proposal, but we do want to talk about the possibility of changing the name of the Criminal Justice Resource Center. The Criminal Justice Resource Center back in 1999 started out as a day reporting center with some wraparound services. And since that time, the center has definitely grown, and our mission has changed over the last 25 years as far as the services that we provided. So we want to broaden the scope of what we're doing, not just saying that we don't want the name of the location to stigmatize individuals that would then be prevented from receiving services or seeking services. So we want it to be more inclusive and more welcoming to those individuals that we're serving. So we think that the name Justice Services Department is more inclusive and not stigmatizing, because we don't want individuals to feel that as soon as they walk through the door, they're being labeled. And so we really want it to be reflective of what we're doing. And also the term center really focuses on our location at Main Street. But the Criminal Justice Resource Center provides many more services across the county. We have services in the Durham County Detention Center. We have services in the Durham County Courthouse, and then we have services at our main location. So we really want to focus on service provision and not just center. So although we would we would keep the center at Main Street as a center, but maybe change that name to Justice Services Center and not just criminal justice. So again, the reason why we're bringing this forth today is because the partnerships we have developed over the years with other agencies in the county and the city that provide services for justice-involved individuals, we all are having the conversations about being more inclusive. And so we think that inclusivity starts with a name change. We took this item to the Criminal Justice Advisory Committee back on January 31st. Commissioner Alon was present at that meeting when we discussed the possible name change, and the proposal received unanimous support from the Criminal Justice Advisory Committee. So they welcomed trying to do something that would make us seem more inclusive of the individuals we're serving in the community.
We have reached out to some of our internal departments to ask what the impact would be. We want to chisel off the criminal justice on our sign outside, but everything else is really just an electronic change. Letterhead, Commissioner Alam has her hand up. Letterhead and everything is digital, so it will take some work, but we're proposing that this change, if you agree and if you support it, would be effective July 1. That way we can close out this fiscal year with the current name, and then have a new budget and work through finance and all the other internal functions to make sure that we have sufficient time to make this change adequately.
It's quick.
Yes, ma'am. We're trying to get you back on track.
Quick. Commissioner Alam?
Yes, thank you so much. And yeah, I just want to echo and elevate that this is really in line with the people first language resolution that we passed several months ago. And I really hope that our board will be supportive of this because it will open up the doors of just the way our community sees the Justice Resource Center and the services that are available for residents across Durham.
Commissioner Carter?
I couldn't agree more with what Commissioner Alam just said, and I think the proposal, it makes such good sense. I remember when I was new commissioner and would hear about CJRC, Criminal Justice Resource Center. It's such a gem in the service provision of Durham County, which is so accurate. But criminal just sounds punitive, and it's the opposite, total opposite of that. And so I was confused by the name, as an incoming commissioner, and I just think I'm surprised no one has suggested it sooner, honestly. I think it makes such good sense, and I'm 100% behind your proposal today. And I think we should also think about this when we reopen the youth center, Youth Justice Services Center or something, but, nothing related to criminal. So great job. Thank you.
I, again, agree with my colleagues. And Commissioner Carter actually started out the same way I was. I was going to say I couldn't agree more. It is in line, and I do think that language matters. Words matter, especially since, we've used this facility as a polling place, right? And so then you think to yourself, if I'm a senior or if I'm somebody else and I'm like, I want to go vote, let me list which one I'm going to go to first, right? And that might not be the first one on somebody's list. So I think, this is it's a place where I've been to vote. It's a place where people in my community vote. I think it's more welcoming, and I do think it does take away the stigma, because when you become formally incarcerated, you want to really start to take on that moniker of being formally incarcerated and to walk into a space that is labeled criminal. Even you yourself, who are now no longer incarcerated, you now have to put on that cloak again. So I hate that Perry is not here, but I don't. We just gonna get him to get us a new sign. Instead of closing it off, he left too soon. We gonna come to Perry and say we need a new sign. Thank you, lady. Okay, so hold on. We don't have to pay for demolition. Commissioner Carter says somebody get that in right, and she looked real strong down there. But thank you, ladies.
We were going to come at night and just, with a little tool.
Commissioner Jacobs?
Ditto on what my colleagues have said. And I just also want to use this time to really recognize the incredible work, Gudrun, Roshana, of you and all of your staff, because the vast array of programs and services that you all offer, is really incredible. Just reading the agenda action form and, everything that you provide in the community, but also the way you operate is so much based on collaboration and integration. You are modeling it, working in the court system, working in the detention center, partnering with nonprofits like the Religious Coalition and providers in the community, partnering with the city. You are really modeling what everything that we need to be doing. And you also apply for a lot of grants, and you get a lot of grant funding. And you're saving us money. So all of the program, so many of the programs end up saving us money. They're cost effective, like the pretrial release program. Of course, everyone who doesn't recidivate, the diversion courts. But anyway, I just want to really thank you all for your great work. And wondering, you're saying, my one question is, you said that you want to just call the building the Resource Center, not the Justice Resource Center. So could you explain how people will refer to the building itself?
We're thinking to name it Justice Services Center
Oh, Justice Services Center.
in line
Okay.
with the Justice Services Department.
Okay, so Justice Services Department, Justice Services Center. Sounds great. Thank you.
Okay. Doesn't seem to be any other questions. Thank you so much. And, you know, I miss being on your board. Was it 12 years I served on that board? Yeah. So I miss being there. But I know you're still doing the great work, so thank you. All right.
Madam Chair,
Yes.
this wasn't asked, but I know this is a name change of a program, and it's not the naming of a building pursuant to our renaming policy. I just want the record to reflect that. I think this is my understanding within the sort of general power of the manager to run the operations. It's not a honorific or something like that, or something that requires your vote. So I just wanted to kind of express that if anybody had a.
So we don't need to vote on it. We just say, okay, you just go do it. The manager go do it. Tells you to go do it. Okay.
And I am in full support of it. Just
All right. So you got what you need. You're welcome. All right.
All right, now we have a presentation 230132, Durham County Gun Safety Team presentation. And this is presentation from the Durham County Gun Safety Team has been in operation since 1999, established through a resolution from the Durham County Board of Health. The gun safety team works to reduce the number of deaths and injuries from firearms, especially those stored unlocked in homes. And we have our presenters here. Ms. Donna Roser. Rosser, is it Rosser or Roser? Rosser, okay. Inquiry Prevention Public Health Education Specialist. And we're going to have our health director to help us out, too. Great.
As she gets ready, just want to say good morning to you all again and just let you know that so proud of all the efforts that have come as a result of this award-winning gun safety team. We have been really the model for the state, if you will, in that most recently with the white paper being published by Secretary Cody Kinsley.
Rod, I know you can talk louder than that.
Again?
I know you can talk louder than that.
I can.
Come on.
But
make me have to strain my ears here.
I'm sorry. But with the recent white paper that was created at the direction of the governor, they did ask Durham County to come at a roundtable convening. I want to say this was toward November, and Durham County was proudly represented by Willa Robinson, and they're just recognizing the fact that we go from county to county, training other gun safety teams. Most recently, we've been in Hope County, and again, so proud of the work that we've been doing since 1999. So just wanted to tee that up and pass it on to those who are able to better articulate the finer points of it.
Okay.
Thank you, Madam Chair.
All right. Thank you.
Good morning. I'm Donna Rosser with Durham County Department of Public Health, as was mentioned before. And I'm an injury prevention health educator with Director Jenkins' shop. And I am also a part of the Health Promotion, Chronic Disease, and Injury Prevention program of health education and community transformation. I also chair the Durham County Gun Safety Team since June of 2019. And I have with me my program manager, Willa Robinson Allen, as well. Can you all hear me okay?
You could pull it up a little bit closer. Yeah.
Is that better?
It's better.
Okay. Okay. So, just wanted to share a little history of the Durham County Gun Safety Team with you. In 1999, the Durham County Gun Safety Team, or GST, was named a county program, was established as a county program through a resolution from the Durham County Board of Health to address the issue of the rising trend of, I'm sorry, just need to. Okay. To address the rising trend of deaths and injuries of children where firearms are in the home, unlocked and loaded. I knew this was going to happen. I'm sorry. Running into some technical
It's all right.
difficulties with my screen reader. Just gonna
All right, take your time.
see if this helps. Okay. So I was back with the history of the gun safety team. In 1999, the Durham County Gun Safety Team was established as a county program through a resolution from the Durham County Board of Health to address the rising trend of deaths and injuries of children where firearms are in the home, unlocked and loaded. Yeah, it's not.
So the mission statement for the gun safety team is to reduce death and injury related to firearms through broad-based and preventive strategies to promote a safe, violence-free environment for our children. Who we are and what we do. The gun safety team is an interdisciplinary, apolitical community group of partnering agencies and concerned citizens, led by the Durham County Department of Public Health. The team works with partners on education and public awareness initiatives in an effort to increase the safety of children and reduce the incidence of gun violence in all its forms in the community. Just a few of the team members include several partners that spoke here today: Alliance Health, Bull City United, Criminal Justice Resource Center, Duke Children's Primary Care, Duke Health, Trauma Services, Duke Violence Recovery Program, the VA Healthcare System, the County Department of Social Services, of course, Public Health, Sheriff's Office, Durham Housing Authority, Durham Public Schools, Inside Human Services, North Carolinians Against Gun Violence, Project Build, and the Religious Coalition for Nonviolent Durham. The team meets on the fourth Wednesday of each month from 9 to 10:30 a.m. Some of the first gun safety initiatives included the following: safe storage of firearms messaging, distribution of free gun locks, and the Asking Save Kids, which is ASK, campaign. Safe storage of firearms reduces unintentional death, injury, and hospitalization. Additionally, when firearms are stored safely, they are less available as a means of suicide, unintentional shootings, or intentional harm to others. And this is especially true for children and youth. With regards to the NC Safe Storage Law, the team provides information on safe storage of firearms during events and tons of educational sessions. In addition, the distribution of gun locks. So to date, the gun safety team has distributed approximately 25,000 free gun locks in this community. They were originally provided to the team from Project Child Safe. Safe Kids Durham used grant funding to provide gun locks to the team as well. Now they're provided mostly through the Durham VA Medical Center.
Say that in the beginning when the gun safety team was established, from my understanding, it was required by the Board of Health that law enforcement be a part of the gun safety team because they were the only entities that Project Child Safe would provide free gun locks to. And so there were a lot fewer gun locks that we were able to offer at that time. But over the years, we have been able to offer more, and now we have an unlimited supply of gun locks that we can provide.
Firearms in the home. Firearms are the leading cause of injury-related death in children and teens. 1 in 3 homes in the U.S. has at least one firearm. 4.6 million children live in a home where firearms are unlocked and loaded. However, more than a third of the unintentional shootings of children take place in the homes of their friends, their neighbors, or relatives. That's why it's important to make sure that kids are safe when they spend time where other people live. The Just Ask campaign, which is now Asking Saves Lives, was first established by the American Academy of Pediatrics in 2000 and is currently administered by the Brady campaign. This initiative encourages parents to ask about firearms in the places where their children visit and play to make sure that they're properly stored, locked, and unloaded with the ammunition separately stored. And it's been a part of the gun safety team educational initiatives almost since the team's inception. This slide here shares a little bit about some of the spaces where we've done education and then also where the gun locks are provided. So corporate public health fairs, schools that also have health fairs, activities in the PTAs, civic organizations, healthcare clinics, religious and faith-based communities, child care centers, and also neighborhood events. The program, the healthcare provider program, started around 2014, where the providers asked their patients and families about storage of firearms in the home as a part of a preventive strategy assessment. Based on the Durham County Gun Safety Team health model, DUTE, to date, there's roughly 20 health clinics in 7 counties that are providing this service. Sharing of a few recent activities, we still call this recent, but the Skills and Knowledge of Injury Prevention Partners, Skip. In the fall of 2018 through spring of 2019, the UNC Gillings School of Global Public Health worked with us, and it was a project that was supported through a grant funded by the John Rex Endowment. The goals were to create an implementation guide that could be replicated in any county. And this guide, of course, was produced by Durham County Gun Safety Team, and it's been used throughout the state. In fact, it's housed on the State Health Department's webpage. And so the other goal was to start an Orange County Gun Safety Team based on this very same model. We're very proud that several other counties have just used this guide alone to start their gun safety teams.
There was no other gun safety team in North Carolina until 2019 when the Orange County Gun Safety Team was formed. In 2021, Pitt County formed their gun safety team using this guide, and in 2022, Hope County started their team using this guide, and now, as Willa said, lots of other counties are.
In 2021, we received the Comprehensive Suicide Prevention Grant. We were awarded about $200,000 for the implementation of the strategies. So part of the deliverables was to develop a curriculum for virtual and in-person trainings for a minimum of 5 counties to establish their own gun safety team based on the Durham model. As of November 22, we completed the very first one. It's a 5-series workshop. We met our goal, 7 counties, and we had 10 waiting. And so we're in our second one now. And we also were to hire a part-time coordinator, and we were able to do that. So our next steps include continuing to expand Durham's gun safety team, but also to work with additional counties. And we have had wonderful support from our leadership to be able to do just this. We hope to also provide a campaign around gun safety in Durham. This brings us to responsible gun ownership. In January 2021, gun safety team member Jim Stipe mentioned the need for the gun safety team to consistently educate the community on responsible gun ownership. So he mentioned during that time, the 2020 report felony possession of a firearm jail bookings in Durham. 1 out of 4 booked on this charge in possession of stolen firearms. The stolen firearms were ending up in the wrong hands, resulting in increased suicide, homicide, and other shootings. It also brought up the importance for the community to lock their vehicles when they have guns in them. And also a better way to secure those guns while in the vehicle. From Sergeant Michael Beal of the Durham Police Department's Community Service Division. In data obtained from the Durham Police Department, January 1st through November 26th of 22, there were 331 cases of one gun or multiple guns being stolen. In 56% of those cases, guns were stolen from the cars. In 62% of those instances, the car was unlocked, meaning these are highly preventable crimes. So as part of the campaign that we're committing to establish, the team wanted to develop a multimedia campaign to emphasize information and increase of community awareness and to address this very same thing. So that campaign may include radio ads, social media, PSAs, and then a content creating contest and informational skits as well. So additional recommendations.
So, some additional recommendations that, wait a minute, did you already cover the multimedia campaign? Okay. So I just wanted to go over a little bit of that. The gun safety team had a discussion about what we would like to do. And we were thinking about doing this multimedia and social media campaign. And one of the ideas that we had was to use some local celebrities that would appeal to the younger population in Durham. When I'm talking about younger, I mean young adults who may be gun owners, to promote community awareness and encourage them to store their firearms safely. We also wanted to appeal to people who are not necessarily young adults, but would like to, I mean, you know how it is. A lot of times we like to see people that we know in commercials, in campaigns, in PSAs, whatever. And so it was suggested that perhaps members of maybe the sheriff, the county manager, Board of County Commissioners, City Council could star in PSAs where they share safe storage of firearms messaging, especially messaging around prevention of theft of firearms from vehicles, to be included in this campaign as well.
Additional recommendations discussed lockbox distribution, which is a standard that's recommended by law enforcement. And then the mass media campaign. And Donna just mentioned that. All right. So there were recommendations made from the Durham City Council members to reduce violence in Durham. And I just want to share some of these. Many you may have heard of already. But significant investments in HEART, increased city funding for Bull City United, increased 911 operator pay, affordable housing, education to better engage and enrich our youth, and the infrastructure so that our neighbors can walk, bike, and take transit. All of these are being worked on, and there's so much more, of course, that we can do.
Is in support of these recommendations. So I did want to also mention the name change for the Durham County Gun Safety Team. There, we noticed that there's been some confusion over the years, and we have people calling us to find out if they could get classes on firearms training, not safe storage of firearms, but how to use firearms. And what we discussed in our most recent, in our previous iteration of our gun safety team training, was that we should probably change the name of the team to one that more reflects what the gun safety team actually does. And so we took a vote and we decided that the name of the gun safety team should now be the Firearm Injury Prevention Partnership. So that is the name that we are using now. And just wanted to just run through the Durham County Department of Public Health staffing for the gun safety team. And that's going to be yours truly, Donna Rosser, Health Education Specialist, Giovanna Rosario, who's our Comprehensive Suicide Prevention Coordinator, and Willa Robinson Allen, our Program Manager for Health Promotion, Chronic Disease, and Injury Prevention. And before I take any questions, I want to thank Commissioner Jacobs for inviting me to share information on the Firearm Injury Prevention Partnership and to share recommendations for addressing firearms stolen from cars and vehicles. Questions?
Thank you. Thank you for your presentation, and it's good to hear the work you're doing. Appreciate that. Because we all know we do have a problem with gun safety, that our young people, that our children have such easy access to guns. It's not healthy for our community, it's not healthy for our babies. So thank you for the work that you're doing. Commissioners, questions, comments? Commissioner Burns?
One, thank you ladies so much for coming in today. Donna, I get your emails. It's finally nice to put a face with a name. I do want to, I love I love all the ideas you have. I want to congratulate you all of being a beacon, 20 years of doing something, and then that you all get grant money to teach everybody else how to do it. I love that, right? 10 on the waiting list, pretty soon there'll be none on the waiting list because we will have covered everybody and we will have played our part in making, North Carolina a little bit safer. I do know that my colleague, along with the sheriff, often brings up how many guns are actually stolen out of cars, and it is a real problem. And I do remember last year when our sheriff and our public health department got together and they were giving out gun locks. But I'd like to throw out a little idea. Not too long ago, I was at Hillside High School, and they had a presentation day. And the presentation day was in the larger foyer. And I walked around, and I might get the number wrong, but I don't think I will because I did not get to every presentation. But there were at least 3 student groups that did presentations on gun locks and gun safety and gun cases. So as you all seek to figure out what celebrities you want to use, I'm telling you right now, they are at Hillside. So I know you saw me typing. I actually took pictures with the kids, took pictures of the presentation. I think they wanted to ask the county commission for $10 million to buy gun safety cabinets. And I said, have y'all heard of locks? And and so I had to take out my phone and kind of sort of explain it to them. They said, well, okay, that costs. I said, yeah, the cabinet was like bigger than me, so these are kids who do, but they get it, right? And then there was another set of kids that were talking about gun safety, and that was in one of their recommendations. And then there was another set of kids, and it was in their recommendations. So I would just say, this is an issue that they are acutely aware of. So as you're doing your multimedia campaign, there are some beautiful boys and girls that I think could add a lot of credence to this work, and I hope that you will add them to your campaign. And I do have, their pictures are on my social media, so I know that parents are okay with it. If you all are okay with it, I would love to share their names. It was a group of Latinx girls and a group of black boys, all athletes, but all acutely aware of the fact that guns are a big issue in their community. So if y'all are open to that, I would love to share that.
Absolutely.
Thank you. Commissioner Jacobs.
Thank you so much, Donna and Willa. And I will just say that Donna is a rock star. She is also our staff person for Durham Joins Together to Save Lives. And I've had the privilege of working with Donna for a long time. And I kept seeing Donna and her team at community events. Book Harvest I saw you at. I saw you at the Recovery celebration at Central Park. I've seen you many places, and really was pleading with her to come report to us because, again, this is another, little engine that could. But we have, such a crisis going on, and I have to be honest, I am sick of sitting in, gang intervention meetings and violent crime roundtables for 6 years now and hearing people talk about the guns getting stolen out of the cars. And I really want to know, Donna and Willa, do you have enough funding to do an adequate campaign? Because, we need an all-out, robust, fully funded, adequately funded community awareness and education campaign. So, you know, I would like, county manager, if we could make sure that we are making sure that they have all the resources that we need. We did this with Back on the Bull. We provided extra funding. We had billboards. We had a lot of radio ads. And I think you're totally on target with using social messengers, celebrities. Commissioner Burns had a fantastic idea. We don't need county commissioners. I'm sorry, guys. We're not going to have any influence.
I will be in the commercial. She's speaking.
Okay, Commissioner Burns can be in it. But I just think, you know, and I just want to make sure this is important. If we have, I think the number is something like 800 guns getting stolen out of cars, and most of the time they're unlocked. This is something that we can do something about, but we have not had an adequate campaign around it, and we need to get everyone involved. So I'm thinking about, you know, Durham Public Schools, PIO, the city, the county, of course, public health, the police, the sheriff. We've got lots of great PIOs, but we need to have, you guys need to have the funding that you need. And I just, there's nothing more important really for us to spend money on. So we're coming up with our budget, and if you need extra funding for this, please don't be shy. And also, do you have enough funding for gun locks and for the boxes?
So, gun locks, we have an adequate supply of gun locks, but lock boxes, which are the gold standard as far as law enforcement and gun safety experts are concerned, we do not have the funding for it, and would like to be able to add that to our interventions. Once upon a time, we didn't have enough gun locks. They were hard to come by, like when Project Child Safe was providing them. There was a limited supply, and now we have, plenty of gun locks. We could put gun locks in every Durham public school if they wanted us to. But lock boxes, we would like to be able to provide.
Well, that sounds like maybe a possible use of ARPA funding, because it's a one-time cost and it ties into what we said we wanted to do around reducing gun violence. So ask us, put a proposal.
Appreciate that, Madam Vice Chair, and Madam Manager. You will have that submission to you in due course.
Thank you. And I also was wondering about with your partnering with healthcare providers. I think that's so important. I was thinking about Lincoln, our pediatric clinics, and even our Child Care Services Association and Durham Pre-K. Just any way, you know, let us know if you need extra support, because this is just so important, and we can do something about this. Thank you.
Again, thank you so much for your presentation, not just your presentation, but thank you for the work that you do daily. Appreciate it. Okay, thanks, Rob. Okay, we have another presentation. It's 45 minutes. Why don't we go ahead and do that one, and then after that, we'll go to lunch.
Brenda, can I say something real quick about the guns? This is Heidi down here.
Oh, I'm sorry.
That's okay. Well, and Donna, before you all leave, I also just wanted to thank you so much for your important work. It is critical, and I agree with Commissioner Burns and Jacobs that we should pull out all the stops on the campaign. And I also think that the clinics, you do clinics, more of them need to be on board. There wasn't nearly enough. You know, that should be an easy one right there. Get them all doing it, for God's sake, right? And I also want to thank you because I think that this is an example of public health's work. In the same way that we in this country made inroads against, episodes of violence with other dangerous objects like cars and cigarettes and alcohol even. there were public health campaigns around all of those that made a difference. And it's a long slog, but these broad-based efforts, it may take a long time, but it's what we have to do, especially when, I know your work's not political, but your task is almost Sisyphean in a sense, because you're up against a lot of political challenges that prevent us from putting restrictions on who can have a firearm. That's what we need to do. The same way we restricted access to cars. You have to have a license. You can't drive until you're 16. We need to do more of that with guns. And if there's anything, that's part of your work that we can do around political issues like that, advocacy, I would like to hear more about that as well, because I do think that that's needed to really enable your work to flourish and make a difference. Thank you.
Okay. I'm sorry, Commissioner Carter, I didn't see your hand. So the next presentation is the review of the 2020 City-County Residents Survey results. And Deborah Craig Ray is here, our Chief Communications Officer. And is Jason here? Okay, so he's going to be, okay, so he's going to be on screen? Okay. Good morning.
I think it's important that we know that we have received some good information, and we use this information in our planning for our departments and our budgeting. We see where we're strong. We see where there are areas that we need to fortify. And so it's always instructive when we get this. So, Jason, I'm going to introduce you and let you go ahead and move quickly through the presentation as I've been asked, and the board will ask questions on the other side. Good morning, and thank you, and welcome.
Okay.
Yeah, sounds great. Are you ready for me to ready to get started?
Ready.
Okay, thanks. My name is Jason Morado. I'm with ETC Institute, and we're a marketing research firm that specializes in conducting community surveys for local governments. And we just finished for the 8th time conducting a resident survey for Durham County. So today I'm going to go through the results of the survey. The full report is very detailed and comprehensive. So today I'm going to walk through the key findings at a fairly high level. Next slide. So ETC Institute, I just have one slide about us. We're based in the Kansas City area, but we're a national leader in providing market research for local governments. We've been doing this type of work for over 40 years, and in the last 10 years alone, we've conducted surveys in more than 1,000 communities across the country, and that includes a lot of work throughout North Carolina. So this is really the type of work that we specialize in. Next slide. This is just a quick rundown of what I'll go through today. I'll go over the purpose and methodology of the survey. What I call the bottom line up front are our main conclusions from the survey, and then I'll go through the major survey findings to show how we came to those conclusions. And of course, I'll be happy to answer any questions as well. Next slide. So there are several reasons to conduct a survey like this. One is to get an objective assessment of how satisfied residents are with county services, and to determine what residents feel are the top priorities for the community. We're also able to measure trends from your previous surveys. Each year we change a few of the questions a little bit, but most of the questions remain the same so that we can measure trends over time and so that we know what residents' current priorities are for the county. And then we're also able to compare your results with other communities across the country. Next slide. So I mentioned this is the 8th time we conducted the survey for Durham County. We've been doing this every year since 2015, and it's a city and county joint survey. So we're surveying city and non-city residents in the county, and then the question focuses on both city and county services. We administer the survey by a combination of mail and online to randomly selected residents throughout the county. Our goal is to receive at least 800 completed surveys. We had a very good response. We ended up with almost 900 completed surveys. And the results of the 891 completed surveys at the 95% level of confidence has a margin of error of plus or minus 3.3%. Essentially, this means that if we conducted the survey the same way 100 times, 95 times the results would be plus or minus 3.3% from what we're reporting. So even for a statistically valid survey, the results are never perfect, but the margin of error is very small. Next slide. So one of the types of analysis we provided is we broke the results out by geographic area. We broke the results out by residents who live in unincorporated Durham County. And then for city residents, we broke the results out by PAC areas, Partners Against Crime. One of the reports you provided shows the results for every question on the survey, asked on a 5-point scale, broken out by these areas. So there's over 100 maps in that report. There's just a few that I'll go through today. And as we were administering the survey, we made sure we had a good representation, not only geographically, but also by key demographic areas, such as race, ethnicity, age, and gender. Next slide. So here we have a map of the county. The red dots are households that completed the survey. So we had a good distribution throughout the county. And this is similar to the distribution we've had in your previous surveys. Next slide. So here are our main conclusions from the survey. We found that residents have a positive perception of Durham County. Over 80% feel Durham is an excellent or a good place to live. 77% are satisfied with the overall quality of life in their neighborhood. Overall, the satisfaction ratings this year are similar to last year's survey. In a little bit, we'll look at some of these specific areas that had the biggest increases and decreases in satisfaction compared to a year ago. But when you look at the overall level, it's similar to last year, which is a good thing. Most communities that we've surveyed recently have had more decreases than increases over the past few years on their survey. We also compared your results to other communities across the country. One of the things that really stood out is that you rated 12% higher than other large communities for the overall quality of county services. And that's one of the most important questions on the survey, because they're asking residents to take into account all the services that you're providing and give an overall satisfaction rate for how well you're doing. Another area that really stood out, and this is one of the areas where you rated among the farthest above other communities, is customer service for county employees. You rated 26 percentage points above other large communities in customer service for county employees. Next slide. So the top overall priorities for the community include public schools, affordable housing, police protection, street maintenance. And then the top priorities more specifically for county services were public schools, sheriff protection, and the Department of Social Services. Next slide. So first we'll look at some general perceptions that residents have of the county. Next slide. So we asked residents to rate their perceptions of Durham in a number of ways. The dark blue ratings are very satisfied, light blue is satisfied, the gray is neutral, and we interpret neutral as average or meeting expectations. It's a rating of a 3 on a 5-point scale. And then the light pink and dark pink are those who are dissatisfied or very dissatisfied. So overall, there's more blue than pink, so the positive ratings overall by far outweigh the negative. If you look at the top of this chart, most respondents are satisfied with the quality of life in their neighborhood. And then if you look at the fourth row down, 54% of respondents are either very satisfied or satisfied with the overall quality of services provided by the county. And that's compared to only 11% who are dissatisfied. So you've got about a 5-to-1 ratio, those who are satisfied versus dissatisfied, overall quality of county services, which is a very good ratio. Oftentimes that ratio is more about 4-to-1. Next slide. Here's some more perceptions of the county. Again, overall, the positive ratings far outweigh the negative. You look at the top of this chart, over 80% of respondents rated Durham as an excellent or a good place to live. Most respondents also gave positive ratings to Durham as a place to work, as a place to visit, as a place to play, and as a community that values the diversity of residents. Next slide. This was the very first question on the survey. Here we asked residents how satisfied they are with major categories of city and county services. So again, overall, the positive ratings far outweigh the negative. There's a lot more blue than there is pink. The highest rated areas are library services, fire and EMS, water and sewer, parks and recreation, customer service from employees, and public health services. The only areas that had more negative responses than positive were schools, and then a couple of transportation-related services such as streets, public transit system, pedestrian facilities, which include sidewalks. And that's similar to what we've seen on your previous surveys. Next slide. So we also found that satisfaction with the overall quality of county services is high in all areas of the county. Next slide. So I mentioned earlier that we broke the results out into these geographic areas. There's over 100 maps like in this report, like this in the full report. So just a few we'll take a look at. This is for the overall quality of county services. And you can see the entire map is blue, which means that residents in all of those areas are satisfied with the overall quality of county services. This means you're doing a good job providing services equally throughout all parts of the county. Next slide. This map is for the overall quality of life in your neighborhood. Again, the entire map is blue, meaning that residents overall in each of these geographic areas are satisfied with the overall quality of life in their neighborhood. Next slide. And this map is for how residents feel about Durham as a community that values the diversity of residents. And again, when we break it into those geographic areas that I mentioned earlier, in each area, residents are satisfied with Durham as a community that values the diversity of residents. Next slide. So we also compared your results to other large communities, and overall, these results are very, very positive. Next slide, please. So for these next two charts, the dark blue line are Durham County residents who are either very satisfied or satisfied, so they're rating them at 4 or 5 on the 5-point scale. And then the green are the satisfaction ratings for residents in large communities across the country. And by large, we mean communities with a population of at least 250,000 residents. So this first chart's for major categories of city and county services. And you can see in each area, your ratings are significantly above other large communities. That includes library services, fire and EMS, water and sewer, parks and recreation. And then customer service is one of the areas where your rates the farthest above the communities. 59% of your respondents were satisfied with the customer service they received from county employees. The national average for other large communities is only 33%. So you're nearly double that. Next slide. When it comes to sheriff protection, your ratings are a little above the national average. Your ratings are farther above when it comes to communication and codes and ordinances. The only areas that are rating below other large communities are public schools and then the public transit system. And again, this is similar to what we've seen on your previous surveys. Next slide. When we Here are comparisons for perceptions of the community. Your ratings are similar to other large communities when it comes to image, appearance, and then management of development growth. You do rate almost 12% above the national average when it comes to customer service, overall quality of county services, which is this top row. And again, that's one of the most important questions on the survey because they're asking residents to take into account all the different services that you're providing. Another area where your ratings are significantly above the national average are the value received for local property taxes. 39% of respondents were satisfied with value for property taxes. That might seem like a low number compared to some of the other numbers on your survey, but the national average for large communities is under 30%. So 39% is actually a good number for that question. Next slide. And then here are more comparisons for the perceptions of Durham. You can see your ratings are significantly higher than other communities as a place to live, as a place to work, as a place to visit, as a community that values diversity. About 2/3 of respondents feel that Durham is a community that values the diversity of residents. The national average for large communities is just barely over 40%. And then as a place to retire is another area where your ratings are significantly above the national average. Next slide. So I mentioned that overall, the satisfaction ratings this year are similar to last year's survey. Having said that, this next slide will show the areas that had some of the biggest increases in satisfaction compared to last year. So the ease of travel by bus, the overall image of Durham, the condition of public schools and facilities, library services and programs, yard waste collection, respondents' experience engaging the county government process, and then public health services. And then this next slide shows the areas that had some of the bigger decreases in satisfaction compared to a year ago. Timeliness of response to residents, resolution of issues and concerns of residents. We saw overall satisfaction with customer service is significantly higher than other large communities, but there have been a couple areas where the ratings have decreased a little bit compared to a year ago, even though the result ratings are still very high overall. Other areas with decreases were enforcing traffic safety laws, Durham as a place to start a business, overall communication, condition of parking, and then management of development growth. Next slide. So now we'll look at the overall top priorities for the community. Next slide. So earlier we saw on the first question on the survey how satisfied residents were with major categories of city and county services. As a follow-up question, we asked which of these services should receive the most emphasis from city and county leaders over the next 2 years. So the top 3 priorities are police protection, public schools, maintenance of city streets. Those have been the top 3 priorities for a number of years in that same order. The other most important services were pedestrian facilities, which include sidewalks and sheriff protection. Next slide. Some of you might remember this from previous years. This is what we call the important satisfaction analysis. This analysis is based on 2 different types of data. First, we ask residents how satisfied they are with services. And as a follow-up question, we ask which services are the most important for county leaders to emphasize over the next couple of years. So what are the most important? And the idea behind this is those areas that have a combination of lower levels of satisfaction, but at the same time are the most important, should be the highest overall priorities. So the areas in pink are the highest priorities: police protection, public schools, city streets. The areas in yellow are a high priority as well, but residents didn't rank those as quite as high of a priority as those in pink. So the ones in yellow include pedestrian facilities, such as sidewalks, public transit system. And then in green, you have the medium priorities. Sheriff protection just missed being in the yellow. Now, this doesn't mean that the areas in green don't need attention, but making improvements to areas in yellow and pink will impact the greatest number of residents. Next slide. And then we asked respondents which government services should receive the highest priority for increased funding. And you can see the top two are public school operations and affordable housing. By a pretty wide margin, those are the top two priorities, and that's also consistent with previous surveys. Here, the highest priorities were street maintenance, job creation and training, and the youth program. Next slide. So that's everything that I had. Just a quick recap. We saw that residents have a very positive perception of the county. Overall, the satisfaction ratings are similar to last year. We saw the areas, though, that have had the biggest increases and decreases compared to a year ago. When we compare your results to other large communities, your ratings are much higher when it comes to the overall quality of county services. And then customer service with county employees is one of the areas where you rate among the farthest above other large communities. Next slide. And then the top priorities overall for the community are public schools, affordable housing, police protection, and street maintenance. The top priorities for county services are public schools, sheriff protection, and Department of Social Services. So that is everything that I had, and I'd be happy to answer any questions if anyone has them.
Thank you very much, Jason. And so we've heard a wonderful report overall, and I don't think any of us are surprised. And we're very delighted that we fare very well against other communities similarly sized. So certainly we will take all of your questions.
Thank you. Thank you both for this presentation. And you're right, Deborah, I didn't see any surprises, nothing that made an eyebrow go up. And it's good to see that. And also when the top priorities are the things that we're working on. And it's good to know that we are in the right lane and the things that we're taking on. One thing I didn't see on there is I didn't see mental health mentioned. Did I miss that piece? Because that's an important piece in this community right now.
You are correct. I'm not sure that we actually asked that.
You didn't have that question. The questionnaire wasn't on there?
No, that will be something that will be added to the new one coming up later this year.
Yeah. Trauma-informed care, mental health is a big concern for this community, and I didn't see that on there.
Thank you.
Thank you.
Yeah, we did ask, not directly. We asked about public health services and Department of Social Services, but not specifically about mental health.
Okay, thanks. Commissioners, questions, concerns? Commissioner Carter?
Yes, I just want to first congratulate our staff and say hurrah and how wonderful we are. You know, great services the community believes that Durham County is providing, and great customer service. So both, that's fantastic. And I just really want to thank our staff across the county for being so devoted to providing excellent services and customer service. And I thought it was very curious. We've really been focusing a lot lately on the fact that we're having difficulty filling positions in EMS and some of our sort of first responder type positions. And yet, we scored highly there still as services that we're providing, that people were satisfied with those. And that has happened in the past, but I wondered if maybe we'd slip there, and we really didn't. So we know that the people that are working in those areas are certainly working super hard as well.
They're all rock stars.
They are all rock stars, like you say. Libraries was at the top. That's not surprising. But right after that was fire and safety and EMS. So it's really interesting to me. We have decreases in satisfaction around for public schools and decreases in satisfaction for public transit. Both perhaps, among our most critical services that we're providing, and we're investing a lot in both of those areas, especially public schools and public transit, really, with our transit tax and such. One question I have about that is if we eliminated the number of people who put what's the middle gray area, like you're not sure, or you're neutral maybe. If we eliminated the neutral area And is there any way to ask that question broadly and then ask, are you actually a user of public schools? Are you actually a user of transit? And then see, well, what's the satisfaction rating of people who are actually, using these services? Is that ever done?
Jason?
We do include an option of don't know. And typically those are people who just aren't familiar with the service or don't have an opinion. These charts that I went through today show the results excluding the don't know responses. So these people do at least have an opinion. Now we also could break the results out for younger respondents to see what the results were for those who have kids. We do have a question in the survey also asking the kids who attend public schools and several other questions related to kids in schools. So we could break the results out that way as well. But typically, since we exclude the don't knows, these are people who are at least familiar with these services or at least have some opinion about it.
With schools in particular, I've always read, for a number of years that satisfaction ratings are always higher for families who actually send their children to public schools than for others who do not. So if that one in particular, I would be curious about, especially because, you might say don't know with transit or DSS services, but everybody thinks they know everything about public schools because they've all been to school, right? And so they all have an opinion pretty much about education. So that one in particular, I would be curious. I expect it'll still be among our lower satisfaction ratings, just based on the number of families that are sending their kids to our schools. And anyway, that's one of our main community challenges, honestly, is being sure our public schools are strong, as strong as they can be, and being sure that the strength of our public schools is adequately understood in the community.
I think that's a good point, because I was just thinking about that in the context of, we just had our bond issue, and we did really well in that area. People were very supportive of that funding. Yes.
Exactly. So that's curious to me. It's not a surprise that it's low also because there's been an enormous political campaign to discredit public schools since 2008 at least. It's part of this effort to move towards more funding for private services, privatization of public education. So I always keep that in my mind too when I'm looking at these numbers. But thank you. These are always so interesting, and it will be, I'll be curious to see how we as an organization respond in ways to improve performance even more. Thank you so much.
Deborah, just one other question. I didn't see anything in there about poverty. Was that a question not asked?
I don't believe we did. Now, I'm not sure if it came up. Jason, you can correct me. I know some of the questions were a little different with the city than ours, and I'm not sure if that actually came up, because I know they're actually working on developing their new strategic plan. So they had added some questions around that issue, but I don't recall. And I didn't look directly at the city's results. I looked at ours, so I'm not sure. Jason, you may have a better answer.
Yeah, not really specifically about poverty. What type of question did you have in mind?
Well, we still have a large percentage of people that live in this community that live under the poverty line.
Yes.
And, I mean, if you look at this report, and if someone's looking at it, they wouldn't think that we have any poverty, that everybody is making great money and wealthy and all that.
Right.
And that's not accurate.
Yeah, well, we did include a question that asked the income of households. So one thing we could always do is break the results out by different income levels. Now, 12% of respondents didn't answer the question, which is typical. Some people just don't feel comfortable answering that. But 17% of respondents households make under $30,000 a year. And we asked that all the way up to those making over 100,000. So we can
Yeah.
run across that, break the results out by households of different income levels to see if there are, differences and what the priorities are among different um, types of households.
Yeah, because if you're making 30 or under, that's poverty in this community. Thank you. Commissioner Jacobs?
Yeah, I mean, related to that point, you did ask on the survey about what percentage of your income are you spending on housing, and a key marker of not being economically sustainable is to spend more than 30% on housing. And actually, so that point, it was 30.8% of residents said that they were spending more than 30%. So that's an indicator. And also related to not being able to, you asked not being able to make household repairs, and that was 28.7%. So I would look to those as being good indicators of need in our community. I also want to follow up on what you asked, what you mentioned. I would say, to me, one of the good news takeaways of this is actually the improvement in the trends related to Durham Public Schools, because the 3-year trends, and even from 2017, we are moving in the right direction on almost every single point where Durham Public Schools is improving, actually, related to people's perceptions of the schools. And obviously, we are making the right decisions in our board with prioritizing the facilities needs and school funding, because that's what people say they want. So that was good news to me. Just some of the things that I just wanted to follow up from where what we can learn is, I thought it was really interesting, Deborah, that people said that they get, in terms of what we're doing, that people said they get a lot of their information from Nextdoor, which I know that Randy spends a lot of time on Nextdoor. God bless you, and Randy. And that much more on Nextdoor than on our InTouch, our social media, our Facebook page. So it's just important to see where are people getting their information. And then mailings were much higher than everything else.
We'll be boosting our social media because we're getting some more horsepower, if you will. We have a new person starting on March 20th who'll be adding to our staff, so we'll be able to do even more.
Fantastic. So I guess I do, digging into some of especially the area around customer service, Madam Manager, I'm just wondering, because there were certain areas that we can definitely improve on. And I was wondering what your approach is going to be. What are your thoughts on how you and your team are going to use the information that's in here?
So we'll take the information and dissect it. Thankfully, we have, a great executive leadership team on board now, and kind of develop an implementation plan for how we will approach and address the areas that were trending kind of downward that we need to address.
Sounds fantastic. And I also just want to say, I hope that we're going to celebrate these results, because there really is a lot to celebrate. I mean, here, and also, as Commissioner Carter was mentioning, the fact that we've been able to maintain the satisfaction levels, kind of during post-pandemic when we're so understaffed, is really amazing to me. So I hope we'll take a moment to celebrate. And then also just thinking about what we can learn from here to help inform our decisions around ARPA funding, around the budget. I think there's some good indicators in here as well for us. So thank you.
If there are no other questions, and Commissioner Lum dropped off, so she's not there. If there's no other questions, is it anything else for you?
Just like to thank you all so much for your support, and as we go forward, we certainly will continue to tweak the survey to make sure we're asking the questions and asking them in the right way that will provide the best information for your decision-making. Thank you.
Thank you very much. Okay, commissioners.
Thanks, everyone.
Thank you, Jason.
Yeah, thank
Thank
you.
you.
All right, so we're going to stop now and go to lunch. It's 12:15. We'll take 30 minutes and come back. So we should be back by 12:45.
Are we, all right, we're back. Where's Commissioner Burns? Did she leave? All right, so we're going to reconvene. Since we've got new people that will be presenting, I'm going to repeat what I said this morning to the others. We've got such a packed agenda that we're asking individuals to present when they have, if you have 30 minutes, please don't go over that because I'll call you out. We are trying to keep the time consistent so that we can get all of the things that we've got on the agenda done. So I appreciate your support. Appreciate the board working with me today so that we get through this agenda. If you go right up to the 30 minutes that has been allocated, then I'll have to allow another few minutes for the board to ask 1 or 2 questions and give you 2 minutes to answer. Does that work? Okay, cool. All right. So the next item is 220133, stormwater update. And we already have folks right here in front of us. So Ryan, if you want to go ahead and do the introductions and get started, it'd be great.
All right, thank you, Madam Chairman, Commissioners. Ryan Eves, I'm the Division Manager for Stormwater and Erosion Control. With me I have Annette Lucas from McAdams. Just a real quick introduction, then I'm going to turn it over to Annette. As you hopefully are aware, I know I've had to say it many times, the county is in 3 separate watersheds, the Jordan Lake, Falls Lake, and Neuse River. Each of those have a watershed management strategy that requires us to have different nutrient requirements, different development requirements for new development. We're going to be talking about our new development ordinance today for stormwater. And so it creates a fairly complicated, complex ordinance. What we've done with this project and what we're going to be presenting on are some revisions today that we hope will simplify that ordinance a bit and will make things easier for not only staff but the development community as a whole. To do that, we've hired McAdams to help us simplify, go through a process of revision. And with that, I'm going to turn it over to Annette and let her explain what we've done.
Good afternoon. I'm Annette Lucas with McAdams. I'm the Stormwater Program Practice Lead, and we were very happy to have been selected to work with Ryan and his team to update your ordinance for you. Ryan came to us and said that he and his team had some different objectives for the ordinance updates. So first and foremost was to be compliant with all of the state rules, and in Durham County, that's a lot of different rules. You have Neuse, you have Jordan, you have Falls Lake, and you also have water supply watersheds. We also wanted it to be clear, concise, and well organized. They shared that sometimes it was hard for their development community to understand everything they had to do because of all the layers. And then in addition, the ordinance updates were to encourage green infrastructure, and I'll explain what that is, as well as equity. So those were the goals. And then there wasn't really actually a choice as to whether or not to do this project because the new stormwater rules require some updates to your program by May 1st of this year. So there's some changes in where the program applies. There's some changes in how the nutrient loadings have to be calculated, project density, and then some other aspects like the way plans are reviewed, the way that stormwater control measures have to be maintained. All of that has to be accomplished by May the 1st. So Ryan and his team wanted to get all that done together and make a better product for your development community and for your team in Durham County as well. So this is a map here. It's very colorful. It shows the various watersheds. Like I said, you have Falls Lake, which has one set of rules. You have Jordan Lake, which has a different set of rules. And then you have a small corner of your county in the southeast, where that's the lower Neuse Basin. It's part of the Neuse Basin like the Falls Lake is, but it has different requirements than Falls Lake. Then you also have stormwater rules, buffer rules, and then there were county UDO requirements. And those were all kind of piled on top of each other too. And sometimes folks who are using your ordinance had to go back and forth between what's in the UDO, what's in the stormwater ordinance, and it wasn't always clear how they linked together. So we wanted to coordinate all of that together, and they let us know that they wanted the ordinance to be a one-stop shop, that someone could know they needed to do a stormwater plan, go to the ordinance and find out everything that they needed to do without necessarily flipping back and forth between the UDO and the stormwater ordinance. So this just shows, we did a reorganization. This slide will show you a little bit more kind of where things went. We did some reorganization to make it easier. And probably the most important thing that you see about the reorganization between current and proposed, in current section 14-155 were the design and performance standards, and Jordan, Neuse, Falls were all kind of lumped together in one subsection. And so what we decided would work better for everyone is to pull out each part of your county and have one section that was just Falls Lake, one that was just Neuse River, and one that was just Jordan Lake. And in some cases, there's a little bit of repetition where requirements were very similar, but this kind of went to the objective of one-stop shop. Someone could go to the new section 14-154 if they know they're in the Falls Lake and find out everything they need to do. We also added a new section, section 14-157, which is requirements for designing stormwater control measures. So that's kind of the engineering geek out section, but it lets people know how they have to design the stormwater control measures. It's mostly from the state rules. And again, this makes your ordinance more of a one-stop shop, that your developers don't have to go to the state rules to find out the minimum design standards. They can find it right here in your ordinance. So those were some of the big changes. We also clarified in new sections 14-158, 14-159. You all have a two-step process. You have one step of a stormwater as-built or stormwater construction drawings where the stormwater construction drawings are approved. And then after the development is built, the developer comes back to the county to get the operational stormwater permit, which is for the ongoing operation of the stormwater control measures. So those are some highlights about the reorganization. I'm not going to walk through these flow charts, but the flow charts are here to help the development community understand. The one on the left shows when stormwater permit is required and walks people through the process of figuring that out, because applicability was one of the challenges that the county staff were facing, letting people know when they might be subject to a stormwater permit. And then the flow chart on the right shows the process for obtaining a stormwater permit. And these flow charts will be posted to the website and potentially some other locations just to make it easier for the development community. A lot of definitions were added to the ordinance. We realized as we were going through it that there were a lot of terms used in the ordinance that weren't defined. So we wanted to make sure everyone knew what the definitions were. In a lot of cases, these definitions were taken from the state rules. And then a number of rules were modified so that they matched the state rules, because the county wanted everything in the ordinance to be compliant with state rules. So we made those updates. And then I've never done this before. I have a lot of experience writing rules and ordinances, but it was kind of confusing. Project density is a very important part of stormwater management, because if a project is low density, then vegetative and more passive types of treatment can be used. But if it's high density, that's when an engineered stormwater control measure is needed. So that's why project density is so important. But explaining in words how to calculate project density was kind of challenging and hard to understand. So they had the idea, hey, let's just put a formula in the rules. And I thought it was a brilliant idea. So we have actual formulas in the rules. And the county attorney reviewed that, and we got a thumbs up, so we're grateful for that. And we think that'll clarify things for the development community as well. For green infrastructure, we wanted to have an ordinance that encouraged green infrastructure, and we brainstormed a lot about how to do that. So first of all, what is green infrastructure? That's when you build a development project that tries to mimic the natural water cycle. When we develop land, we pave over soil that used to infiltrate the water when it rained, and we cut off that process, and we create a lot more surface runoff and keep that water at the surface. And that's, in the long term, not great for the streams, because the water picks up pollutants and it changes the hydrology, so streams often erode when that happens, causing more sediment in the streams. I know sediment's been a big issue here recently. So the state rules talk about green stormwater infrastructure. They use a more technical sounding term, runoff volume match. But that means that we're trying to make sure that the surface runoff that comes off the development is very similar to the surface runoff after development, I should say, is similar to the way it was before the development happened. So runoff volume match projects that are designed this way automatically meet all of the nutrient rule requirements. So the way the ordinance was previously written, and even the way the state rules are written, the fact that you can use runoff volume match basically is your trump card. That's not always a good word to say, but it's your wild card, we'll say. That you can replace any of the nutrient requirements with runoff volume match. That wasn't really that clear. So we updated the ordinance. So right out of the gate in the Falls Lake section, and the Neuse section, and the Jordan Lake section, it says if you do runoff volume match, you're considered to have met these requirements. So just by bringing that out into the open and making that more clear, we feel like we encouraged green stormwater infrastructure. So what would a green infrastructure project look like? What you would see is, instead of having one of those wet ponds at the bottom of the hill, and sometimes they're if you see them in a shopping center, they're behind the strip mall, behind a fence. Instead, what you would see is more utilization of the entire site to treat the stormwater, and the stormwater being treated more in a closer proximity to where it's created. So like, for example, this is just an example diagram, but you're seeing treatment measures right next to roads and parking areas, right next to roofs. You're seeing a lot of vegetated systems such as bioretention cells. You're seeing a cistern that actually stores the stormwater, and it can be used as irrigation water when it's needed. So it takes a little bit more thought and effort in the design. Then what you're not seeing on this site is a wet pond, so the developer gets to use more of the site to actually, for the development, and the green stormwater infrastructure that's in the site is an amenity to the site rather than the eyesore that you see behind that fence, behind the strip mall. So, oh yeah, and I already said this. So it's up in front now in all the rules, and lets people know that you can do this. And there's actually a spreadsheet tool that the county is going to make available on its stormwater website once this ordinance is hopefully passed, that folks can go to and find out very easily if they've met the requirement or not. Okay, and then in addition, there's some efforts being made in the, your UDO. It sounds a little bit counterintuitive, but the tree safe areas can be reduced if green stormwater infrastructure is used. And that's because it's, for one, to provide an incentive, but also because a green GSI site will be using green spaces. It just may be that there's a need to cut down larger trees that are on the site and create smaller vegetated areas with shrubbery or smaller trees than what was on the site. And so I try to be well under my time, Madam Commissioner, so, but I'm more than happy to answer any questions that you have, and Ryan is here too, and he can answer questions as well.
Great job. You're doing wonderful. Commissioners, questions? Commissioner Carter?
Trying to get to the page where I have a question. First of all, thank you. This is very interesting, very nerdy, but very interesting nonetheless. And it's really important, I think, too, because there is this balance of needing to protect the environment, absolutely, right? But also we need more housing. And so how to sort of manage both of those needs. Looking on the flow chart thing, and I looked at it only because I was trying to figure out, well, what would exempt some developer from needing to comply with the rules? Could you just talk a little bit about that? Like, for example, redevelopment is one that would be exempt. And what is redevelopment? Why is it exempt? It doesn't seem like it would be to me, but I'm sure I'm not understanding it properly.
That's a great question, Commissioner Carter. So redevelopment means when there's a site that already has development on it, and that whatever is currently on the site with built upon area is being removed and replaced with another project. So can you think of an example maybe?
It just seems like that site doesn't necessarily have the green stormwater infrastructure that we're looking for, and so why would it be exempt?
Yes, so say you had a 2-acre site with 1 acre of built upon area on it, and that 1 acre of built upon area were removed and replaced with 1.5 acres of built upon area, for example. The first acre is exempt. If there wasn't stormwater treatment before, the first acre is exempt from needing stormwater treatment. So why is that? The reason why that exemption exists is because the state legislature has legislated that. And so, and so they've also said, the state legislature, because not all communities agreed with that exemption. And some communities said, hey, we see redevelopment as an opportunity to put stormwater control measures in places that didn't have them before, and we think that's a good thing in our community. And then the state legislature noticed that, and they said, actually, no, local governments can make the choice to not exempt redevelopment. There's a double net here. So, I got it. Yeah.
I hear what you're saying.
Yes, yes.
Okay. Well, thank you. It was a very clear presentation, even of a topic that's a little bit esoteric.
Yes, yes. It's kind of dweeby. Yeah.
Okay, Commissioner Jacobs.
Well, thank you. And I'm really excited about this. I went to my first low impact development conference in like 2005 when I was a member of the Planning Commission. And here we are, 2023, and we are finally incorporating it officially like this into our stormwater ordinance. So, you know, I'm really excited to see the green infrastructure being integrated into our ordinance. It's, you know, other communities have frankly been doing it for a long, long time. And so I guess my question is there anything that we left out related to green infrastructure that we maybe could have put in here? Or you know, I know it's in here, this is like incentivizing people, but do we know, are the incentives going to be enough? You know, because I just worry that, you know, it's hard for people to change, and especially engineers are used to doing things a certain way. I mean, how are we really going to change behavior and have people really start using these? Because this is what makes sense, you know, to keep the stormwater on site, and, you know, and then possibly even reuse it, you know. So, I just wanted to hear a little bit more about that from you.
That's a great question too. I think when, and Ryan, you may want to chime in here too, but I think when developers see a few of those, you know, I don't even know if we could call them early adopters at this point, because like you say, we've been talking about this for a long time, but when they see others being successful doing a GSI project, I think they are going to want some of that as well. So they're going to want that opportunity. And, you know, you think about the things that incentivize developers, and I think, you know, when you're on the development side and you have to carve away, you know, you have to meet the density requirements, restrictions in the UDO, and then you have to carve away some tree state areas. You know, you wind up limited, and so I think they want to push the envelope. So I think what you've done with the tree state area is a good idea, and you know, something that might be attractive to your developers. But it's always hard when you update ordinances and rules. It's hard to figure out how people are going to use them until you experiment. So I think it's something important to keep your finger on the pulse of that. And Ryan, you may want to jump in as well.
I was just going to say, we spent a long time talking about this and how we could incorporate it. We obviously would like to take as many carrot approaches as we could. We also aren't opposed to the stick approach because we know how important incorporating green stormwater, green infrastructure is in our sites. Unfortunately, we're somewhat limited, back to that state legislation, how far we could push the envelope. And so this was one way we could do that, by really putting the runoff volume match out there, putting it out front, really trying to incentivize its use and incorporate it into our ordinance. The UDO amendments that we're talking about, you'll see more in the next coming months that we're still working on with the planning department, are going to have even more, I think, carrots that will encourage the use. But I do think Annette's right that we are seeing it more often, and I think the more often we see it, the more often we're going to see it. I think people are going to see that it's working, that there is an ability to potentially use more of a site if you incorporate these kinds of stormwater approaches, and ultimately that's what a lot of developers want to do. They want to be able to use more of a site for parking, or for their shops, or commercial enterprises, for houses and things like that. So the more we can encourage it, the more we're going to do it, try.
I know you're already understaffed, Ryan, but I guess thinking about, are there ways in the future to do demonstration projects, or lift up, examples of people who have done it, to try to show folks how to do it, and also to kind of illuminate those positive examples. I just throw that out there. The other is, to Commissioner Carter's point, we're going to be seeing more and more redevelopment of, old shopping centers, strip malls, parking lots. So how do we further incentivize, if we can't make people, I guess maybe it's not for now, but just thinking about how can we still incentivize people to do the green infrastructure when they're redeveloping. I mean, I was just reading last night because I live nearby, but the Coca-Cola building on Hillsborough Road is going to be redeveloped into a mixed-use development, and I'm like, that's really exciting to think about Hillsborough Road being reimagined and for mixed use. But there's a lot of pavement there, a lot of parking lots with no trees and things like that. So I don't know. I mean, I know we can't do it in this go around, but do you think there's ways to, even if it's not required, that we could try to incentivize the redevelopment?
Yeah, and that's something we will continue. Again, we briefly mentioned our core principles for our stormwater program. Those are resiliency being one of them, particularly with our stormwater projects that the county is going to be working on. We're going to focus on green projects where we can and things like that. So it's definitely something we're going to continue to encourage. And as we work with the city folks, with the Stormwater Association of North Carolina that we participate in, other groups, we'll continue to kind of push the legislature to allow us to do more where we can, and then locally we'll continue to encourage that use. I do think that we see, particularly in RTP where we will see that development, I think there is an appetite and an understanding that some of these things are amenities. Some of this green, people want to work at places that are environmentally friendly, that do that want to add these kind of green stormwater infrastructure projects to their overall projects. So we're going to do everything we can to encourage it, and then and incentivize it, and then when and if we get the ability to require it, then we'll take that next step.
Yeah. One other thought is if you're able to track the costs, because if it's cheaper for developers to implement some of these than the others, then maybe that will be, I mean, I don't know. I imagine some of them might be less expensive than typical BMPs. So I don't know if that would be something. And the last thing I was going to ask is, do you think that any of these changes will help with what we're seeing with the Triassic soils in East Durham?
I certainly think they can. What I would say is a lot of the issues we're seeing out there, and I won't speak either way about the city's ordinances. I think the city's ordinances are strong as well, as a result of a lot of that area is being annexed into the city. And so these ordinances only apply to the unincorporated portion of the county. We are, and so a lot of that area is going to be ultimately, when it comes to stormwater, going to be hit the city's requirements.
Oh, okay. How do we get these incorporated into the city too?
Again, we have those conversations, and we can certainly have those conversations with them. I will say, it's not that I don't think that the city has, bad ordinances. I think that, their ordinances push a lot of the same things. They have a lot of the same requirements from the state that we do, and even more so than we do.
Anything for you, Commissioner Burns? Y'all got your work cut out for you.
We're up to it.
Huh?
We're up for it.
You're up for it? That's a good thing, because it keeps changing on us. Well, thank you. I don't have any questions right now. Thank you so much for your presentation. And do you have anything else to present?
I don't think so.
I just want to know, I think we have to adopt this, right, by May 1st?
We have to do this today?
No. I think by May 1st.
Yeah.
Okay, so we don't have to do anything today, though. Okay.
But we'll bring it regular session.
Yeah, all right, thank you.
Thank you.
All right, appreciate it, all right. I know I didn't see anything in my package to adopt it. So our next item, Commissioners, is 230108, the Transit
Plan Governance Interlocal Agreement. And I see that Ellen is here, and this is, in 2011, Durham County approved a countywide transit plan which included the development of the Durham Orange Light Rail Transit project. In 2013, an interlocal agreement was developed and approved by the Board of Commissioners, and so on and so forth, and all kinds of attachments we got, and we've been reading and reading and more reading. So now we will hear from you. And you have 30 minutes on this one, and we've kind of pinned you back to back on the items so that you won't have to, you don't have to leave, so you can keep your seat. When you finish this one, we'll roll, and commissioners ask questions, and we'll roll over to the next one. Okay? All right.
Okay, thank you.
You want to introduce everybody?
Yeah, I'll give a quick introduction. So there's Ellen Beckman, Durham County Transportation Manager. We got 4 transportation items on this agenda. All of them are somewhat related to each other, and they're all related to the Durham County Transit Plan and the county revenues for transit. So starting off, we got the Transit Plan Governance Interlocal Agreement. This is the agreement that establishes how we work together in the ongoing implementation of the county transit plan and the funds. It's between the Durham County Board of Commissioners, the MPO Board, and the Go Triangle Board. We've been working on this for some time now, about 18 months or so. And we had this is replacing the original interlocal agreement approved in 2013. That agreement was very short, didn't have a lot of details in it. This one is much more thorough. We went through a very extensive process with our partners to develop this. Adam Howe from Atkins was our consultant, and he's on the Zoom, and will be giving an overview of the changes that have occurred in the document. The Board of Commissioners did approve this document in November, and so subsequent discussions resulted in a few changes to that. So it's back before you again for reapproval. And then it will go to the other 2 boards for approval, the Go Triangle Board and the MPO Board. So Adam's presentation will review those changes that have occurred since November. Sandra Freeman and Chuck Latuka are here from Go Triangle. Sandra's will follow Adam with a presentation specific to some of the Go Triangle issues in that agreement. So with that, turn it over to Adam Howe.
All right, very good. Madam Chair, can you confirm you can hear me?
I can hear you.
Very good. It's a privilege and pleasure to be in front of you all again today. I will keep this presentation quick to allow for questions and segue to the next topics. But we're going to go over a quick status update, as Ellen outlined earlier, give you some of those specific updates to the ILA, and then we'll talk about some of the next steps that are happening with your regional partners. Next slide. So back in the fall of 2022, you were actually brought a version of the interlocal agreement in November 7th during one of your work sessions similar to today to receive an update on this ILA, and then on the 14th, you all took action through consent to adopt that governance ILA. That version was not adopted by your regional partners, and so it was never fully executed. And during that same time, regional partners, both at Go Triangle and DCHC MPO, sought clarification and some critical edits to the ILA as it was presented to you all. And so all the partners decided, let's take a step back. Let's make sure that we review this closely. And so the version that's been presented to you today is the one that incorporates all those changes that everybody has concurred upon as we speak. Next slide. I'm not going to read all of this to you, but I'm going to give you the highlights. And so one of the critical edits that was made was regarding a specific definition. And this falls under the dedicated local transit funding sources, where we are aiming to define explicitly which revenue streams are able to support local implementation or regional implementation of transit services throughout the county. And so this edit more adequately defines the role of the vehicle rental tax funding source, and it acknowledges Go Triangle and their board of trustees to have sole discretion of future allocations of that funding source as it relates to local transit plan implementation efforts. Next slide. This is some just critical information to make sure we update it for execution purposes, but we just made sure that everybody was incorporated appropriately from an official standpoint for addresses and parties to notify for anything in action related to the ILA. And then for an amendment purpose, the partners decided that it was critical for them to make sure that there was a process and cycle that would outline a commitment by the parties to the governance agreement to coordinate a review of this interlocal agreement that aligns with the frequency of the multi-year transit vision plan updates, which is scheduled to occur every 4 years. But it does also allow for a process if there is a need from any one of the partners or parties to the ILA of a critical amendment to then take place outside of that 4-year review cycle. Next slide. Getting in Article 5 of this governance agreement, there are 3 sections that outline the roles and responsibilities for each of the parties to the agreement. In section 5.03, this is Go Triangle's outline rules and responsibilities, and there's a little bit longer because of their role as tax district administrator. And then this one specific section in 5.03M was to make sure that we enhance the language that defines the responsibility for Go Triangle to not pay debt service or use local transit funding sources to fund costs associated with capital facilities outside of Durham County unless otherwise agreed to through appropriate agreement documentation with you all as the County Board of Commissioners. Next slide. And then throughout the document, it was noted by a couple of regional partners as we are evolving as society, and we want to make sure that we are sensitive to use appropriate language in developing policies that impact everybody around us to make sure that we're using positive language moving forward. And so we were using the word master to reference a couple of different things. And so what was originally considered to be a master participation agreement, which is kind of the next step below the ILA that invites the city of Durham to be a partner and implementing party for the transit plan purposes, that is now being called the Comprehensive Participation Agreement. And then what we were calling Master Operating Capital Agreements, which was the concept of essentially bundling several operating and/or capital projects into one standard type of agreement to allow for streamlining and efficiency purposes. We're now referencing and defining those as global operating or capital agreements. Next slide. And so those are the 5 critical edits that were incorporated and agreed upon by all the partners. There is continued coordination to go on through the spring, and then these, a few of these things will come back for you for approval, but all of them will definitely come back to you for review and for information. Is looking at that comprehensive participation agreement, a set of bylaws that informs how the technical group, the staff working group brings forward communications, which I believe you'll hear some of that today. Financial policy procedures to outline how everybody is to make sure they spend and report on the project's work program amendment policy is critical to allow for all partners to make sure that if there's a need to amend, that there's a process to allow for that to occur. And then formation of some type of project agreement templates to inform steps moving forward, getting all of these things in place. So staff does anticipate these to be presented back to the board before the end of fiscal year 23. Next slide. And with that, I'll turn it back over to Ellen.
Okay, thank you, Adam. That's the kind of things that have changed. Sandra now has a presentation to review some of the specific items on Go Triangle.
Now, this is regarding the ILA, or is it to another project, another?
So it's specific to the rental car tax issue and the change in the language there and the financing language that's in the ILA.
Okay, I just wanted to make sure that we're staying within the same
Yeah, they're all kind of related to each other, but I think this flows best.
But specifically, we're not moving to item 23015. We're still on item.
Yes, we're still on the interlocal agreement.
So that we can have our questions, get our questions out and answered before we move to the next one.
Yes.
Okay.
Yeah, after the examiner can go first.
Afternoon. Just a few things I want to quickly talk about on the Go Triangle side before we go into the ILA. You may be aware, or you may have heard the term fiscal cliff. What we're hearing from a lot of transit agencies is that they are potentially facing what is a fiscal cliff. I was on a call with APTA financial people on last week, and we're learning that the impact of COVID, suspending fares, driver shortages, and what had to be done to accommodate COVID has put an undue impact on many transit agencies. And now that the CARES Act funding is no longer available, that one-time influx of funds, we're now facing a new reality. So Go Triangle is in the same boat. We took a 10-year look at our forecast. This is just the operating forecast, and if you look at the line at the very top, the red numbers indicate that Go Triangle is forecasting, just for operating, a deficit each year out through 2033. So in a situation like that, what do? We have very limited resources. We're unable to have a property tax like the city of Durham might do. So we have to look at the resources that we have in place that are funding Go Triangle. Those are the $5 registration tax, the rental tax, which you've heard a lot of discussions about, our fares, and those are the three main areas. So just real quickly on the $5 registration tax, that $5 registration tax has not been indexed to inflation. So since 1989, that $5 is the same $5, which is about $2.79 now. If we were collecting at the rate that you would anticipate, it would be closer to $9. So we're working on that with the legislature to see what we can do to get that index. You will see in blue that actually 70% of the Go Triangle services that we all experience in Durham are paid for out of this revenue source. Only 30%, or I shouldn't say only 30%, but 30% comes through the transit plan, but the majority of the service that you see in Durham, Go Triangle services, coming through these legacy revenues. So we obviously want to keep them healthy so that we can continue to provide the regional service. Real quickly on the transit plans, for those who may not be as familiar with the revenue sources, there's a half-cent sales tax that comes to each of the three counties. There's a $7 county registration tax. In Durham, up to 50% of that tax can be used for increased cost of existing service for the city of Durham. There's a $3 vehicle registration tax, which allows Go Triangle to expand service as identified in the transit plan for Durham. And then there's the 5% vehicle rental tax. That's been a lot of the discussion that we've had. The 5% vehicle rental tax, at one time our board made the decision that when the dollars came in, 50% would be retained for Go Triangle. The other 50% would be distributed to the three counties based on population. And what we have determined is that that 50% that Go Triangle, the board at one time, determined was available to reallocate, we now needed to keep our own operating funds healthy. You can see here that the Durham transit taxes are doing fantastic. And what we've really noticed is that the half-cent sales tax is growing by leaps and bounds above what we anticipated at the time that the transit plans were put together. So it is a very healthy revenue source. It's the second one from the bottom. It's a very healthy revenue source for Durham. And specifically regarding that tax, if you look at the performance compared to the 2017 transit plan document that was approved back in 2017, Durham has recognized an additional $19 million in overperformance of that half-cent sales tax beyond what we anticipated. Even with the updated plan that we're currently reviewing for 2023, we anticipate that there will be an additional $34 million in additional half-cent sales tax revenue above what is currently in the plan. So it is a conservative plan and we anticipate a lot of growth in the half-cent sales tax. With that being said, when we look at the impact of the Go Triangle Board making the decision to retain the rental tax, we didn't just look at it as what is the benefit for Go Triangle, we also wanted to look at it as what is the impact to the transit plan. And what you can see is that if you look at the first box, between FY23 and FY30, there will be about $13 million collected in the rental tax we anticipate. But if you look at between the two plans, what the anticipated amount is above that is $15 million above what was anticipated in the 17 plan, and it's $25 million above what is anticipated in the 23 to 30 plan. So there will be a $12.4 million additional amount of vehicle rental tax over what is anticipated. So we say that to say that when we run the financial model, the Durham Transit Plan will still be able to deliver on all of the projects that are in the transit plan with no issues, even if our board makes the decision to retain the rental tax. Just real quickly, Go Triangle, as it currently stands, will be responsible for doing all the debt financing associated with the projects in all three counties, unless a certain county makes the decision that they want to take on some themselves, and there have been some discussions about that. So we've spent a lot of time working with our bond counsel looking at what financing options are available for Go Triangle. And once we get to a point where we're ready to do some financing, it will be a few years down the road. There will be a lot of discussion with the impacted county. There will be a lot of discussion with our board and with the county commissioners board to come up with a financing package that people feel comfortable with. It will not be done in a vacuum just by Go Triangle. So that's one reassurance we wanted to make to the counties when we went through this process. It will be collaborative, understanding that the expectation for now is that Go Triangle will take on the debt, but it will be a collaborative process. One of the areas of concern that has been expressed is how does Wake and Durham align? There is a concern, and for us as well, that Wake and Durham are treated equally through the processes that involve Go Triangle. So we spent a lot of time on this first one here, the rental tax. We made the language very explicit in terms of how the rental tax was going to be addressed in Durham and Orange. We at one time anticipated that we were going to have to renegotiate the entire ILA with Wake to get assurance that we have the same level of ability to do that. Our bond counsel and our general counsel went through and reviewed the language in Wake County and feel very comfortable that the language in Wake County will allow us to retain that rental tax just as it does in Durham and Orange. The language may be different, but it acknowledges that it is an allocation from Go Triangle and that we feel very comfortable that we won't have to change the language in order to get that done. So the three counties, if and when the Go Triangle Board makes that decision, can make it for all three counties without us having to renegotiate an ILA in Wake County. Second point had to do with the ability to finance. At one time, when we first looked through the documents, we had some concerns that the way the ILA was written in Wake County, that there would be an issue with any debt outside of Wake County, that the boundary line was Wake County, and so we were going to have to potentially renegotiate for that as well. However, we scrub through the language, we look at the wording, and what is very particular is that it says if it's in the transit plan and if it's in the work program, it will be funded. So, for instance, commuter rail is a perfect example. Commuter rail is already in the transit plan and the work plan for Wake County. That will allow this to be a regional project and not just limited to Wake County. We put the language up here for the vehicle rental tax. As I mentioned, the language is different over here. The language in Durham and Orange, because we worked on those two simultaneously, are exactly the same. The language in Wake is slightly different, but if you will see what it says, a portion of vehicle rental tax collected by Go Triangle pursuant to and allocated to Wake County by the Go Triangle Board of Trustees. It is an allocation, and it is an allocation that is done every year based on the discretion of our board. So with that language, we feel very comfortable that we won't have any issues retaining those dollars in all three counties if, again, the board makes the decision to do so. Additionally, we wanted to highlight the equitable use of net proceeds, which is another area where, again, there was concerns about cross-county projects. We feel strongly that the language in the Wake County ILA, as it stands, allows for cross-county projects without them just being limited to Wake County. Our bond counsel has reviewed it, and our general counsel has reviewed it as well. Finally, cost-sharing agreement. This language is pretty much exactly the same, that says there is nothing that will prohibit any of the 3 counties from entering to a cost-sharing agreement with other jurisdictions. And again, as long as they're in the transit plan and the transit work plan, it will allow that to occur. That's my last slide. We are certainly open to any questions.
Thank you. So, I want to start. I've got a few questions. Commissioners, you have questions? I'll start, and then we'll pick up whoever wants to pick up. I'll start with, I wanted to be clear, what I jotted down here was the changing of the comprehensive participation.
I know what you mean.
Yeah, you know what I mean. It's getting all tangled up,
Yes.
the agreement. To be clear what that meant and start changing the language. And I think I saw it somewhat mentioned.
Yeah, it's not on your slides. It was on Adam's slides.
It's on a different
Will I get to
slide.
it if I go back?
Well, let's go back to the beginning, because that's where I started.
So the comprehensive participation agreement, all we did was change the name of it in this document compared to what it said in November. That is, what that is an agreement with the county, the MPO, Go Triangle, and the city of Durham. So we're bringing in entities that may be project sponsors and serve on the staff working group. So the city of Durham, isn't a party to this, governance ILA, but they will be a party to that agreement. And so what it says is, like, what are the responsibilities of the city of Durham and the other 3 parties in serving on the staff working group, in being a project sponsor, things like project agreements and reporting requirements. So it's, we got kind of multiple layers of agreements. This is the overall agreement, and then there's some documents that will follow that are supplemental to the agreement.
So between that change, and both of these are MPO changes to the document, that one, and then the master operating contract agreement, and that's, you said, so that multiple projects, it's a bundling of agreements of projects, is that what you said?
Yeah, so again, the change from November is really just in the name of that agreement. What is required is the same. So this is saying that when we have a project, there will be a project agreement between the project sponsor and Go Triangle, and then in some cases, the MPO and the county, depends on the project. And that in order for it to be an efficient process, we're going to bundle things together. Like we have a lot of projects. You'll see, the next agenda item is the work program, and you see those tables of all those projects. So, to minimize the paperwork, our intention is to bundle some similar projects together in what we're calling global agreements. But there will be some projects that definitely need their own agreement. Anything that requires debt, anything big that involves federal funding, like commuter rail, we expect there to be a specific individual project agreement that we will bring forward and that the Board of Commissioners would approve. And so that's kind of what Sandra was talking about. Anything related to financing and debt, that's a big effort, and it'll come later, and we'll work together to develop any requirements or language in that agreement, and it will have to be approved by the Board of Commissioners.
Okay, I'll move on to the next one. Okay, I think So the Board of Commissioners provide, they have to have a 3 months notice before suspension of the vehicle rental tax. So that's a 3 months notice from the day that a decision is made.
Our board meets, if they make the decision that they want us to move forward, at that point, we would provide a 3-month notice. So it's really at the discretion of the Go Triangle Board. We're in the middle of our budget cycle. Obviously, our budget ends June 30th. So, they will be making decisions about whether we're going to include it in our budget or not. But again, that's up to the discretion of the board.
I serve on that board as well, and I think the county commissioners, whether it be Durham or Orange, should have at least a 3 months notice rather than just say, I'm gonna take the money today and not give counties a notice. It just doesn't work.
Correct. And even though it does not say that specifically in Wake County, all 3 counties will be treated the same. There will be a 3-month notice. And our board will tell us when that needs to be, but there will be a 3-month notice.
And how often do we get an update? It said every 4 years? Is that every 4 years that there would be an update of the ILA? I saw something said
yeah, it would
4
be-
years, and I saw something that said 17 years.
The 4 years is an opportunity just to revisit. That was some language we all agreed on, that sometimes the document sits on the shelf, and it's just an opportunity to take a look at it. Everything looks great. We keep moving along, but it's just at a minimum of 4 years, we want to just revisit the document. But it is a 17-year agreement, if I'm not mistaken.
Yeah, that's true. And every 4 years is lined up with the MPO's long-range transportation plan cycle. So we intend to look at the transit plan, look at this ILA along that same schedule.
Now, I'm still struggling with that we can change ours every 4 years, but Wake cannot change theirs every 4 years. I'm still struggling with that answer that I'm getting back from that, is that they can't change theirs, but we can. Well, I'm still having a problem with that.
I don't think it's that they can't. It's really, the ILAs were drafted at different times. And so they
I know that, Sandra. I've heard that.
There are 12
over and over again,
municipalities.
but
Yes.
it just doesn't compute. To me, it doesn't compute that it's okay for Durham and Orange to change theirs, but because of whatever conversation that is being had, we're not being collaborative. We're not being in sync across the lines, and we're supposed to be doing this as a region. So it concerns me.
I would just say, Commissioner, that the Wake ILA can be changed at any time if they choose to, but
I'm
they are.
sorry, I can't hear you, Chuck.
I'm sorry. The Wake ILA could be changed anytime the parties agree to make an amendment to the ILA. Wake's taken the position that they choose not to open their ILA at this time. But if they wanted to make an amendment to their ILA, I think there's opportunity to do that. But at this time, because of what we've learned about the ILA and our ability to remove the sharing or stop the sharing arrangement on the rental vehicle tax, there's no need for them to open the ILA right now. But if they needed to, they could. There's also all the ILAs have provision of termination if one of the parties is not satisfied with how the ILA is working. So I think the 4-year requirement or the 4-year provision for Orange and Durham to just review the ILAs to make sure that they're current to what's happening, I think is an improvement on the older ILAs like Wake has. Based on what folks have learned, that things do change over time, and taking that 4-year look It just provides an opportunity. The ILA may not change every 4 years, but it just provides an opportunity to have that discussion. So I think it's a real good improvement for the Orange and Durham ILAs, and I think when Wake does change their ILA, that may be something they want to take a look at too.
Well, I know that we did ours, because we passed the sales tax before Wake did, so we did a lot of things before they did theirs. So I'm aware of that. There's just something there that just bothers me. I'll move on to, let's see what else was it. Couple others. Changes to name. We're talking about a holistic and coordinated plan that. So the other issue had to do with the funding, the financing around the bond. So I know that the staff, our bond counsel, has kind of had a conversation with staff. He has not had a conversation with this board. And that was one of the things that I had requested when we talked about it at the Go Triangle board, is that conversation be had with this board so that we understand what that meant. And that has not happened. I had a conversation with the manager and staff, but this board has not heard that conversation.
Right, and we did have a fantastic meeting with Dr. Sewell and staff. We had a financial consultant in that meeting, just to talk about some ideas that we were looking at in terms of how, again, Go Triangle is taking on all the debt. So we want to have it be as low cost as possible and as easy as possible. And so our next step in that process is to have our bond counsel meet with your bond counsel to go into more specifics. So that is on the agenda. We started with the financial consultant just to provide an overview of, what we were thinking about, how some of the financing options that we have, and the bond counsel will be next. Yeah.
And then once that conversation has happened, we would like for our bond counsel to come and talk to the board about it, because we feel like there would be a really good comprehensive understanding of all of the parts.
So are you asking us to approve our ILA before we have that conversation?
So, right,
No?
it's
Right.
not, not addressed in the ILA.
All right, it is part of the.
Hey, is that Doug?
I think it's,
Or who?
who is that? Is that
Adam.
Is it God? God, is that you talking to me?
Sorry, I just wanted to convey that Go Triangle Bond Counsel and financial consultants were also involved in reviewing the ILA in its current version, and so a lot of the feedback and conversations that were provided from them have been conveyed to myself and my team, and the edits were made with their thoughts in mind. So I want to make sure that that was made clear as well, so that their feedback was transcribed.
Anything that would impact financing for the county, right, we don't have to cover that or address that in the ILA. That would be done on a project-by-project basis.
Yes, and the ILA specifically says that there will be project agreements, so, and that they have to be approved by the county commissioners. So that's, we don't know everything about any project that we might want to do, at some point in the future, so that's how we're addressing it. It's that we'll be able to facilitate those conversations and develop a specific project agreement at the time that we have a project to consider.
Okay, so I'm going to let go and let some of the other commissioners talk. Just one other, just for clarification. Talk a little bit more about projects that, with the bond, you said that, and I may not have it right, but across boundaries,
the funds can be used in other counties. So the money, Durham County's money can be used in a different county for regional projects.
Only for a regional,
We'll talk a
regional
little bit
project.
more about that.
I'm sorry? Oh, for instance, commuter rail is a perfect example. There's going to be a cost-sharing agreement between Wake and Durham. Will there be boundaries, or will it be all the money goes in a pot and the commuter rail goes from here to here? It allows for those types of conversations. At the end of the day, the counties will make the decisions on how you want to do it, but it allows you to fund a project that does not stop at the Durham line or does not stop at the Wake line, and that's the intent of the language, to allow for regional projects and money perhaps to be used collectively on a project. That would still be subject to a cost-sharing arrangement.
Okay.
As is described here.
Yeah, because our LA says that, and Orange does too, but Wakes doesn't.
Wakes does. Wakes does. It does.
Wake says that?
Yeah. Even the last sentence about cost sharing.
Different language, because it doesn't read the same way.
Right, but it does. It allows for the same thing. The one I have up here about the cost sharing, it says so long as they're detailed in the county transit plan. So as long as commuter rail, and I keep using that as an example because that's the one most people are familiar with. It's in the Wake County Transit Plan, it's in the Durham County Transit Plan. You make an agreement on what type of cost sharing arrangement that you want to have for that project, even though it crosses two counties.
Okay, I'm going to stop now and let some of the other commissioners ask their questions. Commissioner Burns?
How you doing, y'all? I know it's not always fun at Durham because we have a lot of questions, and by the grace of God, I actually only have one for y'all today. I do want to say thank you for the presentation, Sandra, especially you. I think you've done a great job. There's always nuance to transit, and you always come in here, and I feel like you're the great explainer. I feel like I've, grow 10 feet taller and understand the money better. The same can be said for you when we're at the Special Tax Board, so kudos to you. And I want to just hearken on something that we had, you brought up at the Special Tax Board, but you only brought up some here. The $5 tax that, right, so, we haven't moved that since the 70s, the 80s, so the inflation, the equivalent of that now is $2.99. I know you say you're going to the General Assembly to see if we can move that up to $9. I would love for you to, or someone to tell me what that plan looks like. And in the event that you can't hit the 9, since we are so far behind, can we shoot for 7? That way you all can make up some of the ground. And how can we be supportive?
Okay, you're right on point. We are shooting for 7. 9, if we could get it all, we'd be at 9, but we are shooting for 7. Mr. Latuka and our general counsel have met with several legislators, and he can go into more specifics on that. And I think they maybe had a meeting this week. A couple of things. The DMV has it great. They have what they call a quadrennial. So every 4 years, they do a 3-year look back. And based on that 3-year CPI average, we probably don't even notice it. But our taxes automatically get increased. We love to have some legislation like that so we don't have to go back every 3 or 4 years begging for another 3% increase. So that's what Mr. Tuka is working on, and I don't know if you want to share any details.
Oh, you hit it right on the button there. $7 is I think it was a reasonable ask.
Right.
It's not too onerous on the people who have to register their cars. And it would be, we are asking to be indexed, so we never have to go back again and ask again. This is Go Triangle's first time back in front of the legislature for anything in quite some time. So, we've gotten a good response so far, and we hope that we can get it done this year.
Quick follow-up. I know that we have a lot of people coming into this area for jobs, a lot of migrants. Are we seeing that folks are not registering vehicles, and is there anything punitive that can be done?
So one of our issues that we are focused on, and I'll turn it over to Sandra because she has some information.
Yes, so what we're finding is people are not registering their vehicles. We're seeing a lot of people driving along our highways with their, transplants, and they haven't registered their vehicles. So we are working with the DMV. We've had a couple of meetings with them about electronically, are there other things that we can do to ensure that everyone who gets the benefit, who's supposed to get the benefit of the registration tax, is doing that. But they've acknowledged it is a problem. and it's very difficult to audit.
Well, thank y'all for looking for creative solutions. The only other thing I did want to add, you spoke about how you are working towards making sure that there's some equitable treatment amongst the counties, and I think based on what I saw today, I've often been a pretty loud critic of that, and I just want to say thank you for these first steps, and thank you for your intentionality, and I look forward to see what y'all do next. And that's all I have.
Commissioner Jacobs.
Well, thank you, everyone. I cannot wait until we can approve this ILA. You know, it is a huge step forward, and it has taken a huge amount of work, but I think that it is really going to lay the foundation for us to really track the kind of investments that we're making, for the public to understand, you know, what we're doing, for us to be responsible for our dollars, and to have really, with the comprehensive participation agreements, be able to really understand, you know, really understand what we're doing. And because I'll tell you what, when I looked at, this is an item that's coming up, but when I looked at your annual report, and if you look at that and you look at Orange County, Durham County, and then you look at the report for Wake County, I'm like salivating, like, okay, it's very clear, the deliverables, you know, it is extensive, it's detailed, and that's what the Durham County report needs to look like. It needs to be very obvious exactly what did we say we were going to do, what did the agreements call for, and how much did it cost, and what did we get? I mean, so the ILA is going to lay the foundation for that, and I appreciate the work that everybody has done to address all the concerns. I feel confident from what I just heard today and what I see in the report with the change in language that we have done that. And you know, that's what we did with the light rail. We had cost share agreements with Orange County, and you know, that's what you have to do. So I just really want to say thank you, and I want to ask Ellen, what is the timeline now? Because we can't approve this until we approve the transit plan. So what do you foresee as the next steps in the timeline?
So the intention that we've communicated throughout this process is that we want this new ILA approved before the transit plan. So the timeline would be that this would go to one of your regular meetings this month for approval. Then it would go to the DCHC MPO board and the Go Triangle board for approval. Following that, we'll bring forward the final transit plan. The final transit plan's been out for public comment since December, and it's kind of been delayed pending this discussion and this issue. So approval of this will allow us to move forward on that. You know, I'll talk about this some on the next item. It also allows us to start to implement some of those changes in how processes are done and who approves what, including, you know, the approval of the annual budget by the Board of Commissioners. So this is a critical document for us to start to make those changes and incorporate, you know, new processes. And generally, it does bring us closer in alignment with how Wake County is doing it. You know, our current ILA, I think, is 4 pages long, right? And this one's like 25 pages long. And a lot of the language it has been taken from Wake County and incorporated from Wake County. There's a few things that are a little different that we've, you know, talked about today, but for the most part, it is much more in closer alignment than the 2013 one. So staff are recommending approval of the document, and these other transit plans and items will be coming forward in the coming months.
Great. And I hope we'll make it clear when it's presented. I see Doug sitting here, that the county transit plan will not be adopted until this is adopted. So that's going to be important for all the stakeholders to understand that. And then my other question was, have you, Chuck and Sandra, looked, I mean, we need more funding. We need more funding for transit. I mean, you know, we're going to have to, at some point, be able to have increase the county transit tax. Our 2050 MTP for Campo and DCHC MPO includes 1.5 cents. I know Mecklenburg's MPO needs it. I mean, everybody, we all desperately need more money. Do you all, have you looked at other states? Do you have other ideas up your sleeve? and related to what you're working on right now, if you send us something, I mean, are you working with all of our state reps that are part of the, I mean, because we can reach out to our own Durham reps if you give us, you know, kind of the language or whatever you're looking for. We can help with that. So
the short answer is not yet on the sales tax increase for transit. The registration?
yeah, anything you're doing.
Well, the registration is something we're doing this year.
Right.
And that would generate, you know, approximately $2.8 million. But something more comprehensive to fund transit projects, because there are so many transit projects in the region that we need to do and not enough money. Certainly, I know the way you mentioned Mecklenburg County, they did a blue ribbon commission to decide, you know, how they should increase what the need was, how much they should increase it, and what they would put the money toward. This region has not done that yet. But if we do it, right, if we do have that discussion regionally, I think I've heard some commissioners have had that discussion amongst themselves. But if we did it, my recommendation would be, since we need to act as a region, we might want to talk about if another half penny is added to the sales tax for transit and transportation, that we maybe put it into a regional bank where maybe a different group would administer that bank. But if we're going to be regional, build regional projects, act regionally, I think we need to make sure that we can supersede the county lines and put it into a bank where we can do projects that benefit the entire region, or at least a portion of that money should be, because we have seen that the sales tax has the capacity to create a good revenue stream. I mean, Wake has generated about, what, 120? You got 40, 10 in the orange. So that is a very good revenue stream, and if you add another half penny, you double that, and we can get a lot done.
And that sounds like a great idea. And then related to what you're doing right now with the vehicle registration fee, or is it a tax?
Told us to call it a tax. It is
Tax, okay. Are you reaching out, like, I'm just saying, can we help with that with the Durham reps? Do you have language that we could send to our delegation, or just how are you approaching that?
I was just mentioning to Chuck, maybe we can draft something that is a letter of support that maybe some of the commissioners, city council folks, or others might feel comfortable supporting what we're going to the legislation with. So maybe we could work on something like that.
Yeah, absolutely. We can do a letter that we then send on to our delegation. Any way we can help with that, please, I think, let us know.
Thank you.
I don't really have much to ask that hasn't already been asked, but I really appreciate you all working through the points of contention and getting us to a good agreement that's an improvement over what we've been using in the past. I am worried about the fiscal cliff that transit is facing across this nation and wondering how we're going to all deal with that. Thank you for helping us see that we can absorb this change with the increases in tax revenue that we'll be getting with the half-cent sales tax alone, although it would have been nice to have had both, but we understand we're in this together, and so thank you so much.
Okay, great. So we can move on to the next item. Is that 23? 301. Okay, 112. Is that the right one, or no, I skipped one? Okay, we'll back up for,
Yep.
It's 0154, the draft FY24 Durham Annual Transit Work Plan.
Yes, thank you. So this is the FY24 draft annual work program. It is the annual budget for the transit plan. So the new ILA includes a change to the process by which we do this. It's the most significant change is that it will, moving forward, it will require approval by the Durham Board of Commissioners and the Go Triangle Board of Trustees. So we are proceeding as if that will happen. The draft work plan is going to be presented today by Doug Plachinsky, Executive Director of the DCHC-MPO, for review and comments. It will then be finalized by the staff working group and come back next month with a request for approval. So this month is a good opportunity for you to ask any questions, provide any feedback, provide any, more information that you need ahead of being asked to approve it next month. And I'd say all the project sponsors are here today, too. So we got the City of Durham, we got Go Triangle, we got the MPO and the county all here. So if there's any specific questions about any project, we got the right people here today. So with that, I'll turn it over to Doug.
Oh, see, sometimes if they're red, they're on. I wish, yeah, they're all different. I'm pleased to be here today to present the fiscal year 24 work program. As Ellen suggested, these are all projects that were submitted by project sponsors. We met at the staff working group and discussed the projects. Go Triangle reviewed the funding amounts that were requested, and we reviewed them against the soon-to-be adopted transit plan to come up with a initial fiscal year 24 work program that we are releasing for public comment tomorrow. Officially, we've coordinated that with Go Triangle, and I really want to thank their team for helping us get it out the door for input. Our goal is to open and close the public hearing or public comment period in about 3 weeks, and we'll have it back to the staff working group to review with public comments and make recommendations based on those comments and adjust the proposed program if necessary. So this will cover the time period of July 1st this year to June 30th next year. We have transit projects that have been funded in the past along with service expansions, and we also have some new transit projects. This program's Durham transit tax revenues, which you reviewed the 4 revenue sources that go into the funding program under the last presentation. And under the new governance ILA, the work program is adopted by Durham County and Go Triangle. The MPO board does not adopt the work program, although they will review it. We have a lot of current transit fund projects. These are a lot of the projects that go into the approximately $26 million that will be spent across the program this year. The Go Durham bus stop improvements, continued service expansions on both Go Durham lines and hours on those lines, additional services on Go Triangle's routes, senior shuttle and connect pilots, youth Go Pass and fare collection improvements. We have ongoing better bus projects like the transit emphasis corridors on Fayetteville and Holloway. We would like to initiate a recommendation from the transit plan that looks at significant bus speed and reliability corridors and see how we can both upgrade service, not just with vehicles, but also with facilities and traffic operations. And then some bus stop access points like for example, out on Junction Road, which is a spot that my school bus drove down every day for many, many years. There are some issues with accessing bus stops. There's ongoing Durham Station improvements, and then the Nelson Road bus maintenance improvements from Go Triangle. We do have a few new projects implementing the Go Durham Access and Study pilot. Go Triangle corridor improvements on the 805, the Woodcroft Park and Ride lease. I mentioned already the bus speed and reliability study that the partners asked the MPO to submit a project sheet and anticipate being the project leader on that effort. The Durham County Transit Tracker website that will come in. A reorganization of how the MPO interacts with the staff working group, where up to date, the MPO has been the only partner in the staff working group that was not funded to participate, but only to be the administrator. We've proposed handing those staff working group administrator roles and functions off to Durham County and Orange County, respectively. And then we have several hundred hours of MPO staff working group participation time allotted in the budget, which is actually a net decrease to MPO funding. There, of course, are the Go Triangle tax administration and transit plan administration costs that are increasing as everything is right now with inflation. The Durham County Employment and Educational Access Project sponsorship, and then also, as I mentioned, Durham County assuming the staff working group administrator role. All in all, we project that this plan will receive a little over $44 million. We'll spend about 14 of that on capital expenditures. We'll also spend about 14 of that on operating expenditures, leaving us a fund balance to a fund balance transfer of about $16.5 million when added to the projected fund balance in the transit fund at the end of this fiscal year of $88 million will leave us in between $104 and $105 million in fund balance. Expenditures by agency. Go Durham City of Durham would receive $15.6 million. Durham County and Access would receive a little under $700,000. Go Triangle would receive a little over $10 million, and DCHC MPO would receive $1.1 million, with more than $1 million of that going to the bus speed and reliability study, for a total of $27.6 million. As I mentioned, we're releasing for public comment. We'd hope to get it out today, but it will be out tomorrow. The MPO board will review the work plan and public comment in April. The staff working group will recommend the final work program, and we anticipate that this will be in front of the Durham County Board of Commissioners. Is April still the target for that? And then the Go Triangle Board of Trustees will adopt it at their June budget meeting when they approve their budget. The plan will be available on the MPO and Go Triangle websites, and comments. We have a dedicated public information comment website, or excuse me, email address set up at the MPO. So what we are asking by this presentation, and certainly not necessarily today, although we welcome your comments and questions, is that the county board provide input on the draft work program. Thank you.
Thank you. Thank you for your presentation. One question about the Go Durham Access Study. Is that the same, will that be the same Go Durham Access as we've had before, or will it be something different?
I'm going to ask Ellen to explain that better because she's more familiar with it.
Yeah, so what we heard in the transit plan development was a desire to improve service on the paratransit service. So Go Durham, Go Triangle Access. For Go Durham, it's operated by the city. The county pays for some of those trips for county services, but the majority of the trips are city provided access trips. What we intend to do is to work with stakeholders to figure out if we can implement some improvements in the next year. Brian Fahey's here. He's going to be presenting later. He's actually already initiated a working group with some of the advocates who use access to talk about ways that we could improve the service. So that the funding for next year is in order to implement what comes out of that process. So it's to be responsive to what we heard in the transit plan development, that paratransit service, there are some issues with on-time performance and picking up trips, getting trips picked up on time, stuff like that.
Yeah, I'm glad you're doing this study. We've all heard some concerns from people that use it, so it's good you're doing a study about it. Thank you. Questions, commissioners? Concerns? Commissioner Carter?
Yes, thank you very much. Very interesting presentation. Helps us focus in on, the work program to have it summarized in such a nice way. I feel very excited about a number of the things in the work program. I would say top of my list is the bus speed and reliability study. Will that be county? What's the geography for, where what would the network or the lines, where would we look to serve? You know what I'm saying? Are there certain corridors along which we're studying? Is it more widespread than that?
We haven't identified the specific corridors yet. It is anticipated that it would be countywide, and it would focus on significant public transportation corridors as well as how they connect regionally. So how they interface with, not just Orange and Wake counties, but also, Granville potentially, what opportunities are there. I think what our vision of the MPO is to initially develop a scope based on feedback and input from our stakeholders, including local transit providers. And then I think ideally a component of our study is not just operational improvements, but identifying any potential corridors that could see project development towards a small starts or a new starts grant application through the Federal Transit Administration. So that would be a potential output or rule out a potential application to that program and then take a look. Certainly what comes to mind to me immediately is how to address public transportation on 15501 in between Durham and Chapel Hill. With the absent the light rail project, that corridor is potentially undergoing a lot of transformation right now, and we need to get back into being transit forward.
Great.
Improvements there.
I'm glad you highlighted that. I was going to ask, is that likely to be an area of focus? Because I certainly hope so. I mean, when leaders were working towards the Durham Orange Light Rail Transit, that was lifted up as a project we absolutely had to have, and so I'm sure that the corridor is still as heavily traveled, and there are opportunities for transit-oriented development along that corridor, and so, a bus rapid transit sort of approach seems like, I'm glad we're looking into the possibility of that. It seems like it could make sense for us. And I really am excited about the transit tracker, too. That's not a big expense, but I'm very excited about that, and I think the community will be, too. And also the paratransit improvements. On BPAC, there's a lot of discussion at meetings about the need for improvements. So I'm glad to see we're building that in. I really think we got to have a public transportation system where we have buses that go where people need to go, and they get them there when they need to be there, and they can count on it, especially for the number of riders in Durham that we have that don't own a car and really do rely on public transit. And it's good to see also that we're building in additional staff so that we can get the programs, the projects accomplished sooner. I do feel like we're being responsive to the outreach efforts and the input that we received from the public, and really appreciate all the work that's going on here. I think our work towards improving our public transit system, both locally and regionally, is some of the most critical work that's going on. So I really appreciate all the expertise and hard work.
Thank you.
Okay. There's nothing else. You got something? Go ahead.
Yes, thank you. And, I'm excited about a number of things that are in the plan as well. There's a lot of kind of a lot of diversity there in the initiatives. I'm wondering what you would say about how the work program will look differently when once the ILA is in place, because I have to admit that when I read, the detailed where it has each project and what's going to be done with the money, that the project sheets, it's still pretty squishy for me. And I'm just looking forward to when we're going to really get a clear definition of what is being done, and not only that, but how is that project going to promote, reliable, effective, efficient transit, because that's what we passed the transit dollars for. And I just hope that we're going to see that laid out very clearly in the description of what we're spending the money on and what the outcome is going to be.
I think that's a great point. I'd like to point out that the transit program that's presented this year is an update from last year's transit program. It's not a new format. It's not additional information. Some of the projects have changed in descriptions, but generally it's a very conceptual program for an annual review. I could definitely see something in the future of a multi-year work program for both operations and transit, with approving the year that it's before you every year, but then having a working multi-year program beyond that, and being able to explain those projects with more definition and more description in them. And I think that would be very valuable. I think that also one thing that we have discussed as partners at the staff working group is how to incorporate performance measures, ideally those suggested by the public input from the transit plan, to be presented both in the documentation and then on the exciting tools like the transit tracker. And I know that Durham County had gotten some recognition about the public input during the transit plan development, and I would expect them to deliver an equally award-winning presentation of the transit tracker when it's ready to go. So we look forward to working with them and getting them all the information we can.
Great. And also, especially also related to like the administrative costs for everything, to understand, especially with our partners, I'd like to understand benchmarking, like, okay, we're getting charged this much for this person, like what are other I just would really like to understand that, make sure that it is being done fairly. And again, I'm hoping that getting back to the ILA, we're going to really, that's going to just be kind of be an outgrowth.
Yeah.
And I'm really curious to know.
Can we ask Ellen about that? We talked about that being as part of the ILA. Is that going to be, that kind of reporting, is that going to be a part of the ILA?
Yeah, so the new ILA does require project agreements and reporting back. A few of the things in there are that there will be an annual report, which is already required, and that's actually next on the agenda. And there will also be biannual reports with project implementation metrics that we'll ask each project sponsor to provide us. So we'll be able to use that data to populate an online transit tracker website. This is similar to what you've seen in Wake County, so we hope that we can kind of adapt what they've done for our purposes and have kind of parallel type of information out there to the public. So yeah, the new ILA does make that kind of more of a requirement than it currently is. So that's the intention there. I guess the other thing I want to point out is that the staff working group administrator is the MPO right now. That's why Doug is giving this presentation. But one of the things to change for next year would be that Durham County would take that on. So in the future, it would be Durham County giving this presentation, and the document would be developed, I think, with more input from the county in partnership with Go Triangle. I do want to acknowledge Go Triangle puts in a whole lot of work with all the financial details here, so it certainly will be a partnership. So that change will definitely allow like the county to kind of have more influence on what the document looks like, more work to do, more responsibility too, right? So that will be coming next year. I think Doug is correct that one of the things that really could be done better is showing that multi-year capital improvement program, so you can see all of the projects that are happening and when they are actually going to be implemented, because we have a lot of projects. And some of these projects have projects within the projects, right? Like you don't, there's a lot of detail and layers here that we could provide to provide a little bit more clarity of what's happening to you and to the public. So that's something I would like to see moving forward in the coming years, and we'll be working on that.
Thank you. Thank you.
And if I could bring up just on that note to clarify, if the questions come up at all in discussions, well, the capital area MPO performs a lot of this work for Wake Transit, and that's absolutely correct. They do. They have 3 full-time dedicated staff people that they cap an expense of $150,000 a seat, you know, for 3 of them a piece to perform. But in Wake County, the county itself has essentially subcontracted or subbed the work and management of the transit program to the MPO. And that hasn't happened in Orange and Durham County. Our counties want to stay very involved, and we appreciate that. So that's why I believe in, or Durham and Orange counties respectively, there's been interest and capacity built up to take on that staff working group administration. So we really applaud our local partners for doing that.
Yeah, I had a few more questions. It said in the report that it was not clear who is going to implement the plan. Is that correct? That it wasn't clear who was going to implement the Durham County plan? I think I read that somewhere.
I think, so what you might be referring to is that in the Durham Transit Plan, we anticipated that there would be increased staffing costs to implement the governance study recommendations. So we put a placeholder, you know, in our transit plan. That's, you know, roughly 1.5 positions, you know, so that we were modeling that in our financial model. Okay. We did not say who specifically, you know, what agency would receive that funding. Okay. And, you know, what you see in this work program are increases in staff requests from Go Triangle, from Durham County, from the MPO. So that's just pointing out that we've modeled that, and this is what is being, you know, requested now that corresponds with that.
Okay, so everyone will be implementing it then. I'm just, it was unclear to me, like, are we expecting one entity to kind of be in charge, meaning Durham County, or it was just confusing to me.
It's a partnership, right? We've set this up.
We can take a look at that line and maybe.
Okay, I read it somewhere and I wrote it down, and then the other thing was, it was mentioned in the memo, I think, that there's a suggestion that there be a work session, a future work session, that all of the transportation work representatives should hold a work session in the future. Yeah, can you explain that?
Well, so that is an outcome of our discussions with the city of Durham, right? That on an annual basis, before the Durham County Board of Commissioners approves this, there's a desire to make sure that there's good communication at the staff and elected official level between the city and county on these projects. So it's not required, but it's something we talked about as being a good idea.
Got it.
So if that's what we want to do, we need to arrange that in the coming month or so.
Okay. All right. Well, then we got to get that on our schedules. Okay. And and now you don't have to answer this now, but I'm really, the bus speed and reliability project. I'm on there with Commissioner Carter. I'm so excited that we are doing this. This is also like, I'm so jealous of Wake County, all the BRT projects that they're moving forward with and getting federal funding for. And I just want to make sure with us, the 15501 corridor study, the 70 corridor study, with improvements being made, happening on 147, 70, like if we don't have adopted BRT routes, if we don't have plans that like have them in them, like it's really hard to get funding when we have the opportunity. So I'm just wondering, do we have enough planned for this study? And then, some internal BRT between, let's say, Duke, Central, and Durham Tech and NCCU, something like that, or even getting out to RTP. Like, is this enough? I'm just asking.
Well, I think all those are what we want to take a look at. Where can we connect
will look at
through
all those.
an enhanced bus experience? And we can also be a little jealous of our neighbors in Orange County, as Chapel Hill's implementing a north-south BRT application, which they do anticipate to get small starts funding for. So, we do have a even localer example right over there in Chapel Hill. So we'll be tapping all those resources. I do know that our modeling group, in collaboration with ITRI, is hosting a user forum on the 13th for the STOPS model, which is required for FTA new starts and small starts applications. So we're really diving in and trying to understand this process better so we can field a competitive application in the future.
Okay, great. And my last question is, I'm thrilled that Durham County is going to take over the employment and education project sponsorship, and just would like to hear, and not now, but whenever, what are your thoughts about that? Because I don't know if van pools is the answer, and whether we should be looking more at on-demand for people. But that, and I hope you'll work really closely with Andy Miracle and his crew on that.
Okay, we move over here to Heidi.
Just had another quick question I thought of. So when we say bus rapid transit, are we referring to the official, what I think of as bus rapid transit, where you have a dedicated lane and priority at the lights and a special kind of boarding platform that's more streamlined, or is that what we mean? Or
it can be.
Can be.
As we look at BRT, and then there are also other operational improvements that can be made, even just to have safe transit stops, without being necessarily what you would expect. So a good landing pad for a kneeling bus to come to shelter passenger information. I think there's a big stretch between, just a sign on the shoulder of the road and then improving that corridor. A big part of bus rapid transit is dedicated space, which you mentioned, whether it's a dedicated lane or whether it's dedicated access like a platform. And there are differences. Are those dedicated lanes on the inside lanes or the outside lanes of a roadway? Some of those discussions are happening right now on 15501 as NCDOT is moving forward with conceptual design for interchange at Garrett Road and then interchange at 40. So this is the time we've got to talk about it, because once those designs are set and they move forward to construction, it's a generation plus before we can effectively change them.
Okay.
So just to add on to that real quick, try to be real quick. Right, we're going to study the whole county and all the opportunities. We're going to study if there's a project that may be only in Durham County, that's possible. We're going to study if there's good connections to Wake and Orange County, more like replacing the 15501 Durham Orange Light Rail project. And then another opportunity area is to look at ways that we could partner with NCDOT. Like, there are some highway projects that are desired along these corridors And I think it would make the most sense to see if there are partnership opportunities there that we could, if we're going to reconstruct 15501, I think we only want to do it one time, right? We only want to do it the right way. So maybe there's a way to work with NCDOT in implementing some of those facilities together. The other thing is, this is in the Durham County Transit Plan. I do not believe it is in the Orange Work program at this time, but we would welcome their participation in the study. So if that's something that, the MPO can facilitate, that could be a good addition.
That's our goal, will be to facilitate that.
All right, we got two more to go. Thank you, Ryan. Thank you so much. All right, Ellen, you've got another one here, and it's the FY22 Durham County Transit Progress Report.
Okay, so this is an annual report that is done to the Board of Commissioners. It's required by our current ILA, and it will be required by our future ILA as well. So this is Go Triangle. Oh, or we're on you're next. You're after.
Yeah. Oh.
Sorry. Also.
Wrong chair. Wrong. Okay. So who's supposed to do?
All right.
Oh, you weren't ready for them yet?
Not yet. Not Go Durham. This is the Durham County Transit Progress Report.
Right.
23-0112.
They were ready now.
Yeah, they're ready. This one should be short, hopefully.
Okay.
So Jennifer Hayden from Go Triangle, is here to give this presentation. It's the annual county report for FY22. Jennifer.
Thank you. Thank you very much. Good afternoon, Madam Chair, members of the board, everybody. Thank you, Ellen. I'm Jennifer Hayden, Go Triangle's Director of Finance and Administrative Services, and I appreciate this opportunity to present the fiscal year 2022 Durham County Transit Financial Report. Go Triangle is the tax district administrator for the Durham County Transit Plan, and in accordance with state legislation and collaboratively prepared by the Durham Transit Partners, the annual report addresses the progress achieved toward the implementation of the transit plan. It includes the collection of revenues, the costs of the projects and transit operations accomplished, and the contributions to fund balance. The Durham County portion of the annual report in your packet begins on page 22 and it goes through page 27. I am very hopeful that I'll answer all of your questions during the presentation, but if I don't, I will ask for them at the end. So on the slide that you see before you, it shows that the Durham revenues in fiscal year 2022 totaled $43 million. The breakdown of these is $40.3 million, or 90% of that was from the half-cent sales tax. $1.7 million was from the $7 DMV vehicle registration tax, and $719,000 was from the $3 DMV registration tax. Those two combined equals 5.4% of the total revenues. $1.4 million was collected from the vehicle rental tax, and that equals 3.2% of the total. Other revenue totaled $7,261, and investment income was $636,000, which is 1.4% of the total. The last line on the left of the slide shows $1.75 million classified as unrealized investment loss. Although this looks startling, the loss is what we call a book value rather than a cash value. The other revenues that I just mentioned will be received as cash. On the other hand, this $1.75 million is not a cash transaction. Instead, an unrealized investment loss is the decrease in the value of unsold investments on June 30th. The loss, or in some cases a gain, is only realized after we sell the investments for cash. So if the investment is held until maturity, the principal investment is returned in full. And even though the big number here shows the 43 million, that actual revenue, not including that unrealized investment loss, totaled $44.8 million. Next slide, please. The total expenditures in fiscal year 2022 was $43 million. The largest portion of that was $30 million in unspent revenue. And that $30 million is allocated to the fund balance. So at the end of the year on June 30th, the fund balance with that contribution totaled $108 million. Just for clarification, the fund balance is made up of assets. Of those assets, $99.3 million of it is cash and investments. And then we subtract out the liabilities. So it's the same thing, you may be familiar with the owner's equity. So that is what the fund balance is, and it did grow. The remaining $13 million in expenditures were spent in a variety of ways to further the transportation needs in Durham County for the residents and businesses. The largest is $6.5 million, and that was spent on transit services. That includes sustaining previous improvements, increasing the frequency on trips, expanding alternative transportation services like the Go Durham Senior Shuttle, and the creation of the Go Durham Connect pilot, which provides an on-demand transportation for East Durham residents. Transit services were slightly impacted by the driver shortage, but we have every hope that that's going to be recovering in fiscal year 23. The next largest category of expenses was bus infrastructure, and that included bus stop improvements, the Rayner Street sidewalk project, which would improve access to the Village Transit Center. There were planning and design recommendations for the Fayetteville Street and Holloway Street transit emphasis corridors. And the regional fleet and facility study addresses needs such as establishing low or no emission fleet composition, which includes the fueling and the charging facilities. So that is definitely forefront on the mind. The next category is transit plan administration, and that had expenses totaling $1.2 million. And those services include marketing and other communications, legal, capital planning, development, and even updating the Durham County Transit Plan. There was additionally $1.2 million spent for bus acquisitions, and $1 million was contributed toward the commuter rail transit project. $813,000 was for other capital planning, and $241,000 for tax district administration. And that includes but isn't limited to the auditing or the official financial audit at the end of the year, receiving the revenues, paying out the partner invoices, and financial reporting such as this. So you can find more expense details in the annual report, again, on those pages, beginning on page 22. And that is the end of my presentation. So if you have any questions, I invite those.
Thank you so much. That was quick. Any questions, commissioners? If not, Commissioner Carter?
Yes, thank you, Jennifer, for your presentation. I'm looking at you up there.
Yeah. Okay. Hello.
I just wanted to make sure I'm understanding this correctly, and if I am, I think it's a really positive, development. It looks like, this past year we allocated $30 million to fund balance and spent, closer to, I don't know, 10 million, let's say, on local bus service, transit service. But we're going to be like doubling that and cutting in half, like doubling the amount of money we're spending on actual transit services for our residents and cutting in half almost, if I'm correct, what we're putting into fund balance. Is that right?
Yes,
I feel like
understand the
yeah.
way you presented that. Yes, as the expenses increase, the contribution toward the fund balance will decrease. But what you get in return is greater service to the community.
Which has been requested.
And the other purposes for the fund balance are for future projects that are or will be in the next transit plan. And so that the funding would be available, which would reduce debt obligations. Or also it can help get things facilitated quicker.
And Jennifer, would you say that the FY22 expenses were lower than budgeted due to the bus driver shortage and not being able to put as much service out there as
Yes,
expected?
that was one of the situations that occurred. We monitor that all year long, and often, in particular on the capital side, because of COVID, we have had some delays in getting things accomplished, but it is partly because of the driver shortage, and then of course we've got, other supply chain issues that we've been facing, and of course the redevelopment of the transit plan. So I think things are going to really start picking up here mid-year, this fiscal year. We're already there and continuing to grow.
Thank you.
Welcome. Commissioner Jacobs.
Thank you. I had a few questions. One is, it looks like the regional routes, when I can't remember, it was one of the slides that just showed the ridership numbers was pretty low, and at the same time I've gotten emails from people complaining about the decrease of those of that service. So I'm concerned. I think that the regional routes are really important because Go Triangle is supposed to be a regional transit organization, and I know we've had challenges with operators, but I just like to hear what are the plans to really bring that service back and really support those regional routes. So that's one of my questions.
Okay, certainly the driver shortage played a huge role in any changes to the routes that were not increasing trips. That is being resolved. We do see operators returning to the workforce, and the number of them are growing. A lot of it is requiring training. So once the training is finished, we'll be able to continue to grow. And we do work with Go Durham. We work with the rest of our transit partners to make sure that we are continuing to expand, because we all agree that providing the transportation service is absolutely critical within our region.
This is Catherine Eggleston from Go Triangle. She probably knows the specifics about when the routes will be.
Yeah, absolutely. I can provide a little bit of
Thank you, Catherine.
Hey, Jennifer, I can provide a little bit of additional detail to the overview Jennifer just provided. Back in the fall, Go Triangle's board did approve a significant increase in operations compensation, as well as a change in our operations compensation structure for new employees. So that has had a positive impact on our recruitment as well as our retention. We've been having much larger pools of applications and much larger groups of new operator trainees coming on each month since that change was made. So we have a lot of momentum to be able to begin implementing our service restorations. The first of those will be later this month on March 26th, the CRX and DRX service between downtown Durham and downtown Raleigh, as well as downtown Chapel Hill and downtown Raleigh, will be restored to the fall 2022 levels. So we're very excited about that. We're already starting to look at a few months down the road what additional services may we be able to put back with the goal of restoring to our full budget levels
Glad to hear that. And do those routes have priority bus on shoulder? Those buses?
We have bus on shoulder on portions of I-40. So those two routes I just mentioned do have bus on shoulder on I-40. And we have participated in a regional bus on shoulder study with the MPOs within the last couple of years. So we had other opportunities to add a bus on shoulder plan for bus on shoulder as NCDOT does upgrades to freeway projects. We'll also manage the bus on shoulder implementation along I-540 for our currently suspended Raleigh Express route as well. So we've had good success working with DOT where the infrastructure can support it, like where there's adequate shoulder already to support bus on shoulder. We've had good success working with them to identify where the signs need to go and how to implement that the bus on shoulder operation.
Okay, great, because anything we can do to get as close as possible to BRT, right? Thank you. Also, it was really interesting to see the boardings have, leveled out, so which, makes the argument for with changing work patterns that people are not commuting at the same time, and it's more kind of all day long. So when we look at rail, making sure that we have that for people all day long, is that continuing? Are you continuing to see that?
Yes.
Same patterns?
Yes, we're seeing some of the pre-pandemic kind of peak ridership in the AM and PM peak commuting periods returning, but not nearly as much as it was pre-pandemic. And we're seeing higher levels of ridership on Go Triangle's regional routes, higher levels of ridership on the weekends, even though we're currently operating less service on Saturdays than we were before. So that's a very interesting dynamic for us. We're definitely watching that, and we'll be thinking about that a lot in the context of our future planning for short range.
Right. Yeah, I mean, we're really going to have to respond to people's changing habits, right? And I was just curious, in the wake plan, I saw the description of something called the Smart Shuttle Service. Could you tell us what that is? Maybe something we want to look at for Durham?
Sure. Morrisville implemented an on-demand program within the last year that is a node-based program where they have a shuttle that operates on demand. It can be, people can order a ride on an app, and it'll come into them to other locations, other nodes within their Morrisville Smart Shuttle zone. That operates similarly to other on-demand programs around the country, or even locally. Go Triangle administers a couple of on-demand zones where we use Uber and Lyft vouchers in a pilot kind of phase for that. But we're looking at the potential for directly operated or contract operated microtransit zones as we expand that program. So that's definitely something that we're looking at, coordinating with the City of Durham to look at for the Go Durham microtransit implementation, and we'll be coordinating with other partners as well.
And that's free. Is that free?
Yeah, I think
it's free. Yeah, wow. And I'm wondering, do you collect data on, I mean, this is really for everything that we're doing, but I'm just curious, like the senior shuttle, how many people are really have benefited from it? I'm just wondering how much data is out there, and if that could be shared with us.
Yeah, I think we do have that data available. I can work with Ellen to pull together information.
I mean, that's the kind of thing that would be good to have on the dashboard when we have one. How many people are actually benefiting from these things and using them. Yeah, thank you.
Okay, thank you. Thank you very much. Just one question. When these numbers are put on on the website, will it have a little bit more clarity underneath as to what it points to transit service, will it have more information about what that means? Or is it just going to be that one line?
On the website, the full report is there, and the report is broken up in narrative for what progress was made, particularly regarding the services that were provided. And on the financial pages, we list them categorically. So it's a complementary report. By and large, you should be able to tie the two together, but on the financial page, we just categorize it so that you can see how much was spent per category, and then the details are on the progress side.
Yeah, it would be great to have some details, itemized details, so that people can understand what it means. Okay.
Okay.
All right. Thank you so much for this one. I got one more.
Thank you.
Commissioners, are you okay? Do you want to stand up before we go to the next one? Do you want to go to this next one and then stand up? What's your pleasure? Want to stand up?
Where's Maceo? Maceo will get us moving.
Those of you that haven't been around us, we've made a commitment to our health and to your health that we don't sit in a chair all day long, that we stand up, move. All right. All right, we won't do any jumping jacks. So let's get through this next one so that Ellen will be through. And then if anybody wants to run in the back and grab something to drink or whatever, we'll do that then. All right. So Ellen, the next one is 230174, Go Triangle Annual Report. You got it right this time. You don't have to leave this time, right?
Go Durham annual report.
All right.
So similar to the last update, this is an annual report, this time from the City of Durham Transportation Department. They gave this to the City Council earlier this year, and I've asked to give an update to the Board of Commissioners. So with that, we have Brian Fahey and Evian Patterson from the City of Durham who will give the presentation.
Just want to begin by saying thank you from the City of Durham. We are excited about the work that we've continued to build partnerships with the county, and thanks for your support on a lot of our transit-focused programs, which is a priority for our department. And we are excited to provide you with the annual report to show the work. Turn over to Brian.
Thank you. Good afternoon. I know this is the end, so I'll make sure I try to make it exciting. I'm Brian Fahey. I'm the Mobility Services Manager for the City of Durham Transportation Department. While this report is mainly the Go Durham bus service annual report, I'm happy to answer any questions about Go Durham access. So I know that is an important topic for all of us, so I'm happy to answer any questions on that at the end as well.
Okay.
Okay, sorry. We've seen throughout the pandemic how transit can be critical for essential workers who keep our community healthy and strong. We continue to provide personal protective equipment and fare-free service to aid our community's recovery from the pandemic. You've seen there, just in FY22, we've distributed over 500,000 masks on board our buses, as well as hand sanitizer and installed driver barriers on all buses. Consistent with the city's carbon neutrality and renewable energy action plan, we are moving forward with the electrification of our fleet. You can see here the benefits we're already seeing and the major milestones. So that our first 2 electric vehicles did go in service in spring of 2022, and we've seen them reliably in service since October of 2022. In December, the City Council approved the design contract for a $10.8 million Durham Station renovation project. We are very excited to move forward with this transformative project for our transportation hub. A hot topic that was discussed is our food access for seniors. This is obviously a partnership funded by the Durham County Transit Plan. It addresses the importance of access to fresh foods for our residents of senior living communities who have limited transportation options. The program was launched in 2022 with 5 communities, and we're continuing to grow and see significant interest in the program. There was a question about usage. We saw just over 2,500 trips to grocery stores in FY22, and we're averaging right now about 250 per month for the first 2 months of the year. The award-winning Go Durham comic is part of our effort to improve outreach and engagement in our community, particularly among families and youth. Our comic book stories emphasize what we already know to be true, that our operators are heroes. By population, Durham is the 4th largest city in North Carolina. And if you look at bus ridership, Go Durham is the 2nd highest ridership in North Carolina. We saw nearly 5 million trips in FY22, which is still below our pre-COVID levels, which were around 6 million. However, we lead the state when it comes to passengers per hour. And that also just highlights, it indicates a strong desire for more and better services provided, thanks for support from the Durham County Transit Plan. So the remainder of the presentation just focuses on some of our key performance indicators that we've established for the Go Durham system. As shown here, safety is our top priority, of course. We track incidents at Durham Station. We nearly have 12,000 boardings per day, as well as onboard incidents. We are consistently below our targets for both, and we continue to develop training and customer engagement tools to reduce the frequency of these safety incidents. In the fall of 21, we actually saw a substantial increase in the number of operator assaults. From that, we actually improved training and coordination with our law enforcement partners, and that helped to limit the number of assaults since then to only 1 in April of 2022. However, as we know, 1 is too many. But as you see with the onboard incidents, the vast majority are general disturbances or minor rule violations, such as someone refusing to wear headphones when they're playing music on the bus. Note in this slide when it comes to our preventable vehicle crashes per 100,000 miles. In September 21, we had 0 preventable crashes. We're working to make this a regular number rather than the exception that you see here. We also created a Million Miler program that recognizes operators who've gone consistently a million miles without a single preventable crash. And the city joined Go Durham in celebrating 16 bus operators earlier this month who have achieved this milestone, which is amazing. There are very few peers around the country that have that many operators reach that milestone. Due to the importance of transfers at Durham Station, the target for on-time arrivals is 99% or better. For all time points across our system, it's 90% or better. Obviously, we have work to continue to get these numbers up and improve the timeliness of our service. This is a key slide. The orange line here represents the published service levels provided, taking into account our announced service reductions in July of 2021 due to staffing shortages. We consistently delivered 100% of the reduced levels that we share with our community. But as you can see here, in FY22, we were around 81% of our budgeted levels. While we have had the budget to deliver more service, without the bus operators, we consistently under-delivered our service. We made significant improvements since the end of FY22, though. Go Durham has been adding staff and added back service in November of 22, as well as February of 2023. We are currently near 90% of our June 2021 service levels, with the goal of restoring full service this year and adding planned expansion funded by the Durham County Transit Plan in the first half of 2024.
I don't understand revenue hours delivered.
Sorry. Vehicle revenue hours are a very important statistic you use in transit. And basically, that is just saying every hour so that your bus is in service where it can pick up passengers or drop off passengers. That doesn't include the time a bus may go from the garage to the first stop or coming back in the afternoon or other training miles that may be used on buses. The reliability of our fleet is one of our standout performance areas. We set an aggressive target of 20,000 miles between failures, and we consistently exceed this target. Keeping the fleet in a state of good repair is critical to avoid service disruptions that can impose significant hardships for our riders. In FY22, Go Durham added a new executive position, Director of Customer Engagement. Since taking on this role, Sangeet Duda has brought a strong focus to addressing customer complaints in a timely manner and using customer feedback to improve training procedures to provide a better customer experience. On the top, you see the passengers per revenue hour, which I just described what revenue hour is. So this is system-wide for the entire Go Durham system, where we average right now over 30 passengers per revenue hour. This measure continues to climb. While we've now exceeded 30, most of our peers have rates in the teens. Adding additional frequency and crosstown routes funded by the Durham County Transit Plan are excellent opportunities to reduce crowding and improve the customer experience. Our focus today is now on advancing major capital projects such as Durham Station and the Better Bus improvements, while continuing recruitment and retention to restore 100% of our 2021 service levels and prepare for expansion. We are also upgrading our fleet and planning for a new operations contract managed by the city that is designed to incentivize significant improvements in performance indicators you've seen today. And with that, I'm happy to answer any questions.
Well, thank you. Thank you, and it's good to see you both. I just saw you on the Zoom from the conference we went to Miami. They have it on Zoom right now. I have one question about safety. I've been hearing from our partners that they're having a bit of a challenge around safety on the buses. What do you see that's happening?
See, what we've seen with our peers, a primary concern is as you continue to provide fare-free service, is sometimes people utilizing the buses just as a shelter and just increase traffic because it is free, and sometimes you see some more incidents than normal. I think we've kind of curbed that with our coordination with the law enforcement, both Durham County Sheriffs and Durham City Police, to address some of the incidents we see at bus stops, but also on board. And then just having sound policies when it comes to when someone has to get off the bus, and utilizing our other, our community safety program in the city of Durham to assist us in when people are staying on the bus and they don't need to be, but providing them with other alternatives for shelter and mental health support.
Okay, great, thank you. Thank you. Commissioners, questions, comments? Commissioner Jacobs?
Thank you. I like the way you structured this, Ellen, with everybody presenting together. Thank you so much. It's really helpful. I was wondering if we could get follow-up information about the Fayetteville and the Holloway transit corridors, like a more, just, sending it to us, like more detail, the budget and exactly, what the plans are for those projects, what are the planned, outcomes and all that, so that we could get that. And also, I assume the city has an adopted annual transportation plan and budget. I guess, what do you all do annually? Or, I'm just thinking, we have our county transit plan and the annual work program. Is there some equivalent information that you could share with us?
I will say we do not have the equivalent transit plan, but we do go through extensive transportation planning efforts to identify projects that are in need of capital improvement, in need of operational improvements, and we follow the city's capital improvement program, which we submit projects to the city manager's budget for consideration that helps us keep the work moving. It's not as extensive as the transit plan, but we do find opportunities to focus on certain areas like the bike walk plan that gives us information about the areas where there are sidewalk gaps or need for sidewalk improvement, as well as some other bike planning efforts where we're getting an opportunity to engage with the public and have their input heard and implemented in some way with our transit plan and also, I'm sorry, with our our plans and then moving forward from there. Regarding the TECs, we're happy to provide more information. We're still happy to be working with the county transportation director to work through the elements that are included in, that came out of the recommendations from the planning phase. So we're happy to, as we progress on that, to come back if Ellen agrees to provide some more information.
Okay. So the city doesn't have like an adopted transportation plan or an annual work program or a budget?
Yes, there actually is one large piece of guidance, and this is done primarily with our partners at Go Triangle, since they handle a lot of the planning activities. We have what's called a short-range transit plan.
Okay.
The last one was adopted in 2019, and if I'm correct, we have our kickoff meeting this week. So that will guide, it's basically the next 5 years of where the Go Durham service is going. So a lot of that is looking at existing routes, reconfiguration. We're also, Go Triangle sponsored a bus stop optimization study, which also looks at all the bus stops across the system and how to make our system more efficient by how we do bus stop spacing, making sure they're equitable, making sure they're safe and accessible. So those plans actually go into kind of what we develop for the city budget and how that drives the process for annual budget.
Anything you can share with us would be great.
Sure.
And then I know you all, it's fantastic about updating the Durham station. It really needs to be done. I was curious, and I know you've already got a design, but had you all considered incorporating affordable housing into that site and, over where the buses are and doing more of doing that as such a prime location there?
Prime location, but it's not included in this design work and construction work. But always looking for opportunities to improve what we call the front porch to Durham, with building of the Durham station and the new canopy ideas. So willing to explore.
Okay, affordable housing would make a nice canopy. I went to the Revolution conference in Vancouver and went to see where they had a huge bus station with affordable housing on top of it, and people could just get out of bed and go down and get on the bus. But it was really, really great. And then I was going to ask, what kind of changes will we expect to see now with the city taking over administration of the buses? What will that look like? And also, what are the plans around being fare-free?
Well, I'll definitely speak to under a new contract. We're actually in active procurement. We're currently evaluating proposals as we speak, with the hope of we issue a notification of intent to award, but no later than March 20th. And I think the one thing that's really going to bring to this is an improvement in kind of trimming down the layers and making it very clear of how your oversight, your administration, and your operations occurs. I think bringing in more corporate support from a transit provider to help with HR matters, especially with hiring and recruiting, is going to be crucial. And with these national companies that are out there, there are a lot of activities they're doing right now that will really help us there. There's also a lot that we'll gain on the safety end, maintenance, being more efficient there. And then more importantly, we're actually including certain things in this contract to be more specific to our Durham County residents. One is marketing and customer outreach will be part of the contract. And the second is actually our bus stop amenity maintenance. It's one thing where it's been a frustration for me over the years is seeing how many trash cans are overflowing at bus stops, what we hear from our customers. We've actually established a clear accountability for our contractor of 3 different tiers of bus stops that we have and expectations for keeping those stops clean and maintaining shelters.
Are there any other questions? Because we have 2 minutes.
Sorry, there was one additional question about the fare free.
You got 1 minute to answer her?
1 minute to answer it, yes.
Okay.
That we're currently in budget season, and the council just met last week with to pull the proposals together. It is a commitment by our council to continue with fare free, but we will have to wait for the city manager's budget for that final decision.
I just wanted to express how much I enjoyed your presentation and reading it. I think you have great key performance indicators, and the data that you collect is really interesting. And clearly, you try to respond when you're below your targets, and that's fantastic. Congratulations on the grant funding for the new center improvements. And I think it's amazing that we have the second highest ridership also in the state, and the leader with the passengers per hour. Is there any way, if I were trying to distinguish transit services in Durham that were funded by the city, like through legacy dollars, I heard that phrase today and I liked it, versus, new investments with transit tax revenue, where would I go? I bet you guys presented it to us, and I'm sorry that I don't know where it is.
There will be information published when this annual report is published to the Go Durham website, and we'll obviously share that. But also with the transit tracker that will come about, that's going to be, those same performance indicators will be available just for the expanded service. So you can clearly see what we've done with expansion, what has been legacy.
Okay, so it's not in the report somewhere, right?
There's not an existing report, but we can produce it if needed.
Well, okay, sounds good. Thank you. And welcome to our friends from the city back there. It's nice to see our partners.
All right, thank you so much. And Ellen, this has been... I can't hear you.
In the draft transit plan that's going to be brought forward for approval, the amount of funding from the transit plan that goes to Go Durham over the next 6 years will increase 5 times what it is today. So it's a tremendous improvement, investment in Go Durham services in the next few years, if we can hire the bus drivers.
Thank you so much. Thank you. And Ellen, this has been a long presentation for you. Thank you for all the work that you do. It's a lot. That's a lot today. Yeah. All right, we have one more. She just went to go get some water. How you doing? Yeah, I need some water. me. We in the ninth inning, y'all. This is the World Series. I'm counting on you too.
I'm serious. So,
Bring it on home.
we got one more to go here, and this is 230093. This is update potential joint partnership with the City of Durham on affordable housing initiative. So, Claudia, and introduce your folks, and let's get going.
Good afternoon, board members. I'm here to share some updates on potential partnerships with the City of Durham as it relates to housing projects. I have with me our colleague Reginald Johnson with the City of Durham and their Community Development Office, and Hebron, of course, and also we have city colleagues Bertha Johnson and Keith Chadwell, also with us today. And so we'll get started real quickly. We'll present some information about the city's RFP process that happened last year, and which brings us to the point of considering joint partnership and some ARPA fund usage. We'll also talk some about permanent supportive housing, and we're looking into potential partnerships in that space as well, and share next steps in coming back with the board and updates. I always show this slide where there are priorities and how funds can be used. With ARPA, will not go into all of them, but for our public, I always like to include those, and we will also highlight the plan that the board adopted almost a year ago. And we've been moving through that process with allocation of funds. We will, in our April meeting, have a reconciliation period where we will go through what we funded, what we've have left to fund, and get some direction as well on those items. We come to you again with some potential joint city-county affordable housing projects, and we have partnered with the city throughout this whole process since 2021 with joint conversations with our residents as we have explored projects through their RFP process, looked to see if we could partner in interlocal agreements on areas. And one area throughout this whole COVID environment has been how we handle housing, whether it is affordable housing, transit housing, housing for our homeless community. And we've also looked and partnered with the emergency rental assistance program as well. So our partnerships have been ongoing. There was I will shift to Mr. Johnson in a moment. There was a conversation with the board back in November, and we recommended to the board that we consider moving forward with some exploration of projects for shovel-ready projects that the city had already done an RFP with. You asked that we sort of go back, explored some, and our partners in engineering, Jay Gibson, as well as Perry Manns, looked at the projects as well as some others, and we suggested that we move forward with having the board consider it further. And so with that, I'll turn over to Mr. Johnson to share further.
Thank you, Claudia. And it's always good to be over across the street, I would say, to visit with you all. Again, I'm Reginald Johnson, Director of the Department of Community Development for the City of Durham, and I'm joined by Keith Chadwell, Deputy City Manager, and Bertha Johnson, Deputy City Manager. And a couple of things that I wanted to say before I get started. I wanted to thank you all for your indulgence and consideration in considering partnering on these projects for much needed affordable housing in our community. I just want to say thank you for taking the time to consider. I know we have details and all that, those sorts of things to be worked out, but nonetheless, we appreciate the consideration. What I want to do in my brief time here is to share just a little bit about the multifamily request for proposal process, so you have some grounding in that, and then to talk about the schedule, then the results of our RFP process, what was funded and what was not funded, and then talk about the project status and the requested information that we have ongoing now as we're vetting these projects again. So we had a request for a proposal. I'm not going to go through all of these bullet points, but just to give you overview, we anticipated having at least $15 million for multifamily rental projects. The sources of funding for the city included dedicated housing fund. If you recall, that's the 2 cents on the tax rate that the city council has dedicated to affordable housing. Funds from our affordable housing bond that the voters voted on and approved. And then we also would include home funding, that's U.S. Department of Housing and Urban Development funding, or a combination of the funding, depending upon how the projects presented themselves in the process, going through the process. We reserve the right to move funding from this RFP in order to fund projects that most align with the city's priorities. The city reserved the right to fund additional proposals above the $15 million stated if the qualified responses were received. And the use of city funds, and this is a key point, were to be used for new construction, property acquisition, property rehabilitation, refinancing to a lower debt burden in order to enhance affordability, and then existing restricted low-income housing tax credit projects, LIHTC, that are seeking to extend the period of affordability. And that's the proposal process. These are the dates that, just so you have in your, for your information, that we issued the RFP in December of 2021. And the proposals were due in February of 2022. We did evaluation and underwriting of the proposals completed in March of 2022. And the council approval was April 2022, and anticipated commitments started in May of 2022. These are the projects, that recommendations that we had with intent to award. The four in yellow are the ones we actually funded. It actually totaled $16.7 million that we were able to look at. Of course, that goes above the $15 million. One of the things we wanted to do was to, of course, fund whole projects in terms of the requested gaps. That's how we got to the 16.7. But we have JFK Towers, Fairhaven Walk, Cedar Trace, Sandy Ridge Station, and all those four projects totaling $16.7 million will produce 682 units at an average cost of $24,611 a unit. We had received additional proposals, but we were not able to fund those proposals. These included the ones listed in the green, Dearborn Family, East Gear Street, Sandy Ridge Villas, and 902 South Briggs Street, with Durham Technical Community College. You can see there the amount that the requested subsidy amount, and you see that the part that we didn't have to fund was about $21 million at that time.
Reginald, I have a quick question on that slide.
Yes.
When it says per unit cost, that's not the cost to actually construct the unit. That's just the cost, the subsidy.
Subsidy, that's correct.
Okay, because there's no unit that costs
no,
today
no.
$8,000. We wish, right?
That's correct.
Yeah, I just want to clarify that. That's the price unit cost is just the subsidy, not actually how much it costs to build something new. Okay, thank you.
Absolutely. So the project status of the four recommended developments, you can see Cedar Trace closing March of 2023 this month, Fairhaven Walk closing December of 2023, JFK Towers closed in February of 2023, and Sandy Ridge Station closed in March of 2023. So again, I think you are familiar with this slide that I just shared, the information. The important piece is after we started having conversations about the possible partnership, what we needed to do is to request additional information from each of the projects that we did not fund. We have been talked with each of the developers and had conversations with them. This is a list of the information that they are providing and have provided to us that we are in the process of reviewing as it comes in. All of them we received positive responses, but might be mindful that the information we had in our files was almost a year old. And so we're asking them to basically update the information to make sure, to see what's current, what has happened in the interim. Some projects have moved on to other to keep in this environment, keep trying to make progress. Some have, kind of stood still or moved slower. But as you can see, particularly of the documents requested, information requested, we needed evidence of site control, standard site plan, site survey, and elevations. The most important thing is the detailed project schedule, although in this particular case, all of these projects, we're not concerned about the time frame and matching with the ARPA time frame. They'll all be able to meet that with no problem. Of course, project sources and uses, and then the 20-year, 20-year pro forma, and then cost estimates from their sources, including cost per eligible unit and cost per square foot, that type of information. And then whether they did any changes to their market study. And then what we do is analyze that information, and we're working with them, and we'll hope to finalize and revise the number that we had from a year ago, and be able to share that with you. But we're still doing some analysis. But like I said, they're all providing the information and good partners about it. And so we should be able to conclude that shortly.
Mr. Johnson, we've got 4 projects here. You're asking us to partner on 2. Is that correct? Rather than all 4?
So this is, from our standpoint, all 4.
That's not what I heard from the mayor. It's supposed to be 2. So would you clarify that for the record?
And I've had conversations with Manager Page as well, and I think there are certain members of the city council that have gone back and said they would like to fund some of the additional projects if possible. So Manager Page said that she's asking staff to go back and look at, and I think those projects were ranked.
Yes,
right?
yes, ma'am, they are in ranked order.
Right, and so those top 2 projects, I think Manager Page said that they are looking at, or will make a request for council to fund those 2 projects as well. But I don't think that has been, vote has occurred.
Well, because I talked to the mayor this morning, and she said there were 2 projects, not all 4. So there needs to be some clarity, is what it is that you're asking of us, because if the mayor says 2 and then you tell us it's 4, what is it?
And perhaps you all haven't been privy to those conversations yet. Like I said, apparently the chair has spoken with the mayor, and Manager Page and I had a conversation about it as well. So I think you all are going to be asked to submit those first 2 projects back to the council for consideration.
All right, well, I appreciate your sharing that. I just, the information that we provided, that we were looking at a $10 million partnership with both entities, and when we look at that and we look at what an amount of projects we have, that's how we come up with the 4.
It's an evolving process.
Yeah.
There's only thing that I would add, that from our perspective and going through this RFP process, this is a ranked process, and it's still ranked.
Yeah, are you using the money that you have to use by the end of March?
We're using, my understanding that from the city is using this ARP funds as well,
Yeah.
just as the county is considering. And the council did make a decision to do that in the amount of at least $10 million.
Yeah, I mean, we definitely, the county definitely want to partner with the mayor, with the city. I think there's just a little bit of confusion about what we're partnering on. If we could just get some clarity around that, I'd appreciate it. Did you raise your hand?
No question. Thank you so much. Really appreciate your work and your willingness to partner with us around one of our community's most important and pressing challenges, the need for more affordable units. Of these 8 projects, what AMI would they be affordable for?
Generally, they're at 60% and below.
60% and below. Even the one at Briggs Avenue, same?
That one may have, I'm trying to remember if I'll have to check my notes, may have some combination with it going up to 80. But we'd have to check that. But one of the things that we have to go back and look at, they have to provide specific numbers of units at particular AMI levels.
Okay, that would be interested in that.
Yes.
Yeah. That's the RFP information?
That is a requirement of the RFP.
Gotcha. Okay, well, that'll be interesting to see. And how about the length of restricted affordability, length of time that it's restricted?
30 years.
Wow, good. All right, that's all for now. Thanks.
All right. Commissioner Jacobs?
I'm just really excited about the partnership. I mean, just before, we're talking about transit and all of us working together. And now we're here talking about housing and, the community resident survey that we just got back, and our community's telling us they want us to invest in housing. That's one of the priorities. And thanks to the ARPA money, we have the ability to do that now. It's really a once-in-a-generation opportunity that we have, and I appreciate each of us using our expertise and sharing that, and the process that you all have gone through looks like a really great process. You've done your due diligence, and I'm glad that we can partner on that. And in our ARPA money, we're funding some Durham Parks and Recs program. I think it was like $1 million or something like that. What was it? I remember the amount.
It's not $1 million. It was closer.
How much was it?
It was closer to a couple hundred thousand.
Yeah. Oh, okay. I'm exaggerating.
You're mixing.
I apologize, but
you're mixing stuff here.
Okay, but we're supporting some Parks and Rec stuff, and you guys are supporting some transitional housing for reentry. So this is great, and I'm all for you all coming back and whatever you recommend for us. Thank you.
Thank you.
Okay. Commissioner Burns?
Oh, wow. So his is really loud. Let me memorize the serial number on this one. Mine died. One, thank you so much to our partners from the city. I do remember when Deputy Manager Hager and Manager Sowell bought these to us. I remember it could change, but again, my recollection was 4 and 10 million. And then when I talked to some folks at the city council, so I think for me, one of the things that I'm probably most excited about, and Claudia, we talked about this, is that the ARPA funding, the document that we came up with, it is a living document. We can make changes. We saw offsets that we were able to get from the state in the great grant. And so we're in a position now to make the investment that we need to make in affordable housing that we might not be making in broadband or in some other spaces. I love the creativity because we really can't do it by ourselves, right? Like we have no choice in a unique county like a Durham, not to work with the city on this. I think sometimes people, when they see so many houses going up, I always remind people when they ask me about the condos going up on Main Street, I remind them, hey, come 3 blocks up and you'll see 300 and 500 East Main. And, you know, you say, you say it for a couple of years and people say, okay, what do I get this time? This is, because that was 2 years ago, that was the last board. And so now we are in a position to give something to them. Here it is 3 years later. So I will be voting in the affirmative for this. And I think somebody else already asked my question about the subsidies for the housing, but the fact that we can do, I think 4 of them, it was 24,000, another was 33,000. Like, that is the subsidy that we're providing for this housing. So we get to walk out of here today, and while there might be somebody else who's approving 200 houses that'll cost $1 million, we just worked together to approve 1,187 units. And I just think that that's a good day's work. So thank you to the staff that came today. And I'm just happy to say that, you know, we're building back better here in Durham. And I can't wait to tour those 1,200 spaces.
The original ask was that the county contribute $10 million so that all 4 projects could move forward. And as a reminder for the board, counties are limited in how they can invest in housing efforts. The federal dollars offer an opportunity that allow us to actually do this particular partnership. And so that was another advantage, and we talked about that some at the strategic retreat back in November. And that's why we wanted to leverage the partnership so that we could do it in a major way. And yeah, sure. Yeah. Sure. Yes, ma'am. And so we'll follow up on that because it may have been that they were going to do the first 2 and we do the second 2. I know there's just a desire to create that capacity with the shortfall. So we'll firm that up and circle back quickly to the board. Yes, absolutely. Okay, I have one other quick item that we're also having some conversations about, and it's permanent supportive housing. We have about 3 slides, and Gudrun will sort of walk through that. You're going to have the conversation later. We're just going to tee up another partnership that we're working on.
Thank you. It will be very brief. This is just kind of just like Ellen combined all the transit. Here is affordable housing, and then there is a nuance that permanent supportive housing, you heard from Ann and from Alliance earlier, and this is permanent supportive housing is permanent housing, but it has housing assistance and then supportive services that are provided to people with disabilities. And disabilities are defined not only physical disabilities or IDD, but it can also be behavioral health is also considered disabilities. So what we have found is individuals that are placed in affordable housing often cannot sustain or stay successful in this housing because they don't have the wraparound support services that they need to be really successful in independent housing. So there are different types of permanent supportive housing, single sites, scattered sites, there are tenant-based and project-based, and it explains all of this. And in your agenda item, you actually have a very good report that was done, I think, on behalf of Reginald's department, back in 2019 that looked very much deeper into permanent supportive housing, and then also defined the need and what we have now and what the capacity, what the anticipated need is, and that was 2019. We're 4 years in. It probably the need for 1,100 units plus is probably significantly higher now. There are permanent supportive housing. The best practice says you should have a mix of different models. You should have the scattered site as well as, so basically a campus and then individual units. There should be well-trained staff, and then the key is the collaboration of services and the on-site services primarily, so individuals don't have to go to each individual service provider, but services are right there on-site and easily accessible. Here is the report I mentioned, and then here is the current inventory of permanent supportive housing. And this is kind of 355. I just mentioned the report in 2019 mentioned 1,100 plus units needed. So we already have a significant deficit. What you see here is a lot of them mention BASH. Did I say this correctly? So this is, half of these 355 units are for veterans only. So the universe already shrinks even more. So we probably have 150, 170 units for individuals that are not veterans in Durham County. And the need is so much greater than that. We all know that. So we will come back to you with an idea, a proposal, and for a discussion in the very near future. And here is one model. This is coming out of Charlotte. They have had this for quite some time. And if you have a little bit of time, there is a great summary in there that talks about the cost savings that this project created in just the first year. So, and this is a partnership. I think Alliance is involved with them as well now. So Urban Ministry, UNC Charlotte, and then Alliance and many other partners. So yes, and I believe Wake County is also embarking on a permanent supportive housing campus model that we are quite jealous of. Yes, ma'am.
This last slide, this just stated that we wanted to get the board's appetite for this, and it sounds like we need to get some clarification. But we'll come back to the board either at the 27th meeting or in April, and also address some additional areas.
I did have one really quick one. I just want to put a bow on something. We had a presentation this morning where somebody said that housing is healthcare, and Gudrun just hit it on the head perfectly with this Moore Place. If you all do get a chance, I did look at the document, and the 80-some individuals that were able to go into this space in Charlotte, their average emergency room bill was $40,000. After being placed in this space, it was $12,000. So we can actually see that, you know, we get better determinants of healthcare, and it's a million little nuggets like that in there. So thank y'all for bringing this to us, and I hope it's something that we can come back with, because we do have chronically homeless people here in Durham.
Oh my God. Okay, this one is good. I know we didn't have time for commissioner comments, but there is one time-sensitive issue that is really, really on my mind, Madam Manager. If at some point we can have our staff come and talk to us about our plan around the freight that comes through Durham, through the railroad that comes through Durham. Now we just had a second Norfolk Southern accident, and so it's something that I think we really, I'm sure that our emergency management is already looking at, but I think it would really be good to hear what our plan is, what are our plans to strengthen our safety. But that's just something that I've been thinking a lot about. Thank you.
They could.
Move to adjourn. We're adjourned. Well, good job, everybody. We got through a lot of important topics.